All right, everybody. We don't need to get behind to start with.
Thank y'all for being here for day 2 of the joint meetings on the FY27 budget and FY26 amended. We're going to ask our good farmer, Senator Goodman, if he doesn't mind starting us off with a prayer.
Better put my phone on silent before we start praying. Thank you, Mr. Chairman. Y'all, if you will, please pray with me. Dear Heavenly Father, we just thank you for today, Lord. We thank you for loving us. We thank you for the gift of salvation. Lord, we thank you for the opportunity to be able to come here today, Lord, and decide how to allocate not only the resources of the people of the state of Georgia, Lord, but your resources, Lord. And we know that we live in a world of limited resources, and it's our job to try to allocate those resources to get the best outcome on behalf of the people of Georgia, Lord. And as we deliberate, we just ask for your hand and your guidance as we go about making decisions, Lord, that affect all Georgians. And Lord, we thank you for the opportunity. In Jesus' name we pray. Amen.
First up, I believe, is Commissioner Tanner from the Department of Behavioral Health and Developmental Disabilities. Commissioner, welcome to the joint meeting, and the floor is yours.
Thank you, Mr. Chairman. I appreciate the opportunity to be here as always. I want to just thank Chairman Tillery, Chairman Hatchett, members of the committee. Thank you for your leadership and your continued commitment to some of our most vulnerable citizens. When I stood here last year in 2025, DBHDD took meaningful steps toward a stronger, more responsive system that meets people where they are and delivers results in communities statewide. Today, before I walk through each budget item, I want to begin with 3 major priorities that are included in the governor's budget proposals. The numbers you'll see today are tied directly to fiscal responsibility, performance, and accountability and results. I think I may have hit the... All right. So I want to begin today with a couple of important announcements. One, I want to remind you that happened right after session last year, and that was in May 22nd of 2025. The federal court released DBHDD from a consent order provisions relating to deaf services. That was called the Belton Agreement, and that happened in May of last year. The federal judge, Judge Story, noted that DBHDD has met and in some cases exceeded requirements of the October 2014 consent agreement. So that was a consent agreement that had been in place for a number of years that we were released from last year. The state entered into the original DOJ settlement agreement that we all talk about on a regular basis in 2010. For the last 16 years, the state has made significant and deliberate investments to dramatically increase both the quantity and the quality of services statewide. For those of you who've been here for a while, the 2 chairmen, others in the room, I see Chair Lady Dempsey here. You all have been engaged in this work. Chair Lady Kirkpatrick for a long, long time. I am really happy to stand here today and tell you that at 8:04 p.m. last night, a joint motion was filed with the consent of the U.S. Department of Justice and the independent reviewer, releasing us from every single provision in the Behavioral Health Settlement Agreement and its extension. The filing reflects the progress we've made as a team and the confidence of all the parties that Georgia has met its obligation. If the judge grants this motion, it will be the first time in 16 years that the state has been released from the provisions of this agreement. In the total, the state will be released from about 60 provisions. We'll still be under the developmental disability side, and we're going to be laser focused on that. Bottom line, we're being released from all the behavioral health side of the agreement, free from all active monitoring. The 60 behavioral health provisions will be replaced with a single requirement that we house 537 additional individuals in supportive housing. These will need to be provided through 404 Georgia housing vouchers and 133 supportive housing vouchers. Supporting that 133, we're going to be leveraging our partnership with DCA. I want to give a shout out to Commissioner Nunn. He's been a great partner in this work over the last 3 years with me. Our department has embedded 2 DBHDD funded positions within DCA, and they are working solely on our population, and we're able to get people housed through the Choice Voucher Program, which leverages federal dollars. Governor Kemp's budget proposal that you're going to see today includes an additional $9.3 million for the 404 new housing vouchers. This is not just about housing. This will allow us to keep these individuals stabilized with wraparound services. With those 404 new vouchers and with the work that we're doing with DCA, that will fully cover the cost of the 537 additional individuals that we're going to be obligated to house within the next 3 years. And I will tell you, as I stand here today, I am laser focused on getting that done before Governor Kemp leaves office at the end of this year. This progress would not be possible without the leadership of Governor Kemp and the sustained investment of the House and Senate. I am grateful today for every dollar you have committed to strengthening Georgia's behavioral health system. The IDD division is also making historic strides with individuals with intellectual and developmental disabilities that will allow them to live more independently and with dignity in the most integrated settings. On the screen there is a summary about our now comp waivers. Let me make sure I can get there. Yeah. So we have enrolled 4,405 people that are enrolled in now comp services as of June of last year. We have 9,709 individuals, 89 individuals enrolled in comp services, and we currently have 7,891 individuals on the planning list. I'm also happy to announce that at the request of the Senate Appropriations Committee, there was a DOAS audit done of our now comp waiver work. This review has been completed, and most importantly, there were no instances of deficiencies or noncompliance. As it stated on page 4, the results confirm that DBHDD's administration and oversight of the now comp waivers operate at the highest standards and expectations. I want to thank our Executive Director of our DD Division, Ron Wakefield, Ashley Caseman, our Director of Medicaid Coordination, and the Region Office team, and Chris Hamilton, our CFO, for all their hard work to be able to get this clean audit. And folks who know the DOAS audit process knows that's extremely unusual. One of my priorities is to work directly with policy experts, advocacy leaders, and families to ensure we are moving these programs in the right direction. We recently announced that we are preparing to complete an overhaul of the now comp waiver assessment tool and planning list, which will enable the department to better respond to the urgent needs of individuals on the planning list and better forecast future needs. The problem that is the determination of need is not great at identifying urgency and helping the state plan ahead instead of reacting to those in crisis. The solution is a new assessment tool that will prioritize face-to-face home interviews with hybrid options and focus on real living conditions. The urgency criteria will now be assessed using clear categories such as losing a caregiver, complex needs, unsafe or unstable housing, and gaps in services. The problem right now is just a single list with very different needs are included and does not clearly show when services are needed or hard to use, and it's hard to use for forecasting and budgeting. The solution is a new assessment tool. It will be broken out into 3 different categories. The first category is immediate list, people who are in need of services this fiscal year. The planning list, expected to need services in 1 to 5 years, and the forecasting list, likely to need services in 6+ years. The next step is to start the validation process for the new tool that has been developed, and then run every single person on the planning list through this new urgency tool. I also want to thank the House and Senate for passing Senate Bill 233 last session to launch the new IDD subcommittee on behavioral health, on the Behavioral Health and Reform and Innovation Commission. This subcommittee has been working diligently and has reaffirmed our work and the direction we're heading. We have this committee in place for another year, and we plan to continue this work. I also want to note that DBHDD is expanding now in comp waiver services that were approved by CMS last year. These services help place people with the most challenging needs in the right setting. This will keep people with IDD out of emergency rooms, out of hospitals, out of jails. Our crisis residential alternative settings are expanding. We opened 2 new CRAs in August of 2024 in the Augusta area. Each of those have 4 beds. We are preparing to open a 3rd home that's ready to go in Macon that will have 4 beds. We have 2 other CRA homes under construction in the Macon area that will have 4 beds each. We also have identified safety net providers in all 6 regions across the state, and we'll be building out additional homes over the next couple of years. These are the individuals who you all get calls about from constituents who are very challenging, very difficult to place, that are stuck many times in emergency rooms, oftentimes abandoned by a caregiver because of their frustration. So very difficult to find providers to take these individuals, so we're building out a new system that we're excited that we're going to see come to fruition over the next few years. I want to transition a little bit into an area that I know you get a lot of calls about from sheriffs, and that's individuals who are stuck in jails who need beds. In fiscal year 2025 alone, Georgia issued more than 2,500 adult pretrial evaluation orders and over 1,400 juvenile orders from different courts. Across Georgia, we are seeing a steady increase in the number of defendants found incompetent to stand trial. This means individuals whose mental health conditions prevent their cases from moving forward. In FY 2023, about 38% of defendants were found incompetent. In 24, that number rose to 40%. In 25, it rose to 42%. That growth has real consequences on our system. Nearly 70% of individuals waiting for pretrial evaluations are in local jails. Those who are found incompetent to stand trial are waiting on a hospital bed to open up. Today, we have over 800 individuals in jail waiting on forensic placement in one of our hospitals. This places an unfair burden on local jails to hold people who need treatment before justice can proceed. I've shared what's happening in local jails. Now I want to look at what's happening with our bed capacity in our hospitals. Our 2023 bed capacity study identified the need for 232 more hospital beds, but we recognized early that simply adding hospital beds was not the only solution. We projected to reach full capacity by fiscal year 2024. This isn't a possibility way off in the future. This is a trend, and that's what's happening right now, and it needs immediate focus. We admitted 395 individuals in FY 2025. 69% of all forensic legal statuses are typically discharged within 1 year. Current early data from FY 26 shows that 89% of all ISTs are discharged within that year. We're very proud of this because it highlights the good work that our short-term restoration program is doing within the hospitals. However, the remaining percentage, combined with the increasing number of long-term care, is what's driving our capacity challenging. Length of stay for all patients, regardless of legal status, is 3.8 years. Those that have been found not guilty by reason of insanity, their length of stay is 8 years, approximately. Now, I just want to remind you that many of these individuals have committed extremely serious crimes, but they've been determined not guilty by reason of insanity. So these individuals are not coming to the hospital for a short period of time and getting out. The courts oftentimes keep these individuals in our facilities for many, many years, possibly their entire life. That's why Georgia opened its first standalone jail restoration center in Dodge County 1 year ago this month. And I want to just give a shout out to Representative Mathis and to Senator Walker, because they brought this to us, brought this to our attention. It was a DJJ facility that was sitting in their district unused. We went in, worked with DJJ, got state properties to convert that building over to us. We renovated that. You all funded the operational cost, and since January, we have, of last year, 73 individuals have been admitted, 45 have already been discharged. The average time to restore competency has been just 74 days. That is the fastest we're able to restore competency at any facility we have in the system. That means fewer days in jail, fewer delays for victims, and less pressure on the courts. And just as important, it actually works. The individuals who are restored are returned to the court system so their cases can move forward. Those who need more intensive care can be identified quickly and early and be moved to one of our hospital settings. DBHDD has spent the last 2 years launching programs that reduce reliance on inpatient hospital beds. A lot of these individuals who have been at our hospital for a long time, who the courts are very reluctant to release, that our clinical staff believe are ready to go out into the community. So we opened up and you funded what's known as Operation New Hope. That was the state's hospital system first transitional program. We opened up our first in November of 2024. That was 30 beds at our Savannah Hospital campus for vocational and life skills training. We opened up 17 beds in January of 2025 at the Allen Building at Central State Hospital in Milledgeville, and you funded, and we currently have the finishing touches being placed on 30 beds at Columbus with a ribbon cutting scheduled for February of 2025, just a little over a month away. These step-down facilities offer a different solution for a different population. And we have already, in the short period of time, success stories. One individual that graduated from Operation New Hope was at Central State for more than 27 years. The court approved moving him to a community integration home after he completed our Operation New Hope program. In 2025, that program served 43 individuals and discharged 5 into the community. Most importantly, though, that's 43 additional inpatient beds that we were able to open up to be able to use to move people out of jails into the hospital. One individual discharged from Central State into a community integration home was at the hospital for nearly 4 years. Most important lesson here is that where competency restoration happens does matter. What's next? I'm thankful that the governor in the GSFIC budget has proposed putting $20.7 million to build an additional jail-based restoration facility on our Augusta Hospital campus. This would, again, be 40 beds. It would be on some property that the state already owns in Augusta. We have workforce availability in this area, which is really a big factor for us in deciding where to locate facilities, is we have to be able to have a clinical workforce. We have that in our Augusta area. It also will have a regional impact on East Georgia and surrounding counties, bringing jobs to that area. This investment will allow us to expand our forensic capacity without consuming our hospital beds. It reduces wait times in jails, and it strengthens our public safety across the state. And again, this is not a new idea. This is a proven model that we've been able to prove at our Dodge facility. This facility does not eliminate our need for additional inpatient beds. The only long-term solution is to build a new hospital on one of our existing campuses. Also, again, going back to the release of our the state from the 60 provisions in the DOJ settlement agreement, and the overall that we had, how we administer the now comp waiver and building on our competency restoration are all priorities that's found in the governor's budget. So with these things in mind, I want to walk you through line by line the recommendations in the governor's budget to the General Assembly. First, you have statewide adjustments. You have $21,603,202 to increase funds to provide one-time salary supplements. Again, you'll be seeing this in every state budget. Addictive disease, this is a reduction of $142,919 to replace general funds with other funds for the expansion of hepatitis C screening services at core behavioral health providers. The addition of $243,750 restore some of the funds that were removed last year from the Cobb jail-based restoration facility. I just want to remind the committee that Cobb services more than just Cobb inmates. We take inmates from all over the state into that facility, including rural counties such as Effingham, Lowndes, and Pickens County. So in all total, we've served more than 30 counties at that facility, and that facility has admitted over 82 people from these 30 counties to be restored to competency, and their restoration rates are in line with what we would expect. Again, capital funding in the GSFIC budget that you'll see for $20,740,730 to build a 40-bed standalone forensic facility at the Augusta campus. That design is underway now. Our hope is that we can get that open around November of next year and be able to add those additional 40 beds to our capacity quickly. Also, you see GTA adjustment of $84,779 just to reflect an adjustment in the telecommunications infrastructure rates that GTA charges. Again, things you'll see in every budget. You also, the SHBP reduction of just over $45 million, again, because of the rate drop from 29.454 to 20.264. A big portion of these dollars are CSB dollars because their rate will also be decreased. The TRS rate change, again, from 21.91% down to up to 22.32. That's an increase of $21,733. The insurance premium adjustment for DOAS, just over $1.9 million, and then the adjustment for Georgia at Work billings program of just over $218,000. Again, most all of these are statewide adjustments that are going to be common throughout your budget presentations. Here you'll see a replacement of $142,919, replacing general funds with other funds, and then the $50,000 there is eliminate one-time funds that was in the budget for Hope House. Adult developmental disabilities, last year the General Assembly funded us 150 additional now comp waivers. Those, as you know, have to be annualized the following year. This $3.2 million was the dollar amount needed to annualize those 150 waivers. Our adult developmental disabilities, again, now comp, the governor has proposed 100 additional now comp waivers. That's just a reminder, we have just over 14,000 individuals who currently receive services. We have just under 7,900 individuals who are on the planning list that we talked about earlier. And just to give you some frame of reference here, we're on track to enroll more people this fiscal year, than we have ever enrolled. We're on track to enroll a total of 1,000 new now comp waiver participants. Our regional offices really stepped up efficiency. We have between 500 and 600 or so people roll off waiver services every year because of death or moving out of state, et cetera. So with 100 new waivers, we typically can enroll between 500 and 600 new folks on an annual basis. We also, when we have folks roll off of waiver services, they're usually rolling off at the very highest cost level, and then new people coming on are typically less expensive for the state. So sometimes we can get more than one person enrolled when someone rolls off. And then also $2.89 million reduction to reflect adjustment in the federal medical assistance percentage from 66.4 down to 66.63. Adult forensic services, this is the annualized, the facility I just mentioned to you that's under construction at Columbus. This is 6 months of funding, $1.6 million to annualize that. And then I already mentioned the dollars to restore to the Cobb County facility. $2.3 million to increase funds for new mobile crisis RFP. As you know, when someone calls 988, we're able to dispatch mobile crisis anywhere in the state of Georgia 24 hours a day. That includes a licensed clinician. That had not been rebid for a number of years. That has been rebid by DOAS, and this is the number that would reflect the increase in that cost. The $2.9 million is increased funds to support health crisis intervention services through the 988 Lifeline. This would be to maintain 97 critical positions within the 988 system that's going to be included in the governor's budget. Just as a reminder, studies show that $1 spent on crisis care can save between $2 and $3 in hospital cost. Also in 2025, crisis referrals on our platform supported over 50,000 referrals to crisis beds, averaging 4,200 folks going to crisis beds per month. Total volume in 2025 at our Georgia call center, we received over 350,000 interactions through call, text, and chat. We're currently averaging around just over 1,000 calls, text, and chat per day into Georgia, into our 988 system. So Georgians obviously need this service, and they're utilizing this service. Adult mental health here, that you see the $9.3 million. That's to add the additional 404 housing vouchers for the settlement agreement that we talked about, and then a reduction of $326,481 for the federal medical assistance percentage from 66.4 to 66.63. and then $1.1 million increased annualized operational cost at Gateway. Most of you are familiar that we're building a new crisis and adolescent crisis center in the Savannah area. That's currently under construction. You all funded that. This would be the annualized number needed. It's anticipated to open this fall. It's under construction currently. So very excited about that facility opening up in the Savannah area on the coast. I'd also be remiss if I didn't just mention some of the great work that we're doing on the opioid crisis. As you know, I serve as a trustee of the Georgia Opioid Crisis Abatement Trust, which is a separate legal entity from DBHDD. We completed another grant cycle in 2025 and committed $42.48 million in grant funds to over 109 projects across the state. Almost everyone in this room has had a project completed in their community. This brings the combined total for 2 years to $111 million in grant funding. Also very excited about some of the work we're doing in partnership with other state agencies. We've partnered with the Department of Community Supervision and with other agencies around the state, and recently with the Department of Education. You all passed Wesley's Law with legislative intent for Narcan to be placed in every Georgia school, Senate Bill 395. We launched a partnership a few months ago with the Department of Education to put Narcan in over 2,300 public schools in the state. I want to give a shout out to DBHDD Office of Addictive Disease and Georgia Harm Reduction, along with all of our RESAs across the state that we partnered with. The first round of schools, which is about half the schools, was completed in November of 2025, and the balance of every school will receive their Narcan in the spring of this year. That includes a nice box, just like the one you have hanging here in the Capitol, with 2 boxes of Narcan gloves, etc. So really excited about that, and I know our schools are. Just want to remind you that we have a regional presence around the state with regional leadership and offices all across Georgia. We recognize the state's a lot bigger than just Atlanta. We have leadership across Georgia, and those are our regional office locations. So if we can be of service to any member of the General Assembly or a constituent, I know I hear from many of you on a regular basis, please don't hesitate to reach out to us. So thank you for allowing me, Mr. Chairman, to be here today. It's always good to appear before the Appropriations Committee and to be able to announce a release from a settlement agreement that has been going on for 16 years now. So with that, Mr. Chairman, I'll be glad to answer any questions.
Thank you, Commissioner. A lot of great information. Y'all doing a lot of great work. We all realize it and appreciate it. You do have some questions. Chairman Petrie.
Thank you, Mr. Chairman. And Commissioner, congratulations. Unbelievable accomplishment. And thanks to you, and thanks to some of the fine leaders you have here with you today, and some that aren't with you today. Y'all are doing great work. 30-something years ago, when I started serving people in the community, everybody was institutionalized. Whether they were developmentally disabled or whether they were frail seniors, they were in an institutional setting. We've come a long way, and we've done that by focusing Medicaid spending on improving the people Medicaid was built for and created for, the most vulnerable, the most frail. Thank you for doing that. There's one big challenge I want to ask you about, homelessness, and I know the governor's got making a real focus on homelessness now. And a lot of our communities, I mean, my primary constituent issues these days tend to revolve around homelessness and aggressive panhandling, et cetera. One of our challenges is having a place for local government, which is primarily responsible, to move those individuals to an endorsed location where they can have a more humane way to live. Can you tell us a little more about the governor's program as it relates to supporting local communities with homelessness?
Yeah, so I know the governor's creating a significant grant program to try to help fund local governments and help support them in their efforts focused on homelessness. And I think it's going to allow for some creativity from local communities to come up with their own individualized solutions. I will tell you that in working in this work and chairing the Behavioral Health Commission now since 2019 and being involved in government service now for actually this year's 36 years, government swings a pendulum from one side to the other, oftentimes on every issue. And we did that on the mental health side, which that we had too many people institutionalized. We know that. But there are some people who do need care in a hospital setting. And we just do not have the capacity in this state, as a growing state, that we need to give people the level of care they oftentimes need. So I think in order to help some of these individuals, I go back to parity, and I go back to, if someone's physically ill, sometimes you need to go to the doctor, sometimes you need to go to quick care, sometimes you need to go to the emergency room, sometimes you need to be in the hospital. It should be individualized with the goal of serving people in community, but sometimes people need a longer stay. And I think until we have that level of capacity, we're going to continue to have jails that are overcrowded with individuals with mental illness, and we're going to continue to have individuals who are homeless. So I'm excited about where we're heading. I think it has great potential, but I do think ultimately we're going to have to look at our capacity issues.
Chairman Watson.
Thank you, Mr. Chairman, and thank you for what you're doing.
Thank you.
What you are doing. Sort of piggybacking on the homeless issue, I used to say in talks that the worst place to receive mental health care was the jail, the local jail. And I tell you, my sheriff spoke up one time and said that's absolutely not true, because I have a mental health section, and we take care of people with mental health issues in their jails. Homelessness, they're on our public property, they're panhandling aggressively and so forth, so they do get picked up and go to jail. Tell me about what percentage, or do you know what percentage of sheriffs in the state have mental health capacity like the one in Chatham County?
I don't know offhand exactly what that looks like. I can tell you it's definitely a mixed bag across the state. You have a jail commander, Todd Friesman, there, who is just one of the best jail commanders in the state, and they've been laser focused on really taking care of their population in a way that we don't see oftentimes in other places. So they've done a tremendous job. We have other jails that do as well, but most just don't have the resources or haven't invested those resources in those communities. So it really varies around the state. And some sheriffs are just not open to that and don't feel like it's their responsibility. So it really depends on the community.
Thank you. Sounds like that's something we need to explore, maybe not with you, but with others also. Just a follow-up question, as the Cobb County facility takes care of those from around the state, just a reminder, there are three, if I remember correctly, three gateway child and adolescent facilities around the state, and the one in Savannah does not take care just of Savannah folks. It is a statewide facility.
That's correct. All the facilities we fund, whether it's crisis centers for children or crisis centers for adults, take folks from every community in the state. It's based on the need. We try to locate people in the geographical area where the need exists, so when they're released we can do good discharge planning, but you're correct. Gateway will take folks from the entire area.
Thank you.
Thank you.
Chair Lady Dempsey.
Good morning, Commissioner.
Good morning.
First of all, thank you so much. It sounds so easy to many people here, but I know how hard and how long you and the commissioners that have come before you and the staff and governors have all worked to help with this DOJ settlement.
Yeah.
We have reached a historic moment in time, I have no doubt. So thank you for that, particularly. When we look at several things that are going on, though, and I know like some of the messages that have already been, the questions that have already been asked, reference the need for longer-term congregate care. In the settlement, what is allowed there to return us to that challenge of some people who seriously do need not only long-term, but sometimes lifetime care?
Yeah. So there's nothing in the settlement agreement that prohibits us from providing individuals who need longer-term hospital stay the ability to have that. But the idea is we don't want to institutionalize anyone that doesn't need that level of care. So my focus is on individualized care. What level of care does the individual need at this particular time in their life, with the goal of moving that person to community. But you're right, there are some people who need longer term stays, and specifically our forensic population, you know, folks who have this constant contact with law enforcement, the criminal justice system. regardless of whether it's related, it's caused by the mental illness, or if it's caused by something, they still have the mental illness, they still need that treatment. So we're just going to have to, at some point, the state's going to have additional facilities, but there's nothing in the settlement agreement that prohibits that.
That's great news to hear. If I may, Mr. Chairman, one more question. So this interim, we did a study on children particularly that become stuck in our hospitals and in our psychiatric treatment centers, which is a very sad and difficult thing to walk through. I think we'll have some things to maybe address that soon, help it along at least. But I think each of us here have had those calls from our hospital. Not only is someone in the jail that needs services, but someone's in the hospital that has nowhere to go. They don't always need to go to jail, but they need care that our state is not able to give right now. I'd love to know what you think we can actually do to move that ball forward, to work particularly in a way that deals with prevention. The earlier, the better, the right time delivery of service for our youngest to make sure that they don't become that lifelong really challenge.
Right. Well, I appreciate you asking that question. I try to be careful what I say and how I say it, but I will say this about the child and adolescent space. I have providers. I had one come to my office last week from out of state that wanted to come to Georgia, and I talked to them about what type of child they wanted to serve. And I said, those are the children everybody wants to serve, right? I got to have providers that are going to serve those that no one else wants to serve, because those are the folks stuck in emergency rooms. Those are the folks that parents get so frustrated that they don't know what else to do with that child. And the state has had resources in the past, and some of those have been closed over the years. I personally am a firm believer that at some point the state needs to operate its own child and adolescent facility, PRTF, where no one's turned away, where we have the resources in place to serve these very challenging youth and then get them to step down. And we work closely with DJJ, with DCH, with DHS and others looking at that, and looking at this idea of a youth innovation campus where you could have a state-run PRTF, a Medicaid-funded PRTF on the same campus to step these children down to, but also home housing on the campus for the family, so you could work with the whole family with the idea of integrating that family back together as a unit. Because oftentimes what we see in these cases is the whole family needs services, not just the child. So there's going to have to be some investment, smart investment over time from the state in some of these areas, but there are some real solutions out there. But I will tell you, this is not easy, and no other state has solved that riddle either. They're all being faced with the same challenge. But currently, we just don't have providers that are willing to take the hardest challenged children in the state. And we did a study internally with all of our sister agencies looking at how many beds are we talking about, what's the capacity we're looking at. So we're happy to share that information with you or anyone else.
Thank you. I look forward to working with you on that, and we'll have more discussion Friday morning.
Looking forward to it.
Hearing. Thank you.
Thank you.
Okay, members, we've got 6 more questions, and we are ahead, so try to make your questions as succinct as possible and answers maybe to Chairman Tarvin.
Thank you, Mr. Chairman. While I'm making, did you say Tarvin?
Yes.
I'm sorry. Roll back 2 slides. I've got a question, but I want to, as you know, you and I have discussed the need for this mental health operation you're doing now, and we go back to decades probably that we were behind, and we go from the largest mental hospital in the world to where we were with very few beds, and it's very frustrating in our areas where we see, as you and I have talked, that our jails have people, and I think now we've got a lot of it down below a year, but you know, we were at 2 and 3 years, people that were there couldn't go to trial or hadn't been evaluated. So I'm pleased to see the overall picture. We see progress, and this is something that's very dear to my heart. But I got to get this off my mind here because my brain works different. Reduced funds to reflect adjustment. there on that 326,000. Explain that to me, if the percentage went up, how we had a reduction. That's what it caught my eye. Is that a...
The percentage that the feds are covering went up, so the other portion went down.
I understand.
Yes, sir.
Leader Hughley.
Thank you, Mr. Chairman. Thank you, Mr. Commissioner, for all your hard work. I have a couple questions. Number one, on your planning list, I guess that's what we used to call the waiting list, but on your planning list, for those who reach the immediate category, can you tell me how long they are waiting before they are integrated and have the services?
Yeah, so we currently don't have the planning list broken out that way. That's what we're moving toward. Right now, everyone's just lumped into the planning list, so we're not able to say to you, we have 50 people that need an immediate waiver or 500 people. That's what we're moving towards. So the tool that's been created, and I will say it's been a collaborative effort with the advocacy community, with everyone involved. So we're working to get one of our academic partners to validate the tool that's been created. Once that happens, we'll run everyone through that, and I'll be able to tell you specifically, this is how many people on the immediate list. Our internal folks have done some guesstimating on that. You know, we probably have out of the 7,800 around 1,000 people in the next fiscal year, maybe more, that would need waiver services if funding was available. But we're going to be able to give you a lot more concise answers over the next 12 months.
And also, for the people that are going to be in the New Hope step down, after they complete their time there, what supports do they have to make sure that they continue to thrive and be able to stay in community?
Yeah, so typically when they leave Operation New Hope, they'll step down in what we call a community integration home. That's a home where they live, and we have DBHDD staff that's in the home 24 hours a day with them. They go out to public jobs, et cetera. They typically have SSI, disability benefits at that point. And then from there, they can either step directly into community, or they can step into a forensic apartment where they live independently with a lease in their name with still wraparound supports. And then from there, they go into the care of our community service boards and community. So we step them down slowly so that they reintegrate into the community. Thank you.
Chair Lady Kirkpatrick.
Thank you, Mr. Chair, and thank you, Commissioner, for your great work. I'm so honored to work with you on the Behavioral Health Coordinating Council. We're doing good stuff, getting agencies to talk to each other.
That's right.
What a concept. The question that I have is, we know that a lot of our PRTFs are highly involved with out-of-state people who need services, and I don't know what the solution to that is, but we need those beds for our Georgia people. So I just wondered if you had any thoughts about that other than increasing our rates.
Well, and I will tell you, looking at some of the most recent data, that percentage has come down pretty significantly, and a lot of that has to do with the funding that you all provided with the new rates. So Georgia is now very competitive with other states, so we have saw that drop drastically. The challenge is if somebody needs a PRTF, I think we can typically find placement unless they're one of those hard to place individuals. And then sometimes we have to look out of state because we have locations out of state that's able to provide a lot higher level care that we can sometimes find in Georgia.
Chairman Hawkins.
Thank you, Mr. Chairman. Thank you for all you do.
Thank you.
Kevin. I really appreciate it. This question is related to general health. You serve so many young adults and children. What do you do for general health? I mean, I assume you access the ABD section of Medicaid, but could you talk about that a little bit, how that works?
So when individuals are in one of our state hospital facilities, we have internists that work in the hospital. We have dentists that work in the hospital, so we take care of the whole health while they're there. Obviously, if they need a higher level of care, we may have to take them out to a hospital outside of our facilities. In community, our part of what we're moving toward is the CCBHC model, which is a federal model that has more integrated health care. We have 3 of our community service boards, I believe, that just started that process in January as approved by CMS. They're going to be able to provide a more holistic whole health approach. We also partner with some of our FQHCs in community to provide some of that whole health services. But you're right. One of the challenges with an individual who has serious persistent mental illness is oftentimes they also don't take care of their physical health, which adds to their whole process.
Representative Al Williams. Oh, yeah.
Thank you, Mr. Chairman. Thank you, Commissioner.
Thank you.
Quick question. Is there anything in place through your office or any place else to train police and sheriffs in rural Georgia how to respond to a crisis with a person?
Yeah, I didn't plant this question, but it's a great question because at 1 o'clock today, we have the new reconstituted CIT board, which is the the crisis training that is 40 hours of post-credit, and it not just for law enforcement, but for the whole community. And we're going to be rolling that out through our regional offices in the spring. So we're opening that up to law enforcement all across the state, and we'll be providing the instruction, training, et cetera. And we have an advisory board made up of law enforcement professionals and other people with lived experience, et cetera, from all around the state. And we're meeting at 1 o'clock today. So that'll be rolled out, and it is great training. Yes.
Representative Bentley. Stinson.
No problem. Thank you, Mr. Chair. Thank you, Commissioner. Quick comment and a question. Just want to thank you and your team for coming down to Taylor County, helping me with the situation and educating our community. But you referenced Operation New Hope, $20 million for a new JRC in Augusta, 40-bed project. Senator Harbison and I have an empty facility in Taylor County. We just want to make sure that you're aware of. But you also referenced the workforce. That made a big difference in going to Augusta. So can you talk a little more about the workforce, exactly what you need from workforce? Because Senator Harbison and I want to make sure we let folks in Taylor County know about what's needed in case you all want to consider coming to Taylor County.
Yeah, another great question. So the facility we're doing at Augusta is going to be a jail-based restoration facility. It's different than Operation New Hope, but it's 40 beds. And it requires us to have nurses, psychologists, doctors, and those are very difficult to recruit to rural Georgia, as you all know, outside of some of our key cities. Workforce is our #1 biggest barrier to our agency in the state. The licensing process that I know many of you in the room have championed is still very challenging for clinicians, et cetera. I have a lady that works for me that's been licensed in Florida for 15 years as a licensed family and marriage counselor, still can't get a license in Georgia. So workforce is a challenge. We're creating a lot of partnerships. I was at Columbus the other day. We're getting ready to roll out a condensed 3-year medical school program for psychiatrists. They're going to go match with St. Francis Hospital, and then they have to come to work for us for 4 years after they finish as a psychiatrist. So we're trying to create programs, but it's just that we have to be realistic that when we're looking for doctors and psychiatrists and psychologists, very challenging to get those individuals for the amount the state pays to go to places other than some of our major cities.
Commissioner, you've talked about bed capacity on several of your slides and kind of even came up just then. You've had a plan out there for a large 300-bed hospital in the metro area. Can you just touch on that a little bit and tell us where that might be or what your plans are there?
Yeah, so we have a state hospital on Panthersville Road out next to the GBI headquarters here in DeKalb County. We had met with the DeKalb government to make sure they had the infrastructure, water and sewer, et cetera, available there, and they do. We have a place there that we've looked at with an architect and an engineer that we could build a new 300-bed facility on that campus. That's the most logical place to put it for a lot of reasons. Number one, that's the only hospital that serves the entire metro and North Georgia area, so the population just demands that service. Second thing is we also have a better opportunity to recruit professional staff there than we do anywhere else in the state. The second location for a future hospital would be on our Augusta Hospital campus. We have land there and we have land in Atlanta. So it is definitely something that the state needs to give serious consideration to, because in 2034, our prediction is we will have 0 hospital beds available, because if you look at the trend of how many people are getting ordered to us by the court to stay long-term, all of our beds will be full. So there'll be 0 places to bring individuals into the hospital. So, and it'll take 3 to 4 years to build a facility.
Thank you, Commissioner.
Following up a little bit on what Chairman Hatchett said, what's the cost of that?
Our estimate's between $450 and $480 million spread out over three to 4 years.
Gotcha. Congratulations on that coming out from underneath the settlement. I know that's something you and I have personally worked on for a long, long time. It's a big deal. Let me ask you about another one, opioids. You said we spent $111 million on grants. How much have we collected now in the opioid settlement cases?
I can send that to you.
You can ballpark it.
Yeah, it's probably about 150 or so million, but I'll send you a breakdown of exact. Now, we're over 18 years, we're going to collect 489 million will come into the trust from the manufacturers and distributors settlements. Those dollars come in over a period of 18 years. So I can send you, I have a breakdown at the office. I can email out to your office today that'll give you a breakdown of how much we received and what settlement agreement it came in from.
489 million, though? I thought we were almost double that.
For all the settlement agreements. Some of those are not going to flow through the trust, some are going to flow through the General Assembly, but I can give you a breakdown of all of that.
Some are going to flow through the General Assembly?
Correct. And I think there's something in the governor's budget looking at replacing some funding for a service.
Well, that's kind of where I was going next. I remember us having quite the debate about that, and I thought that bill got vetoed, of us having control of those funds. It was surprising to me that we now will. My understanding of that MAP program, though, is that it doesn't just treat opioid addictions. Are we able to use those funds for more than opioids? And as the trustee, do you think that that's about $25 million of state funds we don't have to use there? Are we able to use that for MAP?
So every settlement agreement's obviously drawn a little different. The manufacturers and distributors settlement agreement is specific to opioid related, and it has 5 categories that we're able to fund. I can't speak to some of the other settlement agreements. I wouldn't want to try to give an opinion on that. Just the ones that we're responsible for, we're real careful how we spend those dollars.
Gotcha. You feel comfortable, though, with the $25 million at MAP? Medicated treatment.
Yeah, I have, yes.
If you could tell me the dollars you feel comfortable on the other settlements that might be used that way, that'd be helpful as well.
Yeah, well, I can send you a detailed report this afternoon.
Thank you.
Yes, sir.
Thank you, Commissioner. We appreciate the job y'all do.
Thank you.
Oh, you got a question? No, I'm sorry.
Can you have your staff stand up back there? You got such a good-looking crew that works with you that many of us recognize. We sure appreciate what they do to keep you on the rails.
Thank you.
Next up is Dr. Burt with Department of Community Health. Is he here? Let me see. Dr. Burt. Hey, y'all let Dr. Burt come in, please. Let the man in and his entourage. All right, y'all. Dr. Burt, welcome. We were ahead until everybody started asking questions. I wonder if you're going to get all the questions too today, or maybe Commissioner Tanner took them all. The floor is yours.
Yeah. Well, thank you, Mr. Chairman. I was about to say the gavel is yours. You're in charge. So if you're tired of hearing me, you can just send me out the door, okay? Good morning, ladies and gentlemen, members of the committee, Chairman Hatchett, Chairman Tillery. First off, I want to thank my fellow health agency commissioners, Commissioner Tanner, Brose, and Dr. Toomey for the work that they do in conjunction with us and in partnership to try to continue to improve the health outcomes for the state of Georgia, and of course our partnership with you guys and the governor's office is what makes that happen. And just know that it's an honor and a privilege to be standing here and having the responsibility that we have as trying to manage these taxpayer dollars in the way that they'll do the most good for the most people. And again, that type of pressure and responsibility is something that our agency thrives on. And I again want to thank my team for their hard work. We've got a great team of people who work very hard every day, and as everyone here knows, especially the pay's not so good, and so they do it out of dedication. I want to thank them for their service. First thing I want to do is just make sure that you guys have an understanding of what we've been doing for the past year, and then we will move into the amended and 27 budget shortly. This is just an overview slide of some of the things that we've accomplished. The Medicare Advantage procurement was released and contract signed, and that's going well. One of the things that was very important to the House and Senate last year was the SHB transitioning to NADAC pricing, which was the implementation of House Bill 196. There's a lot of people in this room that had a lot of interest in that, and that program went live as of January 1st, and to my knowledge, we're not having any significant problems with the implementation or reimbursement. Obviously, the independent pharmacists are in touch with us on a regular basis. If they see any glitches, we hear about them fairly quickly. And so far, so good. We'll cross our fingers. As some of you know, we had Dr. Oz with us earlier or late in the fall, and he visited our OnMed program, which is the telehealth station that's over in Sloppy Floyd, and he was very impressed about the technology as well as the access to care, and we are hoping to increase that type of service in our Rural Health Transformation Fund that we'll be talking about a little bit later. The middle part of the slide is focused mainly on behavioral health and care for the elderly. The QRTP program was approved by CMS this year. The therapeutic care model was approved, and that's a multidisciplinary community program to try to help keep kids with behavioral health problems out of institutions. So it's community services that are designed to make sure they can get treatment at home for various types of diagnoses. There's some cleanup we need to do with that. Some of the things we wanted to do in that model are going to require a waiver, and we have legislation coming up this session to send to CMS so that we can finish up that piece. The main thing that waiver will do will allow us to provide respite care, again, for those that are taking care of those children that, 24/7 are under stress, and having some respite services available for them makes a big difference in the outcomes of those family units. We also received approval for the certified behavioral health centers, and those 3 of those have gone live as of January 1st, and we have a waiting on in lieu of services from CMS. That's a big word that basically allows the CMOs, the care management organization, to spend money on things that normally Medicaid won't allow. And so the in lieu of services is what we're doing to help with the transition when a patient, and usually these are young people that are in an emergency room and are staying there for way too long because there's no bed placement, and then those that are trying to leave a setting of institutionalized admission. Sometimes there's not a good place for them to go after they leave, and so these in lieu of services, again, are designed to help support those kids. Another thing that's we're really excited about is the PACE program, which is a program for the elderly that it basically allows somebody who is eligible to be in a nursing home because of the severity of their condition. It allows them to stay at home with a lot of wraparound services, and that program, we had our first procurement that was announced in Savannah, and Savannah Hospice won that bid, and we're doing a rolling procurement one after the other to cover all the regions that are eligible based on their population. So we're hopeful within a couple of years we'll have those programs rolled out throughout the state, and that's one of the things that on an internal basis our folks have been real excited about that, because they see the need and the benefits of keeping folks out of the nursing home. The next thing I want to talk about is the directed payment programs, which are very important for healthcare financing in Georgia. We're talking about about $2 billion a year. We submitted all of those this summer. We've had one of those approved. We got a round of questions from CMS on those a couple of weeks ago, and those have all been answered. So we're crossing our fingers that we'll get feedback and approval on those very shortly. Been a lot of discussion, especially in the media, on the One Big Beautiful Bill and what implications that has for Georgia. We've spent a lot of time since that bill passed evaluating what changes we're going to have to do because of some eligibility changes and technology changes, and also some changes that will be coming in the provider taxes that fund those DPPs I was talking about earlier. The final rule on that bill is expected to be released sometime between now and May, and we hope to get further guidance on the changes, but we're already kind of pre-planning for what we understand is coming so that we won't be caught short when we get those final rules. Another thing that's been on a lot of people's mind, because it's been in the media, is the Rural Health Transformation Grant that was also part of HR 1, we did get our reward for that application. Again, I want to thank our staff. That grant for a $50 billion grant, the timing of it was unprecedented about how quickly the application had to be submitted. And our folks worked weekends and evenings trying to get that accomplished before the deadline, and were successful. And we did get our notice of award a couple of weeks ago for $218 million. We've been a little more aggressive in our ask because, you know, we want more of those federal dollars if we can get them. And so we had to go back and you know, get our budget right-sized for the actual award, and we've resubmitted that to CMS, I think this week, a couple of days ago, and we're expecting that approval very shortly, and those dollars should be flowing probably after the 1st of February. As most of you know, that was a national grant. Every state had the opportunity to apply, and all 50 states did get an award. I think the last time I looked, we were 8th or 9th in the size of our award, so you know, we're excited about that. Our initiatives are very expansive. We've got 29, I think, projects that we'll be working on across the state, and they cover areas such as sustaining health system, continuum of care improvement, access to care improvement, workforce improvement, and of course technology improvements. And all of those things are going to be necessary to try to stabilize the rural health care delivery system in Georgia. As most of you know, I practiced medicine in a small town for almost 30 years, and have a great passion and love for that part of our state, and it's exciting to be a part of this initiative to actually make a transformative kind of generational difference. And one of the biggest pieces, and the most of these dollars are going towards trying to change the reimbursement model in rural Georgia to be more sustainable, to make the funds flow in a way that will keep the rural hospitals financially stable, while also improving their outcomes. And we'll be using these dollars to kind of target on a very, very narrow basis to try to direct the funds where they will do the most good for the most people. So again, we're excited about that. The other thing that's been in the news, of course, has been concerns about fraud, waste, and abuse in our state and federal funds, and it has been very satisfying to me to learn about what we're already doing. So we're not way behind on this issue. As you see on this slide, there were a few cases publicized in the past year of fraud that with our partnership with Attorney General's office, we're making cases as they come and have been. That being said, as the saying goes, why do you rob banks? And it's because that's where the money is. Medicaid in Georgia is kind of where the money is. There's a lot of funds that flow through our agency, and so we're always going to be a target. It's just like all of us are targets of cyber criminals every day. There are folks that want to take taxpayer money illicitly, and you do have to stay on top of that. It's not, you're never going to catch them all, and you're never going to be able to keep up with the transition and what they're trying to do without a lot of dedicated people and resources to stay on top of that. And this slide just tells you the broad pillars that we use. Obviously, the biggest thing we want to do is prevent it from happening in the first place. So we use advanced data and analytics so that we get early warnings when a provider may be billing in such a way that's just outside the norm. We have investigators that go out and help with that, even on the ground, and also have enforcement and accountability programs that we partner with Attorney General's office. We do waste reduction, which is, fraud, waste, and abuse. Everybody focuses on the fraud part, but there's a lot of waste in healthcare and duplication of services and unnecessary lab work and so forth and so on. And so we always try to balance the oversight of those programs and making sure they're doing what they're supposed to do, but you have to balance that with getting in the way of needed healthcare services. And there's always this tension about prior approvals and some of the oversight that has to be done. But I can promise you, if you don't do some of that, you're going to have a lot of money walking out the door. So we're, as a clinician myself who's had to be on the phone dealing with those issues, we take it seriously as far as not overdoing it, but it's not going to go away. It's impossible. And of course, I mentioned the interagency collaboration. We can't do this without our partners in Attorney General's office, as well as the GBI and the other folks that help us, local law enforcement. We want to have an open door policy, but we do have some, advanced technology. I mentioned the fraud detection. We have a vendor called Fraud Scope that uses assisted artificial intelligence to early evaluate claims that are kind of out of the norm, and we use that tool, and it's been very, very successful in saving us money in detecting these things earlier than normal. And of course, we have the third-party liability, which is just using the fact that on the federal government side, Medicaid is a funder of last resort. So if somebody has more than one fund source, sometimes Medicaid gets billed first, and we have to go back and say, no, you didn't bill the commercial first, and so that results in a lot of money that comes back to the state because of those billing errors, and that's a big piece of what we're trying to do. As you can see on that slide, those are millions, so it ends up over $1 billion we're getting back from those types of services. And this is my favorite slide because I know y'all can't read it.
And that usually increases the number of questions you get. So,
well, I was just kidding, boss. I did have to get them to move some stuff off of this. I did try to make it better, but I do think it's representative of the fact that our agency is big. It's very, very complex. We have 50 active procurements that we're managing right now, 200 contract renewals that we deal with every year, and our folks are just busy, and they do a great job. We're not perfect. We're always wanting to do better, and the great thing for me is I'm usually being schooled on what we need to do better. It's not me telling them what to do. They're bringing it to us. We could do X better if we had this, that, or the other, and that's very rewarding and makes it fun to come to work every day. But we know our technology is old. The public-facing interface provides a lot of challenges when people are trying to interact with state government. But we can't improve those without those procurements, and unfortunately, procurements when they're as large as ours are frequently protested, and very, very frequently they go to Superior Court for litigation when the loser loses, and it really slows down our ability to get our technology up to speed to where we want it to be. Y'all have put the money in the budget, and it's just unfortunate that we can't spend it timely because we're having to wait on these issues to be dealt with. So again, that's just a problem we face, and just want to make sure you all understand that. Now, I think I'm going to let this guy with the brain speak. I'm going to turn it over to Cody, our Whitlock, our CFO, and he's going to go into the nitty-gritty on the budget itself.
Thank you, Dr. Burke. Good afternoon, Chairman, members of the committee. My name is Cody Whitlock. I'm the Chief Financial Officer of the department. Before we get into the governor's AFY 26, FY 27 recommendations, I do want to go ahead and level set with our base budget. Our current base budget is about $5.6 billion in state funds, $24.7 billion in total funds. As you can see on the slide, the majority of those are the benefits program. Approximately 97% of our total funds relate to Medicaid benefits. The remaining 3% operate our administrative functions, departmental admin, the State Office of Rural Health, boards of pharmacy and dentistry, and our HFRD division. Because a lot of our dollars are spent on Medicaid benefits, we did want to highlight our beneficiaries of the state. Our ABD population is our fee-for-service population, LIM being our capitation within our managed care program, paid on a per member per month. Primarily that break out children and women, and we also have SHBP as members of our beneficiaries as well. Looking at the budget itself, with 97% of the budget being driven by benefits, the largest driver of those benefits is our enrollment trends. This slide provides historic and projected base trend moving forward. We had historically seen year-over-year growth within Medicaid prior to the public health emergency. With the end of the PHE, there was a decrease in enrollment due to redeterminations. After DSNAP or disaster SNAP efforts and a return to regular enrollment trends, we project our initial base trend forward. This trend aligns with CMS projections on a national basis as well. Moving into AFY, the first item is across various programs that the governor mentioned, alluded to in his State of the State, which we are very thankful for, the $2,000 one-time payment to state employees. From a programmatic standpoint, the first item is related to our Katie Beckett caseworkers. Those are our only caseworkers within DCH. This is a $3,000 salary enhancement for them. In SFY 26, DFACS caseworkers received a $3,000 increase in order to maintain parity with eligibility workers across the state. The department decided to increase the staff raise by $3,000 as well. So this $3,000 is simply a backfill to maintain parity within DHS and DCH. The next couple of items are some reductions just within departmental administration and pharmacy. What those were is just a delay in start dates for some positions. So they may have started in September, October, so they went in and took a little bit of the funds since they started funding in July 1, so it's a sweeping of the funds there. Jumping back up, Dr. Burke alluded to earlier, a 1915I waiver. This is a yes item to allow additional services within the therapeutic care model. As Dr. Burke mentioned, really this is for family preservation, so maybe family caregiver, respite, things that would traditionally not be covered by Medicaid, since the caregiver is not a member of Medicaid. This will have accompanying agency legislation as well. It's a yes item just for us to submit that waiver to CMS. The final item in AFY is some protective equipment and an additional vehicle for a criminal investigator, which will be appropriated in the base budget in the Georgia Board of Dentistry. Moving into benefits. As I mentioned, ABD primarily falls under the fee-for-service model, so growth in ABD is really determined by utilization and cost of care. In AFY 2026, the growth recommendation at the very bottom of that ABD column is about $244 million, driven by an increase in enrollment and increase in utilization within that population. The low-income Medicaid population is managed by is managed in managed care, which is funded on a PMPM. Because redeterminations ultimately resulted in fewer active members, people who moved out, pregnant women who were no longer pregnant, kids who have aged out, et cetera. The decrease is about $141 million there. Our enrollment is projected to increase again, but our enrollment starting point was lower than our base projection, so that's why you see that reduction. In Peach Care, there's about a $7 million decrease due to the lower starting enrollment as well. There's also some lines here related to high-cost drugs. That's an $11 million reduction in amended. This is driven based on lower utilization than we had initially projected in base 26. There's also some items within our dual eligible populations, Medicare Part B, Medicare Part D. Those are just annual adjustments. Part D is prescription drugs within Medicare, and Part B is medical services that help cover medical costs, such as outpatient, that Part A does not cover within Medicare. The remaining items, the reduced funds for FMAP is just a slight adjustment on 2 line items in FY26 related to a different FMAP used in the base budget versus what the actual FMAP is, so that's just a slight adjustment from OPB there. And the remaining 3 items on the provider fees are annual true-ups based on revenue collections from the agency on your hospital provider fees, nursing home provider fees, and ambulance provider fees. Moving into FY27, the first table is just our statewide changes. I do want to highlight one real quick that you'll see across the entire state enterprise, which is the adjustment to SHBP. I will talk about SHBP after the Medicaid benefits portion on why that adjustment is occurring, but I did want to just kind of highlight that that is going from 29.454% to 20.264%. Outside of statewide adjustments, you'll see really similar things that are carrying through in the programmatic side. The annualization of that Katie Beckett $3,000 for the employees. We also have an increase of 8 caseworkers within the Katie Beckett program. This is to continue to support the work that's being done and the increased caseload with those eligibility workers. We also received an additional position in our MAP division, which is the administrative function of Medicaid for long-term care. Within the final item within departmental administration is a one-time reduction. In FY26, we were provided $300,000 to assist in a submission to CMS for graduate medical education GME slots. We have submitted that to CMS and are pending approval on that decision. In Board of Dentistry, the equipment and the vehicle were funded in the one-time AFY. This is the funds for the one-time criminal investigator. There's also some funds in base 26 for some protective equipment, which are just eliminating for one-time funds. And then in healthcare access and improvement, which is SOAR down in Cordeal, there were some funds in FY26 for one-time funding for certain items, and those are just being swept since they were one-time items. Within Medicaid, for FY27, we see increase in ABD, a decrease in LIM, and a decrease in Peach Care. This is going to follow the same trend that I was mentioning in AFY 26, increased utilization, increased enrollment within the ABD population, lower enrollment starting point than we had initially projected within LIM, right-sizing that, so a slightly lower PMPM cost associated with LIM and Peach Care, so there's slight reductions there. We do have our annual FMAP adjustment from 66.4 to 66.63. This is just a fund source swap with state and federal funds. Because we deal within the billions, those small percentage points end up being a large increase in adjustment on state and federal funds. We have our annual update, or to update the skilled nursing facility cost reports, which we have here for $5 million. Our dual eligible population for Medicare Part B and Part D again, utilization for drugs again. These are, I didn't mention it earlier, these are very one-time, very high-cost drugs associated with gene therapy, is what these are. But based on projected utilization from base, we're reducing that by $11.8 million. Again, the right sizing of the FMAP adjustment from SFY 26 for 26,029 and 5,000 respectively. And then the final three items, your hospital provider fees, your ambulance provider fees, and your nursing home provider fee true up. Moving into SHBP, as I mentioned, there is a reduction across the state enterprise on the employer contribution for state payroll. The purpose behind that, and I'll have a slide in a future item, is we have fully funded our OPEB liability for the state. We're approximately at 130% funded. So in order to, since we have recognized we have fully funded that liability, the governor's office has decreased that because we don't need to continue to charge state agencies for a liability that we have fully funded. Outside of that, in the bottom kind of box, there is an increase on the school side for the per member per month. We still have an outstanding liability for the school portion of OPEB. It's funded at about 9% right now, or 11%, $9 billion. So an increase there to try to cover that future liability. Moving up, there is a slight adjustment in some state funds within SHBP. Dr. Burke alluded to earlier. We have implemented NADAC pricing, which is House Bill 196. There was a fiscal note associated with that, so that 1.2 tracks exactly what the associated cost to implement and operationalize NADAC, what that is. And then there was some one-time funds for a $3 dispensing fee prior to NADAC implementation, and so we're just eliminating those dollars because NADAC is now in full effect. The next slide just shows projected expense versus revenue. The light covers the dark. Your revenues are going to cover expense within each fiscal year on your state, your certified and your non-certified with this adjustment. And with that being said, we think we can start making some dents in our liability, which I have highlighted on the screen, mentioning state OPEB at 131% funded, and then that $9 billion liability and 11.63% funded on the school side. Dr. Burke, that's everything. There is one other item that I did want to highlight that's not in our budget. It's in the Technology Empowerment Fund within GTA. It's $35 million for IES Gateway. This is a continuation of the $35 million that was put in the previous year to modernize IES. And so it's not strictly in DCH's budget, but I did want y'all to have awareness that does exist as well for the department. So.
All right, Dr. Burke, I guess you thought you were out of the hot seat, but we do have some questions out here. I failed to recognize that this may be your first time here as serving as the commissioner, but you've been here many times.
Yes, it's a little different being on the other side. I'll admit that, but I was ready.
Representative Al Williams, we'll start with you.
Thank you, Mr.
Since
Chairman.
you wait so patiently
You're
usually.
my friend indeed. Thank you, Doctor. Quick question. For years, the Attorney General has stated under waste, abuse, fraud, the vast majority is found not among recipients, but providers. Is that still true?
Off the top of my head, I would say it's true, and I'm not seeing an exact statistic, but I would say that's probably true.
Well, according to the Attorney General, it's overwhelmingly true that that's where the fraud is. Hard to get $3 million out of a check that you get.
Hughley.
Thank you, Mr. Chairman. Dr. Burke, thank you for your presentation. A couple things.
Got it.
To take care of my hometown people, the 105 new residency slots that you all have in this budget, I need to make sure that we have the 7 psychology slots for St. Francis. Can you all verify that for me? It's included in that.
Yeah, we'll get back with you and verify that. I don't want to misspeak about that.
And then the school district always complains about the non-certificated persons and how much they have to pay on the state health benefit program. And so did I understand you correctly? On the state side, we've fully funded the liability, but on the school side, we haven't. And so that's why theirs is increasing? Is that the correct understanding?
That's correct.
And then lastly, the redeterminations had an impact on the reductions. Can you all look and tell us how much was it redetermination, people failing to do what they needed to do to redetermine, as opposed to people actually falling off the system?
Well, yeah, that was, I guess it's been 2 years ago now when that process unfolded. And just to remind folks, and there's plenty of folks in the room that may not have been here then, during the public health emergency, I think it was over 3 years, we did no redeterminations. In other words, normally eligibility for Medicaid is determined every year. You're either renewed or something has changed. You may be making too much money. You may have moved out of state. You know, there's a lot of reasons why people get off of Medicaid. So that process was suspended for 3 years. So our enrollment increased to, I think, over 3 million people at its peak. And traditionally, Georgia has had around 2 million people in Medicaid. So that redetermination process took us 13 months. It was an extreme heavy lift just from the process standpoint, evaluating every one of those millions of people's situation and making that determination, are they still eligible or they're not. So that was accomplished, like I said, a couple of years ago, and that's why you saw that drop in our enrollment numbers. That slide now basically shows we're having a slight gradual increase since that time that really represent the fact that Georgia's growing. So, you know, the more people that come to Georgia, you're going to have a percentage of those people that are going to be eligible for Medicaid, so our enrollment should grow. Now, there are always times that changes with the DSNAP, when we have disasters and all of a sudden there are people that are not working that used to work, you know, so enrollment flips. If we have a recession, which sounds like I didn't hear his speech, but there's some discussion from our advisors on the financial side that may be coming. I mean, you know, we hadn't had one in a while, and so I don't think that's a shock. But we always grow our roles in Medicaid when we have those financial disturbances like recessions and high unemployment. So, but right now we're following the normal annual evaluation or reevaluation on a monthly basis. You know, if you're supposed to be reevaluated in December, then we do that, and some people come off the rolls at that time.
Chairman Watson.
Thank you, Mr. Chairman. Thank you, Dr. Burke. We appreciate that. I'm over here.
Where are you? There you are.
Right,
thank you.
Sorry. In the rural health transformation, would we have gotten more money if we did not have any CON laws in Georgia?
That was one of the grading criteria, and we don't know the rubric of exactly what they were grading on, but that was one of the criteria. Was I'm assuming because of the administration, in their minds, the less CON, the higher the score. So, you know, to answer your question, again, I don't know the details. We got, you know, more than our share, so it's not like it, you know, hurt us, but I don't know whether it would have been $15 million more or $5 million more. There's no way to determine.
Yeah, it was a great plan that DCH submitted. It was fabulous. I just noted in the footnotes there, in the comparing to other states, it seemed anywhere from $15 to $30 million more that they got when they didn't have CON in their state laws.
Chairman Newton.
Thank you, Mr. Chairman. Commissioner, you and your team are doing a great job. I appreciate that slide that was fairly detailed, to share it with us, to recognize just in one point how much you all do. A couple of things that were just unnoticed. The SHPP employer contribution dropping from 29 to 20. That was pretty impressive, and I believe that'll hit agencies across the state, correct? Well,
yeah, the agencies themselves will have to pay less per employee.
One other thing I had noticed, I appreciate that. I'm sure that's going to ripple through in a good way through our budget hearings. The GME number of going down 300,000, I know it was a reduction because it was put in the base budget and it's zeroing it back out, but my impression is that we're going to still keep our foot on the accelerator with expanding GME. Are you sure this is the time to reduce your funding, or do you have enough bandwidth in the rest of the department to carry it without special one-time funding?
Well, as a physician and know our deficiencies in the number of docs, especially in rural Georgia, I want us to keep the gas pedal down. We are benefiting from DPP dollars. We're benefiting from the Rural Health Transformation Fund dollars. The legislature's been very generous about those one-time funds for startup money for residencies in rural Georgia. That's that money that the State Office of Rural Health has been using. And of course the SPA that we just submitted to try to increase our Medicaid funding for the slot. So I feel like from a comprehensive GME standpoint, we're making a big difference and a huge difference in rural Georgia. I mean, I think in the next few years we will hit capacity of what we can train in rural Georgia, because you have to have enough volume of patients and the people that oversee the residents, and when those opportunities are used up in rural Georgia, when all the hospitals that could service a residency program have one, then that'll be a great day, but I don't think it's that far away, to be honest. We have more opportunity in the urban areas just because of the workforce that's available to do the preceptoring and teaching and those types of things, plus obviously the population volume is higher. So, but GME is extremely complex. The funding sources are vast. I mean, there's little dollars that come through on different pieces of in other words, every time you have a Medicare patient in a hospital has a GMM program, they get a little bump to their rates for that, and they get a little bump in their Medicaid rates besides the slot fees that they get. So there is a huge complexity to making sure that we've got all of those boxes maximized to the degree we can. Again, any extra dollars are lovely, and if you show us some love, we'll make sure they're spent wisely. So
thank you for that, and appreciate that. I know there's been some transformative agreements with health systems that have stepped into this alongside it. I just wanted to make sure if there was a team that was funded by this, that we weren't telling them they weren't needed anymore, but we're going to just transfer and keep that going. Thank you, sir.
And again, there's a difference between the startup funds and then the ongoing funds that go towards. So the startup is just some of these rural programs that just don't have the cash to, because with a residency program, the hospital has to hire staff and do applications and have everything in place, usually a couple of years before they actually get the first resident there. So this was a way for people that just didn't have the cash in the bank, but they wanted to start a program. It was a way to jumpstart them, and we'll continue that, but there's just less of those out there than there used to be.
Okay, it's just a reminder, the longer the question and the response, the less questions we get. Chairman Harbison.
Thank you, Mr. Chairman. Commissioner, thank you very much for your support, for your report. You mentioned something about wraparound service for the elderly with a feature a stay-at-home future. Can you expand on that briefly? I didn't quite get that, if I heard you correctly.
Well, one of the things is the PACE program, which is a program for the elderly that are eligible to be admitted to a nursing home on Medicaid. And that criteria has to do with their ability to feed themselves, give themselves medications. All these things add up together to say, yes, you're eligible for Medicaid bed in a nursing home, or you're not. So this PACE program says, okay, this person is eligible for a nursing home because of their needs, but they're going to voluntarily, this is voluntary program, that individual says, okay, I'm going to go into this PACE program, and they're going to handle all those medical needs with home services. They have rehab, physical therapy, different programs like that that allows those patients to be served in the community outside the nursing home.
Thank you, Commissioner. Finally, this rural health transportation grant, just very briefly, is that widely used? For instance, I'm interested because of my area have a lot of rural counties.
Yeah, it's a new program, so just getting started, and all of the hospitals and communities under 50,000 in the county will receive these funds in different buckets because there are a lot of different initiatives, but it's directed towards rural. There will be some rural referral hospitals that also are part of the program, because on a continuum of care basis, when you have a patient that's in a rural facility, but their condition worsens to the point where they need to go to a higher level of care, we want to make sure that that process is seamless. And in doing so, there are rural referral hospitals that are in rural, urban areas that are also eligible for some of the pieces of this grant, because again, the total cost of care has to include that tertiary level of higher services.
Thank you, Mr. President.
Okay, there's a lot of questions on the board. I'm going to take one more question, so if you don't get called on, I'm sure the commissioner and his staff will be glad to take questions in the hall. Chair Taylor.
Thank you, Mr. Chairman. Thank you, Commissioner, for being here. I appreciate all this effort and time that's gone into it. Have you got plans laid out for the rural dollars and how they're going to be spent? I know the GMA is very important to all of us, and it is beefing it up. I am seeing new rural hospitals wanting to be involved in residency. Can we look forward to quite a few dollars from that bucket of money?
Yeah, I mean, we're partnering with the Georgia Healthcare Workforce Board on that piece of it, and so that's Chet's bucket, so to speak. But
Okay,
yeah,
so
there are funds, and remember, this is a 5-year program, so it's not just this year. So the numbers will go up and down every year based on what we feel like is the right transition. In other words, once you've done what I would call the easy things the first year, then you start ratcheting it up, and so you might move dollars more into technology and less into assessment.
Right, and some of the hospitals the rural hospitals have indicated they might move on to doing some fellowships. Again, the specialists are hard to get in there, so just making sure to appreciate how you're outlining how to use these dollars. Thank you.
Commissioner, last thing, can you go back to your slide that showed the layout, the confusing one, the one that you said was too small to read?
You want to do that? I'll end up going the wrong direction.
And leading up to it, the one that you just passed afterwards showed LIM, the low-income Medicaid. Obviously, that's our largest served population, 52% of your budget. When you get into this and the complications here, I agree with you. It's incredibly complicated, and you've got a lot that you're covering. It seems, though, that one of the things that the eligibility portion being separate from the contracting portion seems to cause incredible confusion. You've got the eligibility folks handling the people who have services and are getting them denied or not, and then the contracting on the other side with you guys. Can we move eligibility to you or move contracting over to where eligibility is? And do you have a preference?
You and the governor together, you, the general you, not just you, Chairman Tillery, those are agency level decisions that are above my pay grade. But I can promise you, our folks, provided they get the resources, can deal with whatever y'all think is best.
Do you have a preference?
I'm not going to state that at this time.
If you don't tell us, sometimes we just do it. So, all right.
I'll be seeing you next week, I think. We have an appointment.
Thank you, Commissioner. Thank you, and your staff. Thank you. Next up is Commissioner Candace Brose with the Department of Human Services.
I'm sitting there, but I gotta use the restroom if we want to sit there for this presentation. Yeah, that's fine. So how can I sit here? Just move this. There, sit that one down. Go forward. Are you okay? Yes.
I think I do that in some way every year. I trip over the stairs, so yeah.
All right, let's bring the roar down, please. All right. Commissioner Brose, welcome.
Thank you.
And the floor is yours.
All right. Good morning, everyone. My name is Candace Brose. I currently serve as the Georgia DHS Commissioner and the State DFACS Director. Our agency has three main divisions: the Division of Aging Services, Child Support Services, and DFACS, and we currently employ just shy of 9,700 workers statewide. So here you can see a summary of the governor's recommendations for amended fiscal year 26 and for fiscal year 27. I'll quickly cover the statewide adjustments for both of those budgets. Essentially what you're seeing is, adjustments in agency premiums, technology-related infrastructure through GTA, reduction in the employer contribution rate, and adjustments in the federal medical assistance percentage, the enhanced FMAP. I'd be happy to go through those in more detail, but for the sake of time, I'll just sort of breeze through them. Those are the statewide adjustments. Workload adjustments, I'll go through by program, and that would be for you, I believe, page 214 of the governor's budget report. So under child support services, the governor has recommended an increase of $2,633,924. That is for maintaining software applications through GTA's mainframe. In particular, that will ensure that critical applications like our child support enforcement platform continue to get timely updates as we move to modernize those systems. On the same page, but under Child Welfare Services, there's a transfer of $371,500 from out-of-home care to the Child Welfare Services program budget. This move better aligns those activities with the budgetary program purpose. So it specifically puts all of our federal Family First Prevention Services funds in the Child Welfare Services program budget. And then you can see the associated transfer under the out-of-home care program budget over in page 215. So still on page 214, in Child Welfare Services, there's a $50,000 reduction related to a community service referral pilot, and this adjustment just aligns budgeted funds with the contract's actual cost. Going to page 215, under federal eligibility benefit services, the governor has recommended an increase of $6,207,774 for system changes so that we can become federally compliant with passage of H.R. 1, the One Big Beautiful Bill. We will use these funds to reduce the state's error rate in our SNAP program, also called the food stamps program. And with some additional context, the state's integrated eligibility system, it's called Georgia Gateway. It's an application where people can apply for SNAP, Medicaid, TANF-funded cash assistance. I know I'm throwing out a lot of acronyms, but I can talk to whomever afterward if you want to see our glossary. WIC, refugee assistance, and child care assistance. The Department of Community Health controls the contract for the vendor, Deloitte, that maintains and operates Gateway. They also built Gateway. DFACS serves as their contractor, DCHs. So we manage the day-to-day technical work, the eligibility staff, and system maintenance in terms of scheduling and testing. But DCH sets Medicaid policy as the state's Medicaid agency, and then we effectuate those terms. We are the lead agency for the Supplemental Nutrition Assistance Program, SNAP, food stamps, and TANF cash assistance. So we set the policy for those programs. And DCAL and DPH handle the policy and some of their own staffing for CAPS and WIC, the other programs in the Gateway system. SNAP supports over 1.4 million people in our state with more than 275 million issued in monthly benefits. That is more than $3.2 billion per year, and the average benefit per month is about $390. Right now, all of those benefits are federally funded. Those benefits are issued to EBT cards for eligible food and beverage purchases. I mentioned 1.4 million people on SNAP. That is actually a little over 700,000 active SNAP cases, and DFACS processes somewhere between 30,000 to 50,000 new applications for SNAP every month. H.R. 1, the One Big Beautiful Bill, increases Georgia's administrative cost share, so how we pay for technology, partially how we pay for salaries. It increases our administrative cost share for the SNAP program from 50% to 75% in federal fiscal year 2027, and it imposes cost sharing of the total amount of benefits issued if our payment error rate is above 6%. It's a complicated formula, but I can get into more detail as needed. That increase in the cost sharing of benefits will start federal fiscal year 2028 unless we meet an applicable exception. To reduce the state's SNAP payment error rate, which most recent calculation has us somewhere in the 13% range, the most recent publicly reported payment error rate is a little over 15%, which puts us at the top in terms of states with payment error rates. To reduce that rate, we have submitted several waivers to USDA Food and Nutrition Service. That's the entity that oversees the SNAP program and regulates us. Those waivers would require system changes worth roughly $1.8 million in state funds. Pending federal approval, there's over $1.9 million included in the governor's recommendations for system enhancements. That'll include some automatic quality checks in our processing of cases, more optical character recognition, so we're not doing as much manual work. Better technology for when we have to do client interviews. We have to interview SNAP clients. It's a federal mandate, and other improvements, specifically in income verification for self-employment. That's a big one where we need some enhancements. There will also be some residency checks built in the system with this funding. Finally, nearly $2.5 million is recommended for system compliance certification, and so that supports securing our federal matching funds. Alongside our tech enhancements, DFACS, as part of the reduction payment error rate initiatives, we're investing in our staff. So we've rolled out nesting teams, which is it's a model for staff to get better mentorship from more seasoned eligibility workers and supervisors. We're rolling out training hubs to improve their processing accuracy. We've reinstituted monthly case reviews by supervisors and caseworkers, for example. Some other quality targeted efforts include what we're calling the Drive for Five. That's designed to plan, which is how we look at our cases overall, identify errors, and work with our federal regulators to determine our payment error rate. This recommendation encompasses current deficit reduction methods, including, sorry, hold on just 1 second. Yeah, okay, so same page for out-of-home care, I'm sorry. You can see that we've got 41.5, a little over million put in the budget. Out-of-home care is the program budget where we fund foster care. So we're going to fund services, we're going to fund placements. There are no staff funded in that program budget. This recommendation covers our current deficit reduction methods. There's been reports where we have had, in order to maintain operations within our existing budget, we've had to terminate some contracts. We've had to change the process for how we authorize services. I'll get in more detail soon. But this particular recommendation reflects maintenance of those current methods. And it assumes a 25% reduction for the fiscal year's second half. We will then use, in addition to, based on where we land, we will then use unobligated TANF funds for allowable expenses to cover the difference. The projected state funds deficit in out-of-home care for state fiscal year 2026 is $85.7 million in state funds. That is a projection. There's been some confusion. That's not currently debt that we have, but that is what we're looking at getting to the end of the state fiscal year. Again, assuming a 25% reduction in costs, we expect that we will reduce the projected deficit overall to $48.9 million. In November, with at least 30 days written notice per the terms of our contract, we did terminate several state-funded contracts with our providers for care coordination-related functions and placements. And it's somewhat oversimplifying, but essentially these providers we determined were not meeting the standards that we have outlined in our contracts with them, or serving the populations that we sought for them to cover, or their work duplicated existing capacity, either at our agency or another agency. So that is how we identified those particular contracts. We also changed how we authorize payment of services for children and parents, and that process, although there's been a lot of concern for how that change occurred, it's also been very illuminating for our agency, and I'll get into why. For example, despite our agency paying enhanced daily rates to providers for specialized care for children in our custody, we aren't, in some cases, seeing the desired outcomes. So we still pay increased rates for them to serve high needs youth in very specialized settings, and we are seeing in real time when that does not occur. Children up to age 10, for example, shouldn't demand $200 plus per diems daily rates. So that just, there's rarely a scenario where that is necessary, but that is what we were seeing. Additionally, we don't want children in settings designed for complex teenaged youth. That's just not right for a child at that age. It's not what we contracted for. And, clinical care coordination, which was the subject of one of those particular terminated contracts, that is already covered by DCH through a capitated rate to a MER group for managed care Medicaid. So that is a duplicated payment. And the scope of services for all of these contracts that were affected, it was clearly articulated in the contract. So again, that's how we arrived at those particular contracts. If you could go to slide 4, the governor's amended fiscal year 2026 recommendations total $50,335,034. Go to the next one. Moving into fiscal year 2027, that's your page 218. There's a roughly $35,000 reduction in our program budget, child abuse and neglect prevention. That's based on a decrease in collections of marriage and divorce filing fees, and that's based on the dedicated funds bill from a few years ago. Same page under child support services, you'll again see an increase of just over $3.6 million related to the mainframe technology I mentioned. Under child support services, too, the governor has recommended $456,374 to restore budget reductions that were made in 2021 for the DA's offices that locally administer some of our child support enforcement. On the same page, but under child welfare services, you see the same transfer I previously mentioned of $371,500 from out-of-home care to child welfare services, and then underneath that, the governor recommended a $50,000 reduction. It's the same as the one I described in the amended budget. On page 219, in departmental administration, the governor has recommended $5,925,437. That is related to passage of the One Big Beautiful Bill. This recommendation represents the state's increased match from 50% to 75% for our SNAP administrative expenses to run the program. Next, on page 220, in federal eligibility benefit services, the governor has recommended $40,428,968. That again corresponds to our increased share in administrative costs for SNAP. And under that, the governor has recommended $12 million to fund our overall strategy to reduce our payment error rate. On the same page, but under out-of-home care, there's a $300,000 reduction for what was one-time funding for clothing and supplies for foster youth. Next, there's a reduction of $250,000, which was intended for a pilot project to ideally place foster youth closer to their home communities. Given our projected shortfall in out-of-home care, we did not pursue this particular initiative, but I will note that we do already make significant efforts in identifying placement options as close as possible to the child's home community, and we do that with judicial oversight, should we not meet the expectations. Admittedly, though, we've lost 876 placement slots since 2019. So it is more likely these days that a child will be placed further away from home. In a similar vein, we have new research, this is from UGA professor David Gibbs, that indicates a steep upswing in defects involve children with severe emotional disturbance. I'll get into that later, we'll have a graph. But as you know, behaviorally and medically complex youth are harder to serve in or out of their homes, and that's due to provider shortages, network inadequacy, and similar variables. Slide 7.
So that number is not necessarily just adopting families, it's other providers also.
Mm-hmm.
Okay.
Those are the providers that house foster children. We've lost 867 beds, so to speak. On page 220, again, you'll see a reduction of $371,500 transferred from out-of-home care to child welfare services. Under that, there's also a recommended transfer of a little over $6 million from the Safe Harbor for Sexually Exploited Children Fund Commission. It's an attached entity. That money is going to out-of-home care. It will continue to fund the First Lady's facility for trafficked foster youth, which is called Grace's Place, and that is located in Gwinnett County. It has 26 beds. This move will also allow our agency to draw down more federal reimbursements for placements of children at that location. Finally, on page 220, the governor has recommended a little over $21 million in out-of-home care. That figure covers $19,401,801 for utilization growth and increased cost, plus $1,892,348 based on increased federal drawdown for Grace's Place. Next slide, please. The governor has recommended in some attached agencies in particular, the Council on Aging here has recommended a personal services reduction of $56,379 in AFY 26 and 27. On page 221 in FY 27, there's a reduction of a little over $8 million. That again reflects a transfer of funds from an attached entity to out-of-home care to pay for Grace's Place and the children that are housed at that location. And on the same page in FY 27, for the Safe Harbor Commission, there's an increase of $2,105, and that reflects fiscal year 25 penalty collections from adult entertainment establishments. That is based on code section 15-21-208. Okay, specifically to out-of-home care. You can see here the growth that we've experienced in this particular program budget in a very short amount of time. We have under 10,000 children in foster care right now. That number has been decreasing in recent years. You don't see that decrease here. Over recent years, with that slight downward trend, we still see this increase in cost. Last calendar year, we received almost 121,000 reports of suspected child abuse. Out of those, we launched almost 38,000 investigations. We worked nearly 24,000 family support services cases and just under 8,000 family preservation services cases. That is, we did that work with just under 2,500 caseworkers. So in those cases, family support services and family preservation services, we are trying to keep the family intact with community-based resources. We want to avoid those children entering foster care if we can safely do so. If we uncover abuse or neglect, though, based on a report in one of those cases, and the child safety cannot be assured, we will seek custody in juvenile court. To properly enter foster care under state law, a child must be dependent. That means abused or neglected, and there are, of course, several categories for what constitutes dependency. Importantly, DFACS does not unilaterally take children into foster care. We have to have judicial approval. We have to have a court order. I'm now going to get into what we believe are some big cost drivers for this level of growth in out-of-home care. The first one is court-ordered services. Courts are legally mandated to exhaust every alternative before ordering a child into foster care. If a judge places a child in our care, the juvenile code mandates that hearings occur at specific intervals. The child's parents get attorneys. The child gets an attorney. We have attorneys. We try to first find a relative or a family friend with whom the child can reside. That is the preference. If those are not options, we look for a foster home or a group home, congregate care type setting. And those providers meet their room, board, and watchful oversight needs. That's what we call that particular area. The child welfare system is designed to pursue reunification of the family, but that is not always the outcome. What we're looking for at the end of the day is permanency for that child. So it may be reunification, but it could be guardianship, it could be adoption, it could be independent living for some of our older youth in foster care who will perhaps age out of the system. DFACS pays for services in cases where we can safely keep the family intact. We're budgeted to cover per diems for providers who house and protect those kids in our custody. Local case managers and supervisors determine the referrals for services that a parent or a child needs, regardless of whether the child's in our custody, and we have hundreds of providers who do that type of work. If a juvenile court is involved, we will take our recommendations for what that parent, what that child needs to our lawyers. We'll take it to the parents' council, we'll take it to the child's council, we'll take it to guardians ad litem, we'll take it to court-appointed special advocates, we'll take it to the people actually housing and caring for the child. That's a lot of people, but that's what we do is in this partnership try to make sure that we're providing the right things for that child and for that parent. Ultimately, though, the judge gets the final say, and they hold all of those parties accountable. DFACS, I want to be very clear here, does not have an opinion on whether or to what extent juvenile judges should be permitted to order services. We don't have an opinion on if they order something above and beyond what we recommend in court. At the end of the day, it's a team effort. We have great partnerships with the judiciary all across the state, but as you can see, we do have unsustainable growth, and we do believe court-ordered services may be one of the primary cost drivers. Our spending choices are driven by mission, DFACS policies, federal standards. We are not the only people making those determinations, though. So judges will, all across the state, order DFACS to provide specific services and specific care. And usually we agree with what they order. Sometimes we don't. If we don't, we need to appeal if we can. That's very rare. Or we need to comply, because one of the consequences of noncompliance with a court order is jail for our caseworkers, or perhaps me, hopefully not. The code contemplates that the judicial circuit, through county funding, or the child's parents, if they're able, could absorb some case-related costs, but the vast majority of the time, we pay for them. Case law says we also need not pay for everything a parent needs to reunify with their child, but that is the exception and not the rule for how we operate. That framework is generally how it operates for dependency cases. So that's where we file the petition, we have the child in our custody. But juvenile courts may also order us to do casework and provide services in matters where we are not a party. And although it's declining, some judges will still place kids in our care when we're not present at that hearing. Perhaps there are safe alternatives that exist. Legally, there may not be dependency. We may still get those kids despite changes in state law, and they can and do order services in non-DFACS cases. So to best illustrate the spectrum within which we operate, I have several real-life examples of court orders, which can be verbal, written, they can be delayed, they could be completely missing. All right. Currently on appeal, a Chatham juvenile court judge has ordered DFACS to pay for a behavior aid, which is essentially third-party supervision, for a delinquent teenager who is not in our custody and for an unspecified amount of time. Behavior aids cost roughly $38.50 per hour. We spent a little over $43 million in behavior aids last state fiscal year. And through this past December, we're trending toward almost $58 million in just behavior aids. In DeKalb and plenty of other circuits, it's common for judges to order supervised visitation between parents and children beyond what DFACS policy outlines, beyond our recommendations. And I would say that's probably in keeping with training materials that so many judges get from national associations or their colleagues for what they believe is best practice. For children aged 0 to 2, DFACS policy recommends at least 2 visits per week. For children aged 3 to 5, we recommend at least 1 visit per week. But typically, judges will order double or triple that cadence, and they will often order it for after hours or weekend visits. Of course, we want children to be able to regularly see their parents. That's important for their well-being. It's important for permanency. But as I mentioned, we do have fewer placements based on over 800 beds that we've lost since 2019. And thus, it's far more likely a child will be placed further away from their home community. So that means higher costs. If a case manager, a foster parent, or a foster agency cannot supervise these ordered visits or provide transportation for the parent and the children, we pay contractors. Again, that's $38.50 per hour. That's quite expensive for third-party supervision. Transportation is almost $30 an hour with a child in the vehicle. it's a little over $14 an hour without them. We also pay for mileage. So we spent over $60 million last fiscal year on mileage and transportation. And we are on track to spend $70 million this year. Some more examples of court-ordered services. In Barrow County, parental drug screens are expected or they're ordered in almost every single case, even if substance abuse isn't alleged. In Henry County, there's one particular judge that will call our CPS hotline, or their staff will, to request parental drug screens in non-defects cases because it saves the county money. One hair follicle drug screen is approximately $137. One urine drug screen is approximately $110. They are frequently ordered together, 2 or 3 times per week per parent. DFACS-funded services may be ordered despite a parent's non-compliance with their case plan, and I'm talking about minimal or no compliance in these examples. In Clark County, a judge recently ordered Saturday visitation for 4 hours for parents of 6 children, and they are all in different placements. Those parents are doing some of those visits. We have to pay regardless of whether they show up. And again, they're not compliant with their case plan. Visits are the only thing that they are doing sometimes. So we'll soon file for termination of their parental rights. We have already spent $20,000 in that case. And if we want to comply with that court order, we will spend $4,000 more. In Cherokee County, one judge will not rule on a pending termination for parental rights motion, but that judge has ordered additional visitation for children in foster care for over 4 years. Since July, we've spent $26,000 per federal standards. Children should be reunified in 12 months or adopted by 24. In nearby Gordon County, which is my neck of the woods, so I feel like I have a license to somewhat pick on them. But in nearby Gordon County, to comply with an order in a case where adoptive parents have abandoned their teenage child to our custody, reunification's never been on the table, right? They've abandoned the child. And it's not clear to me that there's actual legal dependency. The parents are scared of the child, that's the expressed reason, but dependency is measured as to the child and not to the parents. We are still ordered to provide supervised visitation between those parents who abandoned their teenager on the weekends for several hours, and we know that he will never go home. So think about the impact that that has on the child, not just the cost. Headed south, Bleckley County, we have a judge who's ordered us to place the child with a specific provider. It is named. That provider operates 2 locations. They are both in Metro Atlanta. That child will, of course, then be placed hundreds of miles away from their parents and community. So transportation to and from visitation, court, doctor's appointments, that will all be quite costly. Going back to Gordon County, I'll describe what we consider, but you may not, judicial overreach. That judge recently ordered DFACS to help a parent create a resume and oversee submission of their job applications. She also ordered DFACS to help a parent write a budget and comply. Of course, we see value in these objectives, but I don't know that we're the best agency for that type of work, although we are going to do what she said. In the middle of a 3 p.m. hearing, same judge, she ordered us to take a foster child to the doctor by 5 p.m. In a different matter, a DFACS case manager was ordered to use their personal funds that evening to buy clothes for a child based on what was really a misunderstanding about clothing allowances. We're currently ordered to provide supervised visitation several times per week to a completely non-compliant, now out-of-state mother, despite weekly positive drug screens for fentanyl. We asked the grandmother where the children are living if she would help us, if she'd be the supervisor, right, to save money. She said no, she's afraid she'll be exposed to fentanyl. So we're not going to comply with that court order because I'm not going to put those children's lives at risk. But again, the consequences of noncompliance can be contempt, and that can include jail time. So what we've been asking is under what case-specific circumstances should we be allowed to cherry pick certain provisions of a court order or ignore them altogether? That is something, especially as of late, we're asking hourly. The same judge ordered us a few weeks ago to provide in-person substance abuse treatment to an incarcerated parent. The jail does not do that. We're not really the state agency tasked with addressing that particular societal issue, if you will. We don't have the right funding or expertise, in my opinion. But again, this is one of those things where we're asking ourselves, like, does the current system reflect today's world and allocated resources? So another example is that we're regularly ordered to complete assessments in defects cases. Those are very common. They're very expensive. They can be excessive. They can be duplicative. And we're often ordered to provide assessments in non-defects cases. So when I say assessments, I mean parental fitness assessments, psychological assessments, domestic violence assessments, substance abuse assessments. Those are the types of categories. We may be ordered to provide them for the parent, the child, both. They're several $100s each. Some of them can be $1,000. That parent, on paper, might be eligible for safety net healthcare coverage, perhaps Medicaid. That is very rarely explored. If the parent does have substance abuse issues, drug screens and also some of those assessments could theoretically be covered by Medicaid instead of defects funds. I have actually found an instance, as I get service authorization sent my way each day, where we paid defects funds for several assessments. We paid for drug screens. We paid for substance abuse treatment for a mother, and she had been on Medicaid for years. Children in foster care are enrolled in managed care Medicaid that is administered by Amerigroup. And if they aren't, they will get fee-for-service Medicaid, or they may remain on their parents' plan. In that way, too, I would assert that Medicaid should cover many of the assessments that get ordered and many of the tests that get ordered for our children, or that we seek independently. It is not just court-ordered services that are causing issues. We do have judges who will deny emergency custody requests, or they will send kids home too soon, in our opinion. Those decisions are costly too. It's not just related to out-of-home care growth. One judge recently sent a child home too soon out of frustration that we couldn't find an ABA provider. Child went home, dad couldn't find an ABA provider. The point is that we're dealing with this dynamic. We don't control all of our costs. They are increasing exponentially. And while we're trying to do this work, our staff can really be put through it. That will lead to turnover. We may have to change a child's case manager because that case manager just cannot be back in front of that particular judge. That causes trauma to the child, but it also has indirect costs. Juvenile court records and proceedings aren't widely accessible, understandably so. But all of those things together make it so that people may not truly realize that the care of every child in foster care is overseen by a juvenile court. So we do, in fact, often get blamed for decisions that we're not making. We're following a court order. Provider accountability. This is the other big area that I think is a primary cost drivers for out-of-home care. We don't have enough placement providers. We've lost those 800 plus since 2019. We have two main provider groups for serving our children. We have the room, board, and watchful oversight placement providers for foster youth. We have delivered services providers. So they will serve foster youth, they will serve kids that are not in our custody. There is some overlap. Unlike placement providers, the number of delivered services providers has increased since 2019. So we have more people to pull from. There are more people generally billing our agency. Our agency's mission is tethered to strengthening families through casework, but also, frankly, goods and services. So inflation hit us uniquely hard. And so in the same way it affected our providers, some of their frustrations also include they really struggle to find just affordable insurance these days. And of course they have some concern about overregulation. That's something that we're tackling. that we will safely lessen if it's appropriate, because it does create barriers to entry, and we need more placement providers in particular. To conserve dwindling resources, we increase state-level review and approval for service requests, court-ordered or not. And as we're making these decisions, we're reading case plans, we're reading the court order, if it exists, we're reading provider notes, we are looking at what the case manager has documented. It can be quite tedious, but it's been very helpful. And that change in the process is different from what it was where we allowed case managers to put service authorization requests directly into one of our technology systems. To stop hoteling foster kids, we use several strategies. COVID and the Great Resignation gutted our manpower and also that of our providers. So to bring some beds back online, we would pay for staff augmentation. To get kids out of hotels or keep them from entering, we paid one-time emergency grants so that providers could tailor that setting to meet their needs, and ideally retain those youth in that placement instead of having multiple changes. If necessary, we would pay for enhanced supervision using behavior aids in a placement. We still do that for the most behaviorally and medically challenging children. And we increased how much we pay for the healthcare costs of our foster kids. The children in our care that are most at risk of being hoteled have serious mental health needs, they have pending charges, they have gang affiliation, they have runaway risk, or a history of it, they have a history of sexual exploitation, they have fire-starting behaviors, they have low IQ, or it's some combination of all of those things. And it's well known that providers willing to serve those children have incredibly strong negotiating power. If we find one, you better believe I'm going to write the check. I don't want them in a hotel and I don't want them in an office, and we're going to pay something regardless. I've asked my child welfare counterparts in other states if they're dealing with this, and it was unequivocal yes. In terms of health care, we don't like our kids on Medicaid, we don't like for them to have to wait for something. So even if on paper they should be covered for certain treatment or service, we may go ahead and pay for it, and then we'll just have our lawyers duke it out. But that is something that is certainly embedded in this particular graph. And those are not, tiny amounts of money. In October 2021, there were some federal changes that went into effect that capped how long we could use a certain federal fund source, it's Title 4E, to pay for an eligible foster child's placement at a group home. They wanted to curtail the use of group homes in favor of foster homes, which is a very noble objective and one that we agree with. But overnight, it created a $15 million hole in this budget for us, which thankfully, with legislative support and the governor's support, we've gotten some of those funds to cover that delta. Only about 35% of foster children are even eligible for Title 4E funds. And when we got those caps for how long we could even use the funds for an eligible child, we didn't have a bunch of homes that had moved into the model that would operate as an exemption, so really 4E for us has been tough to draw down the funds that we believe we should be receiving. In cases where we used 4E to fund a child's placement costs, we use TANF now. That's our $329 million block grant for the initial placement. So we'll do that, I think it's 6 months, and then we have to switch to state funds. Before those changes, there are some other reasons why 4E wasn't as readily available to us to pay for foster care as like some of our neighbors, for example, but those fixes require congressional action. I'm hurrying. So the federal shutdown dramatically worsened existing budget issues. We didn't have access to that $329 million TANF block grant. I'm going to try to just cover the last few things. Okay. I mentioned this last January. It is still the truth that transportation and behavior aids are the two fastest growing expenses in out-of-home care. If we were to just as simplistically as possible, explain what we believe are the three biggest drivers of our current shortfall in this program budget. It's, in addition to serving more expensive children, not having full control over managing those costs, it is, court-ordered services, providers having, extra negotiating power, which I'm not saying they don't deserve, right? But that is, those costs are going up, and, accessing health care for our kids is incredibly hard. There was recent analysis done by Professor Gibbs at UGA. So you can see like the kids that Georgia is serving in foster care that have emotional disturbance is higher, and it's increasing at a faster rate than the national average. So I said this before, we didn't want to terminate contracts, but we picked the ones that we think mandated better performance or involved duplicative services. We don't want to have to do service authorizations the way that we have, but we will if that's necessary. We, in my opinion, are still putting children first. I know that some people have asserted that some of those requests are not reaching me. I will take every single one of those personally if you tell me about them. We've created a dedicated inbox. It's integrity@dhs.ga.gov so that people can report concerns about access to services and provider performance issues. And so with that, I will take any questions.
Thank you, Commissioner. We've got quite a few questions, and members, I think there's 12 buttons pressed, and we'll try to get to maybe 4 or 5. I apologize because we got deadlines. Go ahead.
I'm gonna fire the first one if you don't mind, Commissioner.
Well, I had one, but go.
Well, you go ahead, Mr. Chairman.
Go ahead.
Age before beauty. Age before beauty. You go ahead.
You notified us about a month ago or several months ago, or you did even last year, of the deficit in out-of-home care. You told us last it was $86 million. With your adjustments and what you've taken place, can you give us some sort of estimate of what that deficit might be now?
So if we keep the terminated contracts terminated, we keep the service authorization change and how we approve them, we keep that intact. The best math that we can do is assume like a 25% reduction in costs, and I think that puts us at a little under, it's like $48 million would be the remaining deficit. And we have some unobligated TANF to cover some, but not all, because not even close of those expenses will be eligible uses of that fund source.
Tagging on his question, we are thinking alike. You said this, these kids should have been covered under managed care, under the Mayor Group contract. But you said you're paying for some of their, it sounded like at least medical transport.
Yes, so, we pay for transportation, for example, especially for kids that have really high needs. On paper, right, we should be able to use non-emergency transport that Medicaid covers and what the state pays to AmeriGroup in a capitated rate. I don't know of a time where we've gotten access to non-emergency transport, so we use our own providers for that to keep the child safe.
So thank
that's
you.
an example.
I want to preserve time. Give me an idea of how much you've spent out of the DHS or the DFACS budget, that, if you can estimate it, of what should have been covered by that provider, because we're already paying that.
My team's gonna get skittish. But so my rough math, if I'm looking at things that I know to be covered by the state Medicaid plan for parents, like low-income Medicaid is really what I'm talking about, and children who are eligible for Medicaid out of our custody, but certainly enrolled in Medicaid when they're in our custody. And I'll look at the things that we pay for.
If you need to
last fiscal year, I would say about $100 million. $100 million, I think, is a conservative estimate of things that we pay for in addition to what constitutes existing programs in other agencies.
Representative Vance Smith.
Thank you, Mr.
He
Chairman.
had his button pressed first.
Thank you, Mr. Chairman. Yes, ma'am, you mentioned new authorizations, and I know I'm talking about my area now because I have people in my area that offer those services. They received a letter in November. They could continue with the authorizations they had, but no new. Can I get with your staff and find out what's going to happen? Because these people are going to go out of business, I guess, and they've been in business since '02, which is 24 years, so.
Sure. I mean, well, I'll take all of those and personally investigate them. I will say that there's a certain group of providers that are totally reliant on a state contract. Then we have other providers that have diversified. They also fundraise because they're nonprofits, so they may be credentialed as a Medicaid provider. They may be a core provider through DBHDD. Those diversified providers, I'm not hearing from. It's the ones that are completely reliant on a contract from us to continue to exist.
And if one short follow-up, Mr. Chairman. So if there were issues that they weren't doing the services that they should have been done, have they been worked with before they got that letter in November, or you've sat down and you've worked with these people, hey, you need to improve in this area, so all that's taken place?
Yes, sir. For one of them for several years.
Thank you, Mr. Chairman.
Chairman Watson.
Thank you, Mr. Chairman. Thank you, Commissioner Gross. Just a couple of questions. The timeline on help me understand the deficit. I think you said $87.5 million relating to SNAP or TANF.
Okay.
So that was, you said the end of the fiscal year. Does that mean by June 30th?
Yes, so our projection for our out-of-home care, foster care budget is based on going through June 30th, this state fiscal year.
And we may be able to save 8.9?
No, so I think with our current cuts that we've had to make and authorization change for services, that we'll get that deficit down to 48.9 million. And that's making some key assumptions in reduction in costs, but that's probably our best math at this point. We never know how many kids enter custody. I mean, we never know what court order may come our way, so.
And is transportation one of those things we're going to look at?
Yes, so we did in fact change what we pay for transportation. We issued a memo, and I'll get you a copy of that.
And then you had said the biggest errors occurred in self-employment and residency. What do you mean by that?
Yeah, so going to like SNAP, food stamps, where the big beautiful bills, there's some big changes underway for that program. The state's payment error rate is a combination of underpayments that we make to people and overpayments that we make to people. So we'll take a sample of cases, we look to see what we got right, what we got wrong, and then there's a compilation of that amount, and it extrapolates over the total amount of people that get SNAP to determine the error rate. One thing that I and all my counterparts are pretty frustrated with, we hope can change, is we also get penalized for client errors. So if someone just doesn't tell us about some of their income, or they don't keep their housing, updated in our system, then we can be penalized for that. And it's hard to not, be penalized for something you don't know, perhaps can't know. Some of this budget will go towards system enhancements to tackle that issue.
I.e. cross-references and things like that?
Yes.
Okay, thank you.
Leader Hughley.
Thank you, Mr. Chairman. Madam Commissioner, there's been a report that it was $36 million in contracts that were cut. And my question to you is, are children being served, and are we undermining the industry that we need to support the services that we have to provide for those children?
So I do think that because of the change in process, right, it's a different way to go about getting services for children. I'm hearing reports that some kids need services or parents need services. I know of a handful of times where that's been actually escalated to me, and in those we've corrected them. So what I would say is I need to know about them in order to address them, to evaluate how we're handling our mandate to stay in budgetary compliance. But for the contracts that we terminated, again, it's not going to be frankly well received, but it is nonetheless the truth that those particular providers were either not doing what we had contracted for, or we could take the capacity in-house, or it was duplicative.
So that $36 million number is correct? Is that correct?
I don't have the number right in front of me, but I'm sure that's the right. So we cut what we have determined to be about $8 million. I don't know where the $36 million is, but I can talk to you about it afterward and see if I can give you clarity.
So one other question, that is, you said that most of the providers were affected were those that were completely dependent upon the contract with you. So if the services that they provide in many cases are specific to what your department needs or requires. So I don't understand your complaint about them.
Not at all a complaint, right? But when we're talking about budget, I think it's something that's important to know. And when I look at those providers for delivered services, and I look at, we're paying for a substance abuse assessment for a parent or a child. And maybe that judge has determined the parent can't pay for it, so that's why we are, right? That same assessment is going to be listed in the state Medicaid plan for adult coverage for low-income Medicaid. So that's what I'm doing, is I'm looking at a comparison of things that Medicaid could cover, should cover perhaps, versus what we're paying for with our own funds, and I'm seeing that there are ways to make improvements.
Finally, how did we get way off track before we knew that we were this far in the hole?
This has been an ongoing, a structural deficit, if you will. Now, we've had flexibility because we can use some of our federal fund sources. We've started getting reimbursement from AmeriGroup, for example, when we pay for psychiatric care that they have agreed to cover but can't find a bed. So, like, we've gotten $2 million from them on that front. But you know, the flexibility is waning because we don't have as much of some of those fund sources as we used to have. And you know, in the past, some of my predecessors would do things like delay payments to providers, so they create some cushion. Maybe at the end of the year, they've saved a whole month's worth, right? Because they've delayed over several months, a few days here, a few days there. There have been, you know, hiring freezes, things like that. And so it's been, I don't want to say sustainable, but it hasn't been as apparent that we're dealing with it.
Wood Robertson.
Thank you, Mr. Chairman. Commissioner Broche, I want to thank you for being here, and I do want to thank you for always answering my call and taking care of the problems I have in my district.
Sure, anytime.
Sorry to bug you so much. But you were talking about the issues that you're having in juvenile court with the court orders and everything else, that we're carrying debt that should not be ours. Has there been a formal attempt to educate the management of the juvenile system to make them aware, or is that something where y'all are just complying with court orders because a judge signed it?
You know, I've sent out some written materials, and you know, here and there. I've in this role 4 years, so a few times I've gone to a conference and sort of given like a Medicaid spiel of things that Medicaid would cover, ask parents to apply. You know, let's make sure that our children's Medicaid providers are coming to the table. You know, so there have been some attempts. I'm sure I could do more on that front, you know, and I'll commit to doing more. It's just, you know, we have a lot of judges, and you know, and they're entitled to have their own opinion of what is in the best interest for children that we serve. So we try to balance.
Members, this is going to be the last question. Our subcommittee hearings begin Friday. The FY26, AFY26 subcommittee hearings will be, or we have invited the Senate to join the House in these subcommittee meetings, so there should be plenty of opportunities to ask your questions. With that being said, Chair Lady Dempsey.
Right here. Thank you, Chairman Broche. I want to thank you for the work you're doing, first of all. It's hard. I think everyone in this room has just heard how hard it is and what a big and real challenge this is. Just to kind of summarize a lot of the messages that I've been getting this morning, there are, and we can talk about these on Friday morning at the 9:30 hearing when we start. That's going to be real important for everyone to pay attention to, and like Chairman Hatchett said, just to turn in or be here for. Right. I want you to be thinking about this, though, the deficit. Mm-hmm. And I think Chairman Hatchett asked the question with the 86 million. And if the contracts are kept terminated, we begin to see a reduction. A big reduction, there's no doubt, huge challenge. Mm-hmm. But what happens to those children and those families? And that's the concern that's overpowering this room right now. And you don't have to answer it right now. If you want some time to think about it and come with some of that for us on Friday morning, that would be great.
So I will say, for the contracts that were terminated, we're talking about a handful. So that's, I think it was 4 or 5. And how we're handling it is we have in-house capacity to do that level of work, or there's an existing program that we can better leverage. I'm not saying we're fully covering everything, but for some of those contracts too, what we found is we weren't getting what we bargained for as well. And so we may not have been getting the things. We weren't getting some of the things that we'd paid for. And, you know, there are a lot of opportunities there, but we haven't cut a bunch of other contracts. We just changed the process for how people get access to services.
Thank you, Commissioner. And there were probably 15 lights that were still blinking, so.
I'm around. I'll stick
All right.
around.
Couple announcements. I've been informed that the lunch that the Rural Caucus is providing and invited us to has been moved to room 403 in the Capitol. So if you would like to join them here in the Capitol at lunch, you're welcome to. Commissioner Toomey, you're up.
Thanks. Can this
good.
work if I, how do you want to do this? Because I don't want to, yeah.
This lock is keeping me from moving it too much. Like that. Does that work? Yeah, that works.
All right, let's get in the room. If you're leaving, leave, please. If you're staying, have a seat. All right, members, please have a seat. All right, everybody. Commissioner Toomey, welcome. Glad to have you back, and we look forward to hearing your presentation.
Yes. Oh, good. I think I can catch us up almost. Almost in 5 minutes, I can do my presentation and skip all the people I was going to thank, including the governor and you all for your support. When Will Bell and I started in 2019, we never anticipated the challenges we would find both budget-wise and, of course, a pandemic. What you're seeing today is a budget that reflects focus on priorities for core functions of public health long before we were worrying about any federal reductions, and some focus on core programs and new programs that you have supported. So I will make it brief to say thank you so much for your support over these last 7 years. Let me move on to a very quick run-through of our public health budget, because we are very unusual. And for those of you who haven't heard us talk about the budget before, public health is uniquely structured in Georgia compared to any other state in the country. And it makes it, in some ways, a challenge, but also an opportunity for us to focus some of our prevention efforts. Our state office supervises directly 18 health districts with physician health directors or non-physician health directors, and 159 boards of health in every single county. And so we are one of the few health entities that has a presence in every single county. Now, before you even ask me, or I can anticipate you're going to ask, what about workforce issues? You've heard from every one of the other health speakers about workforce. We have a challenge in hiring both health directors as well as nurses. It will continue. It was a problem before the pandemic. It's even more so now. And we are working with Chancellor Purdue as well as the technical colleges to see if we can do a career path to try to help encourage more engagement in public health by our young people coming in and growing those new public health leaders. Several of you have asked me, what are the core public health functions in all of your health departments? Some health departments have more services than others because of their size and location, but this next slide shows you basically the core services available throughout the state in every one of the health departments. And I think many of you are already well aware of those. I won't go through them. My personal favorites include environmental health, which is really unique to some of the work we do. And we are, from a clinical perspective, the authorities on things like tuberculosis, like rabies treatment when there's a potential rabies exposure. So there's some clinical issues that are uniquely public health expertise. I just very quickly, I would like to talk about our budget by funding source, because I think this is something that hasn't been well recognized. 50% of our budget, half of our budget is federally funded. And it continues to be. We had even more federal dollars during COVID. Most of those funds, nearly all, have been rescinded, but 50% still remains federal funds. These funds include things like the WIC program, that's half of our federal funds, the Women, Infants, and Children's Nutrition Program, and it's separate from other nutrition programs. It's not a welfare program, it's a health program. It's a nutrition program for mothers and babies and children. And that's something that we do in conjunction with our other child health activities. We also have all the issues related to HIV, STD, TB, again, federal funding. Much of our maternal and child health activities, federally funded. Looking at our state funds, the 50% of our state dollars from you into public health actually are directed to the counties, to county health departments. And so I think that shows you that we have a wide range of assets, but much of it focused at that service delivery at the county level. And so let me just move into some takeaways as we're trying to move quickly so you can get to lunch, is that half of our budget is federal, about half of our budget is redirected to grant and aid to the counties, and the federal funds pay for some of these core public health clinical programs that you have all recognized in your health departments, as well as emergency preparedness. I wanted to very quickly mention that emergency preparedness is something that we have done for many years. And public health often isn't recognized as being part of the preparedness activities. And yet we have been right there during hurricanes, we've been right there during other events, and you'll hear a little bit later, including preparing for world events that come to here to the state and to Atlanta. Getting into very quickly the governor's recommendations, we are very grateful to the governor for the one-time salary supplement. And this, again, is coming at a time when it's very difficult to recruit and retain staff, both nurses and clinical staff, other clinical staff. I want to point out that this $11 million is for both the state office staff as well as the Board of Health staff, even though they are technically not state employees. And you can see in the next slide how that's broken out into the individual programs that are very, a lot of different names, but again, they are the programs that you recognize in your health departments. But if you look at the arrow, the majority of this is actually going to the county health departments for the staff, because that's where the bulk of the staff, 4,000 some staff, are in the counties serving the people of Georgia under the direction of the state office. The other recommendation are those statewide changes that you all have heard from the other agencies, about $15 million total across our budget. Now, the last two changes in the governor's budget I wanted to quickly mention. Many of you have heard me talk about our home visiting program, which is unique in Georgia. It's something that we developed here in Georgia based on Georgia data, based on recommendations from a maternal mortality review committee. I will say that Dr. Burke, who has worked hand in hand with us in so many maternal and child health issues, was the founding father of this program, if I'm the founding mother, because he recognized that we are not going to improve maternal and child health until we get to that community level. And this program has already been expanded into 75 counties, and thanks to the governor's support, we will be able to expand with an additional 2 million to 96 counties. 19 of these counties have no birthing facility, have no OB services, and these will be able to fill in some of the gaps that we have in those high-risk counties to those mothers and infants who are at high risk of poor outcomes. And I'll be happy to talk more. I have a one-page, well, actually a several-page handout that describes this further with some outcomes that are really beneficial, that demonstrates that we have already saved lives of mothers and infants through a home visiting program that uses community workers as well as nurses to go into the home. So it's very cost-effective.
So, Dr. Toomey, the additional counties are the lighter pink counties?
Correct.
On your graph? Okay.
Correct.
I just can't read it.
Correct.
So, thank you.
Sorry. And just again, what's unique compared to some of the federally funded programs that you may hear about is that we actually provide clinical services, which is unique. We use community health workers as well as nurses working in partnership with our county health offices. We do care coordination. We do the actual service delivery where we can in the home. And we also make those linkages to all those other programs, both within public health and outside of public health, including literacy education that I've been working on as well, to be able to really provide a comprehensive, broad approach to improving the health outcomes for these mothers and babies and ensure that they can begin to lead a healthy life. Moving on very quickly to the last budget item relates to our public health laboratory. And you'll see on the budget sheet that this is a no-cost budget item, but really a major change for us. For those of you who don't know, public health has a large laboratory on Claremont Road, very near the VA hospital, and another one in Waycross, about 140 total staff, with 12 of those staff down in the Waycross area. But we are different than a Quest or LabCorp. We don't do those same tests. We do unique public health tests, and in many cases, we're the only ones that that provide those tests. Perhaps most significantly is the newborn screening. And newborn screening touches every child at birth. We provide a broad array of newborn screening tests, which we update. And I know many of you are well aware of this program and know more about this program than I have because of your engagement over the years. And it has been in place since the 1960s and has expanded as needs have expanded. We are the only laboratory authorized to do these tests in Georgia. And but there was only one place that we did them, and it was on the Claremont Road Laboratory, and with the help of DCH, we within that CMS grant have asked to have that capacity in the Waycross lab as well, so there'll be some redundancy as well as the opportunity to improve transport of those specimens to South Georgia. So a very important program. The Emergency Preparedness Unit, again, you probably have never heard of this. I've been working on bioterrorism issues frankly, since before 9/11, after 9/11 quite much more intensively. I recently told Chancellor Perdue the most exciting time I had during his administration was at the G8 when we were running our bioterrorism alerts on St. Simon's. But this is something that our lab does, and it does uniquely here in Georgia. And when there are world events like the Super Bowl and coming up FIFA, we have to prepare for that in a very proactive way as a silent partner in Homeland Security. And I have a one-page document describing some of those lab preparations. But I wanted to lay out some of the unique things we do that are different than other laboratories that you may go to when you see a physician in his office. But what we have done is that we've had 6 different lab lines of our budget, which made it very difficult to streamline, to ensure we have efficiency and effectiveness, to identify where there are some gaps in what we need. And the majority of our lab budget is state funded, although we do have a significant amount of federal funds too. And by consolidating into a single budget line, we'll be able to better focus our efforts, identify opportunities for improvements and efficiencies, and more importantly, when we get new funding in, like the CMS grant that will be coming, we'll be able to ensure that we're using that in the most effective way. So all of that, it describes what is really a zero cost but extraordinarily important change to our budget, a single line item that is, although it looks like it should have been easy, to consolidate 6 different checkbooks into one, it was a much more difficult task than I expected. And last but not least, the governor has included in our budget some bonds for our public health laboratory, some preventive maintenance for that laboratory, as well as some other buildings in Rome, the district office space in Rome and in Waycross. And although I didn't do it in 5 minutes, I almost caught us up.
Thank you,
And that's it, thank you. And thanks again to all of you for your support for these important programs.
Well, thank you, Dr. Toomey. Representative Al Williams.
Thank you, Mr. Chairman. Thank you, Dr. Toomey, for all you do, your presence in 159 counties, using your considerable influence throughout this state. And will you ask our co-chairs if they will cut the air conditioner off? I'm freezing to death.
I can't get my own husband to do what I ask him to do.
Well, you didn't have any questions. Now the whole board is lit up. Senator Davenport.
Thank you very much, Mr. Chair. Thank you for that report, Dr. Toomey, and thank you for always answering our questions when we call. But I do want to ask about a permanent health director for Clayton County. We know you before you assigned one, but we want to know when will we get another one. I know the interim is there, and when I call her for a community forum, she can help us. She can't do it all, but
Sure.
then she said there was no one else in some position. They hadn't hired anyone. Is it because of funding, or what's the problem there?
Sure, I think it's many things, and part of it is simply workforce availability as well as funding, and there are other opportunities, and I'm hoping we can grow our own public health leaders over the next several years. But you may not be aware, I was down there meeting with your county commission chair, and we had a very good meeting. I've been in touch with her over the last several weeks, and we plan to be meeting again in this new year. And so we're currently working on that, and I'll be working with the Board of Health down there. I know this is, I think when I first met you, this is what we were talking about, and sadly, 7 years later, we're still talking about it, but hopefully, I think we are on the right track, and I really appreciate the support of the Clayton County Board of Health.
Thank you.
Chair Lady Taylor.
Thank you, Mr. Chairman. And to the Commissioner, I want to take this opportunity to thank you and your staff for what you do. Our study committee this past summer and fall had the opportunity to see the importance and what all the departments do. And again, I just want to express our gratitude and let everyone know how important the work that you do every day is. Thank you.
Oh, thank you. Thank you so much.
Representative Glaze.
Thank you, Mr. Chairman. Thank you, Commissioner Toomey. I wanted to ask, in the DPH report around cancer control, could you share a little bit about prostate cancer? Because actually we're seeing that go up, and we're seeing the deaths of men in Georgia die from this disease that is preventable. And so it looks like we're about 11 to 12% deaths from the over 10,000 cases in Georgia. We've done a lot with women and breast cancer, pap smears, and cervical cancers, so we've fought and done a great job around that. How are we going to continue to do work in the area of men's health around prostate cancer?
No, I think that's an excellent point, and I think that you are absolutely right. In public health, we tend to focus on women and children, and have done an excellent job in the cervical cancer, have much more to do with our breast cancer programs. But I don't know, I don't remember what is in the report now on prostate cancer, but I work with the groups that have put those reports together, and I'll be happy to get back to you about some potential ideas. For the first time this year, there was children's cancer in that report, and that was because of some advocacy around children's cancers as well. So we're doing some new things and taking a different set of eyes to this problem as well. But I will also continue to work with DCH because they will be a critical partner in anything we do to do screening and treatment for men as well.
I'd love to hear the follow-up.
Thank you for being concerned about the men, Representative Glaze. Senator James.
Thank you very much, Chairman. Thank you very much, Dr. Toomey, for all that you do. We've known each other for a long time, but I have been looking for a statement from you about the measles. It's almost like an epidemic now. And for the little ones and adults are getting measles. Also, some of the things that I guess CDC is not covering anymore, did they come to your department? Are you looking at things like autism and dyslexia and things like that they had departments looking at?
And we have had for a long time an autism program and we work together within our child health program, and that will continue and has continued.
Thank you.
And as far as immunizations, the state set the immunization rules. Our immunization schedule is still what it has been, and so we recommend, and those vaccines are available, and insurance still covers them, and so that is the message. What I didn't know until I looked into this further is that the majority of vaccines here in Georgia are actually given by physicians, not by public health. And I think that's important, even more important than for me to work in partnership with physicians across the state to ensure that we are working together to ensure that every child that needs a vaccine, every parent that wants their child to have a vaccine has access to them.
Well, thank you very much, and if we can do anything, please talk to us. And
thank you. Appreciate it.
We'll ask our chairman to please fund it. Thank you.
Thank you, Commissioner Toomey. Perhaps maybe we could put some funding in the laboratories for PSA tests.
Interesting. Or a contract, because we don't, others do that, as you know.
All righty. Thank you for helping getting us caught up a little bit. Thank you.
Thank you so much. I appreciate you all.
Next up is Commissioner Ross with the Department of Veteran Services. Commissioner Ross, it always takes a little while to turn the room. right, seems like the roar has gone. Commissioner Ross, the floor is yours, and welcome.
Thank you, Chairman Hatchett. Thank you to this august group for having me here this morning. It is my pleasure to be here representing 1 million veterans here in the state. I know many of you have seen the number 700,000 that the VA publishes. That's actually the folks tethered to the VA. They say that's about 60% accurate. So we are a very large constituent base for you, and thank you for all that you have done for our veterans across the great state of Georgia. Going over our budget, you can see that we're on page 371 to 376 of the governor's budget. And I'm not going to go into too much detail on the fundamental changes across the programs that are statewide adjustments, but you can see that we've got the $2,000 supplement for personnel across all 4 of our programs. And I'll go into more detail in the next 2 slides, but we were notified in December that we had a $10 million grant opportunity to finally build the Augusta Veterans Cemetery. Yeah, 25 years in the making. And since we had already submitted our budget and we're not yet in the budget cycle, the Office of Planning and Budget asked us to propose the reprogramming of funds to meet the necessary design and architectural costs that would allow us to have a successful grant submission this summer. The only program that had the funds happened to be our War Veterans Homes, so in the governor's budget you will see a reprogramming of $800,000 from the homes to the cemeteries, and I'll go into more details in the next few slides. So to provide some context for those of you who have not been on this roller coaster about the Augusta Cemetery project, again, it's been 25 years in the making. In prior years, the state appropriated $1 million to meet the matching fund costs for environmental and architectural plans, but we were told that the VA would never have enough funding for this project to ever see the light of day. But sure enough, the National Cemetery Administration received $150 million, and that allowed us to go forward with this project. And so the majority of the Central Savannah River area, or CSRA, Augusta was previously considered covered by Fort Jackson as well as Milledgeville. VA has a 75-mile radius that they say is a covered veteran for cemetery purposes. But in this historic budget year, we were notified that we had the opportunity for a $10 million cemetery project fully reimbursed by the federal government. But we need some upfront costs, not just for the $800,000 in architectural plans, but in addition of $200,000 for the removal of debris due to Hurricane Helene. The city has agreed to demolish several buildings. It's in the process of purchasing some contiguous land, which I'll show on the next slide, and along with road improvements and assisted with needed easements. I must thank, quite honestly, DBHDD for identifying through state properties a portion of their Gracewood campus for this cemetery, and we do anticipate it's going to be a medium-sized cemetery serving more than 66,000 veterans in that area with over 700 anticipated burials every year. Since this is now a fast-tracked program, you can see that in our FY25 budget ask, and I will get to that, we're requesting funds to bring aboard a cemetery director to be part of this design project and to ensure that they're trained not only through our cemeteries in Milledgeville and Glenville, but through the VA. And they need to be in place to be able to hire the rest of the team, which will be FY28. Although there are common features in our Georgia state veteran cemeteries, such as Carillon, which is your bell tower, or your service flags, these aren't funded by the VA. So we will be working with the CSRA to assist them in raising funds for these key ceremonial elements. So continuing with the amended at 26 budget, we are requesting the $1 million previously in our departmental budget to be restored for this project without having to reprogram funds from the Veterans Home Program. So we still need these funds for the homes. As you know, we stood up the subacute therapy unit this past fall. We're still onboarding staff, still opening the additional beds, and we need to admit patients up to our fully funded amount. So we would request that $1 million be returned for the Augusta Cemetery project. I'm going to discuss the Georgia War Veteran Homes in a few slides, specifically for the 27 budget. However, while I'm able to talk about this incredible opportunity to support our veterans in the Augusta area, I'd like to show you a brief overview of what it will look like. So here's the Gracewood campus. You can see kind of that cutout. That's what the city is looking at to purchase for this project. You can see where the debris is, see where some of the buildings currently are that need to be demolished. The plan is to have the entry to the cemetery right past that little divot where there's a culvert. And so I've seen some initial designs. Like I said, we need to have this fully designed or at the 95% design by summer to then apply for this grant at the end of the federal fiscal year. So very excited about this finally coming to pass. The next request in the amended 26 budget is for our community referral system, or the Unite Georgia project. In the governor's budget, we received just over $1.7 million for this contract, but this number was actually based on last year's amount, and we had additional ARPA grant funds that actually matched with these funds to fund the entire grant for this closed-loop referral system. So we have a shortfall of about $2 million. Unitas is on statewide contract, and we use this platform exclusively to provide additional resources to our military, to our veterans, their families across the state. We have over 800 partners that aid in almost anything you can imagine, from healthcare, employment, education, childcare, financial assistance, etc. And I know most of you will probably say, well, what's the return on investment? Let me show you. From November of 22 to January 18th of this very year, our Unitas coordination team, which solely serves our Georgia folks, have outreached to almost 5,000 veterans, along with 18,000 touch points. Why is this important? Those veterans tend to be in our rural communities where they're in resource deserts. And so this team, through the Unitas contract, actually goes out and finds resource providers. So our team, the GDVS team, along with our partners with the Office of Workforce Development and your vector centers, have served over 10,000 veterans, identifying over 16,000 needs with almost a 91% acceptance rate of referred cases in less than 2 days. With the resolution of the veterans' needs in less than a week, and a case closure rate of almost 95%. This is a nationwide program. We are leading the nation with our acceptance, resolution, and closure rates for your veterans. What I also wanted to point out is at that bottom corner, those 780 veterans we proactively engaged, we're in our 11th proactive campaign. So we reach out to veterans who have high social sufficiency scores, so high needs, before there's a crisis and before they reach out to us or a trusted partner. This allows us to get upstream of needs to include our just concluded campaign of loneliness. We know that that's a key campaign during the holiday season, which we connected veterans to a variety of groups for social support, as we know loneliness is a key indicator of suicidal ideations. So the referral system is truly impacting veterans' lives, and we request the full cost of the contract to continue to meet the myriad of veterans' needs beyond just VA benefits. So now I'll move over to FY27. We only have 4 programs and only one additional ask. So for our admin program, we have the standard statewide adjustments for insurance, technology, Georgia at Work, state health benefits program. So in the interest of time, that's across all 4 programs. So I will jump ahead. I already gave you a preview, so for our cemetery, we do need a cemetery director for the Augusta Cemetery. To quickly review the timeline, again, 95% architectural solution is due this summer, and we'll know by the end of the federal fiscal year that we have those $10 million in grant funds, providing we meet all the deadlines, which the team is on track to do that. And we anticipate the rest of that construction will take a year, which is why in '28 we will need the rest of the staff. So that's our one ask That's a $60,000 salary with a 70% fringe rate. So there are no changes from the governor's budget for the War Veterans Nursing Home, and I truly appreciate the increase in state appropriations to retain the same number of funded beds that we have now. Additionally, we have no changes to the Veterans Benefits Program. The two additions in the governor's budget, other than our statewide adjustments, are for increases in salary for our veteran service officers and our appeals officers. So the Department of Administrative Services, their human resources agency, reevaluated the duties of this highly specialized positions, and in the governor's budget, we're receiving just over $258,000 to bring these legal coded positions up to their minimum wage rate. It doesn't provide an increase for everybody in those job codes, just those that are under that minimum rate. So just to highlight what this amazing group of veteran service officers and appeals officers accomplished just this last year, they were directly responsible for $5.2 billion in compensation and pension to Georgia's veterans or their survivors. This expert and accredited assistance with the VA process was provided at no cost to Georgia's veterans or their survivors, and we actually rank 5th overall in compensation and pension, even though we're 9th for the number of veterans in the state of Georgia. So we're punching well above our weight class. For the appeals team, they were responsible for over $40 million in retroactive payments to Georgia's veterans. So talk about life-changing events for these veterans, and these funds come right back to Georgia's economy. Additionally, we had requested 2 new positions because the Savannah region, with its over 40,000 veterans, along with about 5,000 transitioning military, has a population that requires an additional couple of veteran service officers, so the governor in his budget gave us 1 additional position. So just to recap, you can see the only additional request in the 27 budget is for that cemetery director. And last year, we also requested funding as a capital project for a new veterans home in South Georgia. As a reminder, the state would fund 35% of the construction cost. The federal government funds 65% of the construction cost. And so here really is the need. Based on the latest estimates from the architectural team, the cost for a 120-bed facility, which is considered the ideal size to maximize beds while ensuring adequate staffing, would cost about $100 million. So that's a $35 million ask for a capital project in either the amended budget or the big budget. Last year, you were very generous and provided additional funding for the 40 beds, bringing us up to 185 funded beds in Milledgeville. Just to give you a highlight of where we stand as far as our residents go, Augusta is at 124 funded beds and is working on about 16 applications for admission, and those will be filled when beds become available. Milledgeville actually can admit 17 more patients based on the funding, and the team is reviewing 8 applications right now and working with an additional 12 families for admissions in Milledgeville, which would also max out our funded beds. So even with the additional funding in Milledgeville, we're still 1,500 beds short based on what the VA says we should be providing to our veterans. And it'll take about 4 years to complete and admit folks into a new veterans home, making over 50% of veterans over the age of 65, compared to just 15% of Georgians. There is a need for skilled nursing care for Georgia's veterans in a new home, and I've committed to OPB and the governor to use another model for funding whereby the enduring operational costs for a new home are not passed on to the state. So if funded, this will be a one-time cost for the matching grant and then some upfront costs until we begin receiving revenue from the VA and other third-party sources. And so while we were looking for a home in South Georgia to geographically meet another market demographic, I will say the Albany and Dougherty County community has really stepped forward and is committed to this project. Albany, of course, is home to Marine Corps Logistics Base Albany, our active duty Marine military installation. Over 25,000 veterans live within a 50-mile radius, so we know there's a need, and the Live Learn program through Albany Tech is a great source for staffing availability as they produce all the nursing staff that we would require for this new home. So when you superimpose this 120-bed facility that would be just north of Albany Technical College and Phoebe Putney Hospital, this is the proposed site, also known as the National Guard Armory. The Albany Dougherty Development Authority has executed an MOU with Dougherty County to provide this site to us for this new skilled nursing facility. And this is about what those 120 beds would look like on that site. So I know you've heard this from me before, but we need to expand veterans' long-term care because our veterans' needs are changing. I know I've been asked, why fund a new home when we still have capacity at our existing homes? Right now, that's 17 beds in Milledgeville is our capacity. And I do want to address, in all transparency, I know I've talked to many of you one-on-one, happy to take questions, but there are no systemic issues at our Georgia War Veterans Home in Milledgeville. Well, we, of course, have issues every skilled nursing facility has. We're dealing with a medically frail population, cognitive decline, bowel bladder issues, among more severe clinical diagnosis. However, when somebody identifies an issue to us, the contractor or our team, we fix it. And so by any metric I could find to benchmark either off of other skilled nursing facilities in the state of Georgia or the national standards, I'm going to give you a scorecard. So we've talked about the need of our aging veteran population compared to how it ranks with Georgians. But our staffing, and though you'll hear everybody say nurse staffing is an issue, anybody in healthcare will tell you that. But our staffing is considerably higher than other skilled nursing homes. And while there is turnover across the board, our attrition rate is significantly lower. You can see that for similar sized facilities, so 100 beds or more, our turnover is just over 33%, and the rest of the state is about 53%. Also, based on survey results back in July of 2023 and this past October from the Department of Community Health, which is one of our regulatory agencies, we had back-to-back deficiency-free surveys placing us in the top 10% of skilled nursing facilities in the state. We have a gold seal from the Joint Commission, which we voluntarily participated, and this summer they recognized Milledgeville's home as meeting the highest of their standards. This inspection occurs every 3 years, and we had it this past October. Our VA survey, which occurs annually, we received only minor deficiencies and were reaccredited back in July of this year. It should be noted that unlike other skilled nursing facilities who have part-time physicians or nurse practitioners who visit the facility a couple of times a week, Milledgeville has 2 physicians and 4 nurse practitioners to include a psychiatric nurse practitioner on site full-time in the facility. So when you look at, let me do my build. When I printed it, I didn't know there was a build. I apologize. There we go. When you look at family satisfaction this past year, 94% of our families were satisfied with the care in Milledgeville, compared to 86 nationally, which was the only benchmark I could find. For food preparation, always something that's of interest in a skilled nursing facility. Courtesy of you all, we opened a dining facility back in September of 2024. And this summer purchased heated and cold food carts to make sure that the temperature was appropriate for all of the food for all of the neighborhoods. All 4 of our dining facilities actually received 100 on their health inspections this fall. We know that falls are always a huge concern in skilled nursing facilities. But through concerted efforts to include patient and staff education, we increased our observation and reduced our fall rate by almost 14% this year, and that is an incredible metric. Courtesy of the state and the VA, along with a portion paid by some residents that are not receiving VA disability compensation, the cost of care provided to our veterans is about $12,000 a month per veteran. That is what the state and our federal government is supporting. Some additional ways we are different from most skilled nursing facilities is we provide transportation to and from VA medical appointments, we provide dental care, mental and behavioral health, offer physical, occupational, speech therapy on site without our residents having to go to a rehab facility. In most skilled nursing facilities, these costs are borne by the resident. And across the board and on every metric we could objectively measure, we exceed the standards in every category. And if there's a metric I can capture and benchmark against with other skilled nursing facilities, I would be happy to do so. Again, I would be happy to address any questions you have. I appreciate the support you've given Georgia's veterans and our department over the years, and I look forward to taking your questions. Mr. Chairman.
Thank you, Commissioner Ross. Well, we just had two lights and both of our Veterans and Defense Chairman. So Chairman Bonner.
Hey, thank you. Thank you, Commissioner. Thanks for all you do and your department does. Just a quick question. You mentioned the fact that Georgia only has 2 war veterans homes. For a veteran population our size, how many should we have?
At 120 beds and needing 1,500 beds, I mean, you're talking 10 plus. I'm happy to start with 1.
Great, thank you.
Chairman Harbison.
Thank you, Mr. Chairman. Commissioner Ross, thank you very much for what you do for the veterans in the state of Georgia. I know it's a tough job. At the same time, can you talk briefly about staffing and security at the facility and the problem you're having with staffing, if that's a problem, or how you see it, if you don't mind?
Yeah, so we have the challenge with staffing nurses and CNAs just like every other healthcare facility. If you saw on my metrics, we've turned over about 1/3 of that staff over the last year compared to other organizations that have turned over half of their nursing staff. So while skilled nursing and finding skilled nursing and CNAs is a challenge, Milledgeville is a fairly rural community. We seem to be doing a good job. I mean, our staffing levels are 5.0 compared to the CMS standards, which is 3.0. So we're meeting the demand. And I know we are rolling out some additional programs to help with staffing across the campus. I'm talking specifically Milledgeville because I know that's where I get most of the questions. We do have the home in Augusta. We're able to meet the staffing requirements. Our contractor on site has brought on contracted nursing to help with that as we ramp up to fill the subacute therapy unit and those additional beds, the 17 that are remaining from the 40 that you provided funding for. So I hope that answers your question, Senator Harbison.
Yes, just one more question. I think you probably geographically misspoke just a little bit when you talked about the War Veterans Home coming up. That's Columbus, not Albany, right?
Let's talk.
Was that a question? Chairman Yurda.
Thank you, Mr. Chairman. I just want to express my appreciation to what you're doing and bringing that facility down to Albany, Georgia, and Southwest Georgia is much needed. That will be great for the veterans and their families as well. So thank you.
Yes, sir. Thank you for that.
Commissioner, I got a question. I support your efforts to make sure we have enough beds. How much money does it keep? You showed us the homes you have, 209 beds, and that one. Yep, that's the string right there. So what would it take, what funding would it take to get the additional 131 beds online? And I get it, opening a floor is harder.
It is, because you have to bring staff and have enough patients to pay for that staff for a floor. You're going to make me do public math, Chairman Tillery. Goodness. It's about $400 per patient per day. About half of that is borne by the state. So if we're talking $2,000 a day? I can get you math, but it's a considerable amount.
I understand that everyone's not going to want to be in Milledgeville.
Correct.
Get that part. But right now, that's where our beds are. So it seems like it would be more cost-effective to get those up as we're moving forward on more homes. So I want to...
Yes, sir. As far as capital projects, I will tell you that we do have 2 buildings, the Wood Building that's been partially renovated, that we do need to fully renovate the building, and our Vincent Building, which has not been renovated, to bring them up to kind of standards for skilled nursing facilities. We would need renovation funding for those to really be able to attract a population in
Could you get us
Milledgeville.
those numbers then, if you don't mind?
I can get you those numbers, yes. We have those.
Thank you, Commissioner Ross.
Thank you,
Appreciate
sir.
all you do. Thank you. Next up is Commissioner Rebecca Sullivan and State Accounting Officer Geralda Hines.
Thank you. You ready for me to get started?
I am, but let's let the roar die down just a minute so everybody can hear you. Well, they're going in and out, and they're being kind of quiet, so go ahead.
Thank you. Good morning, Mr. Chairman, members of the committee. I'm Rebecca Sullivan. I'm the Commissioner at the Department of Administrative Services. Thank you for the opportunity to appear before you today. It's my honor to be here. I will start by saying that we are not here to ask for any additional funding for any of our programs outside the statewide salary adjustments for the recommended supplement, but we do appreciate the opportunity to be here to share updates on how DOAS has managed to maximize the investments that you've already made in our programs over the past several years. I would like to take this opportunity to thank the General Assembly and the Governor Kemp for those strategic investments that you've made, particularly in our risk management programs and in the state's workforce. I'll begin with a brief update on the major risk management programs, report on their program performance and financial position, and then I will conclude with several encouraging highlights on the state's workforce. And then after concluding my presentation, State Accounting Officer Geralda Hines will step up here and we'll give you a quick update on the NextGen project. I only have one recommendation to speak to today, and that's with respect to the risk management program. Governor Kemp is recommending a reallocation of approximately 15% or approximately $15.7 million of the annual workers' comp billings to the property program. This recommendation aligns billing revenues more appropriately with the excess insurance and claims costs within each program. DOAS fully supports this recommendation, and I'll walk through the data supporting that adjustment over the next several slides as I give you an update on the risk management programs. Before we walk through the data illustrated on this slide, I would like to share a brief overview of the workers' comp program, which DOAS oversees for the state of Georgia, and provide some context on its current financial position based on the investments that you've made in this program over the past few years. This program ensures that state employees who are injured in the course and scope of their employment receive appropriate medical care and wage replacement benefits. This program provides coverage for approximately 132,000 state employees, representing nearly $8 billion in annual payroll. DOAS self-insures each workers' comp claim up to $5 million per occurrence and maintains a commercial excess policy to cover claim costs exceeding this retention level. As illustrated on the graph on this slide, the workers' comp programs, billings, program costs, and trust fund balances have evolved over time. And the earlier fiscal year shown on this slide, premium billings and program costs were closely aligned, resulting in a relatively flat fund balance. In the amended FY22 budget, and again in the amended FY24, the Governor and General Assembly made strategic investments in this program, and because of that, we were able to use state appropriated funds to settle long-standing claims. That's reflected in the total program expenses shown on this graph. So those settlements, along with some targeted efforts and return to work initiatives, resulted in a reduction of approximately $30 million in fixed program costs. So at the same time, billings remained relatively stable, and so these actions combined help improve long-term claims management for the program. So as a result of all these things, the trust fund balance has grown significantly, reflecting lower fixed costs and the sustained impact of program management actions. Looking ahead, we'll continue to use the available funds to settle claims and manage long-term outstanding obligations within this program. The projected trust fund balance remains strong, supporting the Governor's recommendation to realign billings across the programs. I'll now explain how that shift benefits the property program. This graph here illustrates the property program's billing, program cost, and trust fund balance over time. From FY16 through FY23, program costs consistently exceeded billings, resulting in a steady decline in the trust fund balance and a negative position in FY23. So this trend reflects increasing claims activity and rising cost of excess insurance during that period. In FY24, billings were increased by approximately $30 million to better realign revenues with program risk and cost drivers. As a result, the trust fund balance has rebounded. But looking ahead to FY26, while program costs remain elevated, an adequate trust fund balance really is critical to address variable costs arising from catastrophic events such as Helene. So I do think it's important to note the magnitude of this state's property program. We provide insurance coverage for nearly 14,000 state-owned facilities statewide with a total insured value of approximately $50 billion. We self-insure the first $10 million of each occurrence, so we're retaining significant risk before the excess coverage attaches. Commercial insurance provides coverage up to $1 billion at an annual cost of approximately $40 million. So excess insurance cost does fluctuate annually based on market conditions and loss experience. So we're not requesting any additional funding or increased billings in this budget cycle for the property program, instead just requesting the proposed reallocation of $15 million from the workers' comp program to the property program to help strengthen and stabilize that and really better realign billings in a manner that reflects the state's exposure and long-term sustainability. I know we're a little bit behind. For the sake of time, we are not requesting any changes or increased appropriations in the liability program, so I'll run through this real quickly, but I do want to point out for you that the trust fund balance in the liability program is at a much more acceptable level, strengthening the state's ability to manage claims and address our long-term obligations in that program. Now I'm going to shift quickly from risk management to a quick update on the state of Georgia's workforce. So the next several slides are going to highlight some key data related to employee turnover, recruitment, and compensation, and how recent policy and budget decisions have produced some measurable positive outcomes. This slide provides a snapshot of the state's workforce at the end of FY25. I will share that the state's workforce, I think, is overall better positioned to deliver services than it was just a few years ago. Agencies are maintaining more stable staffing levels with fewer disruptions caused by vacancies and turnover. And from a policy perspective, I think the key takeaway here is not simply improved performance metrics, but increased workforce stability, allowing agencies to focus on service delivery rather than continuous backfilling of positions. I'm happy to report that the state's overall turnover rate for full-time employees was down to 17.3% in FY25 from a high of 25.3% in FY22. As Governor Kemp highlighted in his State of the State address, that is more than a 25% reduction. Voluntary turnover has declined to 12.2% in FY25, down from a high of almost 20% in FY22, representing the lowest rate in at least a dozen years. The green bars just add to this graph demonstrate the median annual compensation for full-time executive branch employees. Since FY 2020, median compensation for full-time executive branch employees has increased by over $15,000 or 39%, while the overall turnover has declined from a height of 25.3% to 17.3% during that time frame. I think that this trend suggests a correlation between the decrease in the turnover rate and an increasing compensation. So key investments made by the General Assembly and Governor Kemp and our state workforce have clearly paid dividends, and we are very grateful for those investments. We also fully support the governor's recommendation for a one-time supplement of $2,000. This slide breaks down turnover across generations. Turnover has declined for all generations of employees, including Gen Z and millennials, which historically experience the highest turnover rates. The Gen Z voluntary turnover rate is down from 76.4% in FY21 to 28.4% in FY25. And the millennial voluntary turnover rate is down from 28.3% in FY22 to 13.8% in FY25. Millennials do continue to represent the largest generation currently within the state workforce. Together, millennials and Gen Z make up almost half of the workforce. Retaining these employees, of course, is critical to reducing the cost of recruiting, hiring, and onboarding new staff, and retaining the valuable institutional knowledge and expertise that is really critical developing a pipeline of future leaders. I'm also happy to report, while at the same time turnover has decreased, the state's recruitment position has improved. The state's been posting fewer jobs each year since FY 2022, but application volume has increased each year. The application to job ratio has increased from 20-1 in FY23 to 32-1 in FY25. It's a marked improvement. Looking ahead, the focus is really shifts to sustainability, and this is where Georgia at Work, the state's new enterprise human resource platform, will become critical, and you're going to hear about that in just a few minutes. But before we move on to NextGen, I would like to express our appreciation to an opportunity to provide these updates and the appreciation for the continued confidence that you all have placed in DOAS. Our partnership with the General Assembly and our colleagues across state government is really essential to fulfilling our mission to be a customer-focused and collaborative partner and a responsible steward of state tax dollars. Mr. Chairman, I'm happy to address any questions anyone might have before we move on to NextGen.
I don't see a question.
All right, I'll
That
keep
means
moving.
you covered it all.
All right, we'll keep moving.
Good news. Good news doesn't have any questions.
Here we are, still up here. The NextGen project. So this project is implementing the state's new enterprise resource planning system, which is named Georgia at Work. We're going to share just a little bit about this project, its complexity, and how it's going to benefit state operations. State Accounting Officer Hines is going to provide an overview of the project activities, what we've done to date, and on project costs and budget-related changes specific to the State Accounting Office. In summary, well, there's my agenda. In summary, what is NextGen? It is an enterprise-wide digital and business transformation initiative that moves the state from a 25-plus-year-old PeopleSoft environment, which we call TeamWorks, to a modern cloud-based single enterprise platform for finance, human capital management, and procurement. Georgia at Work is going to streamline finance and human capital management processes, reduce the number of systems that agency end users must learn and navigate to perform their business functions. It's going to improve usability, create efficiencies across agencies, and allow better visibility into the state's data. And we're really excited that this is going to deliver some modern functionality by automating workflows and approvals to improve consistency, transparency, and timeliness in state operations. It's going to provide enhanced dashboards and improved analytics to strengthen financial and workforce decision-making. This is going to help agencies and policymakers anticipate staffing needs, monitor turnover and vacancies in real time, and evaluate the impact of workforce investments more effectively, providing better data to support workforce planning, budgeting, and policy decisions. It's going to modernize and streamline the recruitment and onboarding process, making it more user-friendly from job application on throughout the process, and it's really going to, we believe it will help improve the state's ability to attract and retain talent. We're very excited that the system is going to establish a statewide learning management system, expanding opportunities for agencies to share and access training resources statewide. It's also going to automate procurement, reducing manual effort, centralizing and standardizing contract creation and storage, and allow for enhanced reporting capability on state spend. And finally, agencies will be able to access real-time data, enabling them to respond more quickly to legislative inquiries. Overall, Georgia at Work is a critical tool that will help the state manage its workforce more efficiently and proactively, and it positions the state for long-term operational efficiency, improved data-driven decision-making, and a stronger, more sustainable workforce. I did want to point out real quickly how complex this project is. More than 200 agencies are included within its scope. To support this effort, we have relied heavily on subject matter experts from those agencies who make up a project team of over 350 state employees. They're contributing critical operational knowledge and expertise to ensure that this system is going to meet the needs of employees and the roles across the enterprise. This project is made up of more than 30 work streams, each focused on specific business areas. They include HR teams focused on compensation, benefits, time tracking, and payroll, comprehensive finance work streams spanning billing, budgeting, grants, and asset management, and procurement work streams addressing purchasing cards, requisitions, POs, and supplier management. To support the statewide operations, this system includes 402 integrations, connecting Georgia at Work with external partners such as banks, the IRS, benefit partners, and more. Approximately 78,000 employees and 125,000 vendors and external users will utilize this new system in some way. So it's quite a complex project and a huge undertaking, and I'm going to turn it over to Officer Hines to talk a little bit more about the activities that we've done to get to this point.
Thank you, Commissioner Sullivan, and good morning again to Chairman Tillery, Chairman Hatchett, and members of the committee. Again, my name is Geralda Hines, and I'm the State Accounting Officer. So I'm going to talk a little bit about some of the project activities that we've done so far and where we've been. We started this project in September of 2021 and selected a software vendor and system implementer in 2023, and the project kicked off in December of 2023. Since then, our project team has been very busy, and as you can see through our roadmap, a lot of activities have taken place. I'll point out a few. We have worked to establish a regular and robust communications across the project, starting with obtaining a point of contact at each agency to help coordinate the completion of agency activities, disseminate information throughout their agencies. We have a monthly newsletter, and in 2024, we created and launched the Georgia at Work system name and logo. We have hosted several agency previews around the state where agencies were invited to preview the system with demos, ask questions, and provide feedback. We also established a NextGen change network with representatives from each agency who are preparing their agencies as we make this transition. Our communications team has sent over thousands of emails across the enterprise to our stakeholders, agency heads, CFOs, HR directors, IT, procurement teams over the course of this project, keeping everyone aligned on the task, project updates, shareholders meetings, and ongoing activities. Last year, we shifted our go-live date from April 1st of 2026 to July 1st of 2026. The major factor here is in fine-tuning the needs of GDOT, as their business needs and processes are very complex and require some specific customizations to meet federal requirements and a federal certification. GDOT will go live separately, and their team is working diligently to get this, the project team together. I want to point out agencies have been very involved in various activities to prepare them for the go-live. Payroll compare and testing to ensure the accuracy as it relates to their data. Additionally, we publish an agency readiness checklist so that agencies know what to expect, their deadlines, and resources needed so they can complete their task. Our partnerships with the agencies has been extremely valuable to the success of the project, and agencies are required to sign off on different activities to ensure that their data is correct. So a little bit about the project cost. As the project cost, the initial funding for the project of $108.4 million was appropriated to the Technology Empowerment Fund, which is overseen by the Georgia Technology Authority. Our projected total expenditures is $132.7 million with a variance of 24.3. We are not asking for appropriation as TEF, interest earnings, and reserves with the State Accounting Office and the Department of Administration will cover this variance. In the State Accounting Office budget on page 82 and 83, there are two items. The first item, the governor is recommending an amended FY26 to provide one-time funds to continue TeamWorks ERP support for GDOT due to the extension of the agency's Georgia at Work implementation timeline, $10,379,589. In fiscal year 2027, the governor's recommendation is to increase funds to reflect an adjustment in ERP billings to reflect projected costs of operating and maintaining the statewide, which is going to be the Georgia at Work system, for financial and human capital management. There's a yes in the book, but the amount for this is $3.5 million. So a little bit about some of the activities that are coming to get us to our go-live date in July 1st of 2026. First, we're going to continue to do testing. We're conducting our final rounds with selected agencies to confirm some finance and other processes that have been recently completed, ensure the accuracy of data integrations, and confirm reports are producing the needed information to inform business operations. Second is training. We will begin our training on March 2nd to ensure that everyone's available is ready for the first day as we deliver this training in waves based on roles and responsibilities. And then cutover. We're going to be preparing for our cutover, so practice makes perfect. To ensure we have documented and necessary steps to make this transition as smooth as possible, this exercise will also allow our team to confirm backup plans and mitigations just in case we have any issues. This is one of the largest IT projects in the state, with over 121 agencies participating. Significant communication campaigns will be launched to keep stakeholders informed of the cutover activities and progress, and then go live. The finish line for almost 5 years of analysis, design, configuration, testing, retesting, and confirmation. This will be a culmination of the journey to bring this transformation to life. Now, at this moment, I do want to thank Governor Kemp, Chairman Tillery, Chairman Hatchett, the General Assembly, and also our project staff at the State Accounting Office, the Department of Administrative Services, and all of the agencies that have participated in this journey. We do not want it to go unnoticed, again, that, as Commissioner Sullivan stated, we had over 355 state employees participating in this project. And although we're not done, they have done a tremendous job to get us to this point, and to get us to go live. Thank you, and we can answer any questions that you may have.
Officer Hines and Commissioner Sullivan, there's not any questions on the board, and I don't have any questions, but I do want to say that y'all have led an effort that is historical, transformational for every agency of state government, and I thank you. I'm looking forward to going live, and I know y'all are probably looking forward to and shaking, scared too, but anyway, we got to do it. It's huge. I think members, if you know a little bit about it, this is a transformational thing that you're doing, and thank you for keeping us updated throughout, and I appreciate that, and I'm sure Chairman Tillery might want to say a word.
I'm also really proud that we're right now in line on budget for the most part. And then also the timeline, that we've seemed to have held the timeline with one small exception, but we're working through that. So for those of you who don't know, this is everything from payroll to how we manage HR resources. It's a very huge thing. It'll also allow the legislature a lot more insight into how spending is done on more of a real-time basis, almost like looking at your checkbook, which is things we've asked for in the past to try to keep you up to date too.
I do see a question. Sorry. Is that Lim? Is that Representative Lim? Okay. Yes, sir.
Yes. I just had a quick question.
Yes.
I know we took a great step forward a couple years ago with the Governor Campus Georgia Business Certification Program. I also know that DBE certification and speaking to GDOT is a little bit uncertain, and I know that folds into MBE certification you all do. Could you just give a quick update on what the landscape is of MBE, DBE, all the BEs?
I think that's for me.
Yeah.
Yeah, so we did roll out our small business and supplier diversity certifications. I believe it was at the beginning of last year, might have been at the beginning of 2024. So we are now certifying small minority, veteran, and women-owned businesses, and small minority, small veteran, and small women-owned businesses. We have been very successful in getting those certifications issued. We've done a significant amount of outreach. We have recently partnered with GDOT's small business partner, Miles, I believe it's Miles and Company, to reach out to small businesses throughout the state and help them with the procurement process and train them on that. So thank you for that question.
Thank y'all.
Thank you.
Have a good day. Next up, right before lunch, Executive Director and State CIO Shawnzia Thomas for the Georgia Technology Authority. And remember, lunch is in 403. They moved it here. Thank you.
That's going to be a heck of a 250th celebration for those folks.
All right. Hello, Director Thomas.
Hello.
How are you?
How you doing?
Doing good. The floor is yours.
Okay. Let's see what time it is before I say good morning. It is still morning. Okay. Good morning, Chairman and members of the committee. I am Shawnzia Thomas. I'm honored to serve as your state CIO and the Executive Director for the Georgia Technology Authority. GTA serves the state of Georgia by delivering secure, reliable, cost-effective technology services, strengthening statewide cybersecurity, overseeing major IT investments, and supporting agencies as they modernize how we serve Georgians. I am mindful that I'm standing between you and your lunch, so I'm going to be brief here on the governor's recommendations. You will find GTA's budget. Let's see.
Should be the right button.
This one?
This one.
Oh.
No, I'm sorry, this one.
Okay, right there. Okay. Under payment for Georgia Technology Authority, you will see a request for $7.5 million to increase funds to continue the statewide enhancement and standardization for cybersecurity services for the executive branch agencies. These funds support one-time investments to continue strengthening cybersecurity across these agencies. Investments include enhancing threat detection, expanding monitoring capabilities, improving incident response, and tools that help agencies better protect and serve sensitive citizens' data. These efforts reduce enterprise risk, improve resiliency, and help prevent costly disruptions to government services. For the Technology Empowerment Fund, next you will see a request for $35 million to increase funds for the Department of Community Health, Integrated Eligibility System. This request represents the remaining portion of the funding that DCH and DHS projected last session, which was $70 million. $35 million was appropriated for FY25. The current request completes that original approval. The third item that you see is a request to utilize existing interest from the Technology Empowerment Funds in the amount of $7,930,340 for two projects. 7.5 will be used for the ERP modernization system that Commissioner Hines and Officer Gelder just mentioned for the NextGen project. The State Ethics Commission is requesting $430,000. This addresses additional costs associated with the Ethics Commission system replacement. The original project scope did not anticipate subsequent statutory changes requiring new system functionality, nor the requirement to retain 10 years of the legacy systems data. That data must be maintained, so these additional funds will go to help that. We appreciate your support for these funding requests, and that's the request for the budget. Now I want to go into some highlights for GTA. So GTA is not requesting any funds in FY27. However, through the governor's FY27 recommendations, you will see statewide reductions administered through GTA. I think we're listed there 151 times. Overall billing is expected to decline by $8 million, and that is a result of my team negotiating for 11 months on 3 of our major projects. So these reductions reflect adjustments across all agencies, driving lower costs resulting from the negotiations of those contracts. Some of the keynotes: GTA now provides security and enterprise services for over 1,200 government entities. Agencies may experience different impacts. Some will see savings and some will see increases. And that is because it depends on the services that they're given. Overall, these changes reflect greater transparency, better cost alignment, and improved value for the state agencies. Now that we've got the budget out the way, I want to look at some initiatives that GTA has. Our AI and Horizons Innovation Lab, you see here, I'd like to highlight that this lab, which officially opened with a ribbon-cutting ceremony on July 16th, attended by Governor Kemp and First Lady Marty Kemp. We often describe this lab as a state technology test kitchen. It's a collaborative space where state agencies and local government can bring real-world use cases into the lab and work alongside some partners that we've already vetted that's in the AI space. The key value is that We test ideas in a controlled environment, and we have 3 controlled environments, one with AWS, one with GCP, which is Google, and one with Microsoft Azure. Allowing projects to pass or fail before they're put into production. And that's the main reason for this lab. When AI jumped on the scene, we have people ready to use AI, but we wanted to make sure we had a space where they can come in and use these tools in a controlled environment. This lab gives us a smart, practical way of piloting emerging technology, designing better digital services, and innovating responsibly. This next slide, you'll see we're talking about ADA and digital accessibility. GTA is leading a statewide effort to ensure that all digital services meets the DOJ ADA accessibility requirements, where there's a deadline of April of 2026. We're working directly with agencies to conduct accessibility audits, remediate websites and PDFs, and track across Georgia.gov website portals. We also partner with vendors like Code for America and Civic Roundtable to help agencies identify and fix accessibility issues at scale. As a result, agencies are on track to be fully compliant and significantly improving access for Georgians with disabilities. Let's see, go back one. My Georgia. My Georgia is a new way for Georgians to access services securely. And it does something pretty powerful. It eliminates the use of username and passwords. We all know how hectic that is and how we forget our username and passwords, and now you need a long username and password, and sometimes we use them over and over again. Instead of users identifying users verifying their identity with a username and password, they will now verify that by taking a live image of themselves, which is securely matched to the state-issued ID or passport. That live check confirms that the right person is standing before you at the time of any transactions. Now, this technology was developed right here in the state of Georgia, and I gotta give kudos to the Department of Driver Services. They were the ones that started this technology. So by removing passwords, the most common point of failure, we will significantly reduce fraud, strengthen security, and make it easier for people to do business in the state. And because it's an enterprise solution, all agencies can use it without building their own. Since 2018, GTA has assisted the state in deploying broadband to every location in Georgia. I'm excited to say that we are almost near the finish line of this project. Georgia received $1.3 billion in federal BEAD funding. In September, GTA submitted the final state proposal for the BEAD funding. The state will allocate nearly $360 million for deployment projects to serve all 119 BEAD-eligible unserved and underserved locations. The technology used for this project is 75% fiber, 12% hybrid, and 13% low Earth orbit satellites. There's approximately $930 million remaining for non-deployment funds, and we are currently waiting for an update of guidance from NTIA on how to use these funds. On this slide, you will see the projects under the Technology Empowerment Fund. There are 8 projects that GTA is assisting. Officer Hines and Commissioner Sullivan just talked about one of those projects, and you will see the remaining 8 here. I would like to briefly discuss 2 of those projects. One is what we just heard about from Officer Hines and Commissioner Sullivan, the NextGen ERP program. With respects to NextGen, the Unified ERP program, the go-live date for all agencies, excluding GDOT, has been moved to July of 2026. A key milestone was the completion of the payroll comparison, and that has been successfully achieved. The project is currently in yellow, but we are monitoring risk related to benefits integrations and grants functionality. Future planning for the implementation for GDOT is currently underway, and we'll keep you posted on that. The delays is primarily due to underestimating complexity in supporting the full range of agency business processes, as well as additional functionality that must be developed by the vendor Workday. As of December 15th, TEF expenditures of a little over $66 million against the $108 million, and any additional costs, which I don't think there will be paid for by the agencies. The next project I want to highlight is the State Ethics Commission refile replacement. This project has generated significant interest among legislators. The contract was awarded in October of 2024, and the first 3 modules, campaign finance, lobbyist registration, and personal financial disclosure, have been successfully deployed. And I hope that you guys are finding the system to be more user-friendly. If not, please let me know. The system also incorporates statutory changes from House Bill and Senate Bill 199 that was passed during the previous legislative session. Total expenditures to date is a little over $1.8 million out of the $2.7 million allocated for this project. The remaining modules are scheduled for implementation in early 26. Through the Technology Empowerment Fund, GTA provides strong oversight. We support agencies with technical expertise and governance needed to reduce risk and achieve a successful outcome on their projects. I sincerely appreciate the continued support from the Governor's Office and this committee. Your investment enables GTA to strengthen cybersecurity, modernize government systems, improve IT service delivery, and expand broadband access across Georgia. We value the partnership and remain committed to being responsible stewards for the resources you have entrusted in us. My contact information is listed here along with Cameron's. If you have any questions, please feel free to reach out to us, and I can answer any questions about anything that I presented today.
Thank you, Director Thomas. I got a couple, and it may be more for Department of Community Health than you, but the eligibility system.
Yes.
Where, does that have a completion date? Do we have a date that that's going to be done?
We do not have a completion date yet. Right now, we are working with both agencies to gather requirements. As Gerald Hines said, the NextGen project is the biggest project we've ever undertook so far, but I think the NextGen project will be the biggest. So working with those 2 agencies, we're working on the requirements, and once we get those requirements to see what that looks like, we can give you a date of go live.
And the other, it's my understanding that not all of our state agencies are under your purview.
Correct.
Don't you think it would make sense that they were, from a technology security standpoint?
From a security standpoint, yeah, and when we say under our purview, we really just want the visibility into their systems to make sure we understand who's in there, who has access, what is going on, what are they doing, if they're dropping off anything. So the visibility is really what we're looking for.
See what we can do about that. Representative Buckner.
Thank you, Mr. Chairman. This is kind of a follow-up on that. For years, we've heard from agencies and public schools that if, let's say, a foster child is moved from Savannah to Columbus, their records may take 6 weeks to get there. So you don't know their health records, their behavioral health records, you don't know their school records, of whether they have an IEP or any of that until all those records arrive. The child's already moved, but the records are lagging behind. And I'm wondering, with what we heard about the court requiring so much of the Department of Human Services, is there a way for there to be a secure system for all of those agencies, like public health, behavioral health, Department of Human Services, and maybe even the court system, to share information as needed for taking care of individual children? And if so, would that come under your purview?
And that can be done in collaboration with all those agencies coming together. Again, getting those requirements, looking at the technology stack that will be needed to get that done. But yes, that can be done.
Thank you.
Representative Sharper, you're not a member of the committee, and I haven't let anybody that hasn't been a member of the committee ask a question. But I was going to let you ask a question and be the first one, if you make sure it's brief, because we're all ready to eat.
Very, very brief. Someone that's been in technology for a long time. It's great to see us moving forward and ahead of time. But as we see things are in the budget, to continue to make sure that we're moving along with it. Just a little thought, and then I'm gonna sit down. Okay, if we have you guys kind of like another umbrella over the state, but with this technology and us moving forward as a state, is there any opportunity for partnerships with Board of Education, local government, with GMA, ACCG, to help them somehow to get on board, to get their type of technology up? Because if we're up here and they're here, it's going to be that gap if we're not already involved.
So Representative Sharper's mic is not working, and his question was, for those listening, was, is there an opportunity for partnership with the state among other local entities?
Yes, there is. Again, I mentioned that we now deliver services to over 1,200 government entities, and some of those are local and counties. So yes, there is that, and that will take a lot of collaboration with those entities coming to GTA, sitting down, looking at what technology they do have, doing assessments on their technology stack, their security systems, and getting them on board. But yes, we can do that.
That's it. Thank you.
Thank you.
Have a good day. Thank y'all. Let's be back at 1 o'clock. 1 o'clock. Okay. The party's gone, but it's quality that's here now, right? Oh, yeah. Well, we are already late, and we'll probably continue to be late the rest of the day. So, Mr. Secretary, glad you're here. Welcome, and we will get right to work. Turn it over to you.
Well, good afternoon, Chairman Hatchett, Chairman Tillery, members of the committee. Thank you for the opportunity to present the Secretary of State's amended fiscal year 2026 and fiscal year 2027 budget recommendations. Beginning on page 330 of the Governor's Budget Recommendation Booklet, these proposals are focused on maintaining secure elections, protecting consumers, supporting licensed professionals, and ensuring our agency continues to operate efficiently and responsibly. Our budget reflects careful stewardship of taxpayer dollars while addressing statutory mandates and operational needs. Slide 2 is on page 331. The Corporation Division plays a critical role in supporting entrepreneurs across the state and making Georgia more prosperous and affordable for all. In 2025, we processed 898,883 annual registrations with 1.4 million active entities on record, highlighting Georgia's leadership and successful business practices. We're expecting a substantial increase in those numbers within the next year. We serve the state by accepting filings, issuing corporate documents, and providing corporate access to business records. On slide 2 here, you'll see the only recommended change in AFY 26 is a one-time $2,000 supplement for full-time employees to remain competitive and recognize staff retention needs. There are no requested changes for FY 27, allowing the division to maintain consistent operations while continuing to serve Georgia's business community. Slide 3 is on page 331 also. The Elections Division is responsible for administering Georgia's election laws and supporting voters, candidates, and local government statewide. In 2025, we successfully administered and certified all elections while upholding our commitment to keep Georgians safe and secure while they recognized their right to vote. So much so that Fox News on election night on fall 2024 said that Georgia and Florida run the best elections in the entire country. I differ with him on one point. Georgia runs the best elections in the entire country. In AFY 26, the budget includes several key investments: a one-time employee salary supplement, funding for optical character recognition human readable text count technology to comply with Senate Bill 189, a second blind count of all ballots and resources for the 159 counties to conduct a full hand recount of 2 statewide elections during the 2026 cycle. These funds strengthen elections integrity, transparency, and public confidence. We are requesting that these funds be made recurring to ensure Georgia can continue to conduct audits that verify election outcomes that reinforce voter confidence. Slide 4, also on page 331. The Investigations Division enforces laws related to elections, securities, and professional licensing. For AFY 26, budget adjustments reflect changes in insurance premiums, Georgia outwork billings, and updated health benefit contribution rates. While these are primarily technical adjustments, they ensure the division remains properly resourced to investigate complaints and protect Georgia consumers. We're consistently upholding our commitment to keeping Georgians safe, and just this year alone, we've had thousands of successful investigations across all divisions and attached agencies' divisions. On slide 5, also on page 331, this discusses office administration. who provide essential support services across the entire agency. In AFY 26, the budget includes a one-time $2,000 salary supplement for full-time employees. This investment supports retention and recognizes the importance of administrative staff who ensure the agency operates smoothly. Slide 6 is the Professional Licensing Division, which protects public health and safety by supporting licensing boards across numerous professions. Our most recent update has been the online application tracker, giving our constituents access to streamlined timeline to review their application status 24/7. Additionally, we've reduced processing time for our constituents to receive nursing licenses, for example, by 62%, cutting the average processing time from 48 days down to 18 days, proving our office's efficiency and commitment to our healthcare professionals. In AFY 26, the budget includes a one-time salary supplement for employees who support licensing operations. This funding helps ensure timely processing, enforcement, and customer service for licensees and the public. The Securities Division is discussed here on slide 7, page 332. They administer and enforce Georgia's Securities, Charitable Solicitations, and Cemeteries Act. Our office is extremely dedicated to Georgians and protecting Georgians, and we've hosted over 49 different financial literacy programs over the past year. Actually, we've even gone into women's prisons to ensure that our constituents are prepared, educated, and well-versed on the potential threats they could face. We perhaps actually were in your county recently or in the past year. We plan to continue to host these vital programs this year with 2 events that are actually happening just this week. In AFY 26, the requested increase supports a one-time salary supplement for full-time employees. This ensures the division remains equipped to protect investors and prevent financial fraud. On slide 8, this discusses FY 27 recommendations. These adjustments largely reflect updated benefit and administrative cost changes, including retirement contributions, insurance premiums, and Georgia at-work billings. We also reflect savings from a reduced state health benefit plan contribution and the elimination of one-time precinct card mailing funds following the passage of Senate Bill 424. Overall, these adjustments ensure fiscal responsibility while sustaining core election operations. The FY recommendations continue these adjustments on slide 9, reflecting updated administrative and benefit cost. The overall reduction aligns with projected expenditures while preserving the division's ability to conduct investigations and enforcement actions statewide. Additionally, we are requesting $755,649 in funds for salaries to reflect similar law enforcement agencies and staff for our post-certified investigators. Slide 10 on page 333, the fiscal year 27 adjustment reflect routine changes in insurance premiums, telecommunications, and infrastructure rates, and Georgia at-work billings. These are partially offset by savings from reduced health benefit contribution rates. The goal is to maintain strong internal operations while remaining fiscally streamlined. On slide 11, relating to professional licensing, on page 333 and 334, the recommended changes for fiscal year 27 reflect updated administrative cost and a reduction in state health benefit contributions. These adjustments result in a net decrease while still allowing the division to meet its regulatory responsibilities and maintain a high level of customer service. On slide 12, relating to securities, on page 334, the FY 27 recommendations include routine adjustments for insurance, Georgia at-work billings, and reduced health benefit contribution rates. These changes result in a modest net reduction while preserving the division's ability to conduct examinations, investigations, and enforcement actions. In closing, Our AFY 26 and AFI and fiscal year 27 budget recommendations reflect a balanced approach, supporting our employees, meeting statutory obligations, strengthening election integrity, and protecting Georgia consumers, all while maintaining fiscal discipline. We appreciate your consideration and look forward to continue our work on behalf of the people of Georgia. With that, I would answer any questions the committee or members would have. Thank you.
Thank you, Mr. Secretary. I have one or two questions. I noticed that you reported in, I think, fiscal year 25 that y'all had collected around $144 million in fees. Does that include the expedited charges that you collect for those fees? In the past, I don't think it has, but I'm just curious if it has. Do you have any idea?
That's included.
It is include those? Okay. So all those expedited fees are then turned into the general fund that we then have the ability to
That's part of our retained revenue.
count.
The General Assembly receives 100% of the standard corporation fee, and of the professional licensing fee. If we charge a licensee, say $100, we run the agency on about $33, and the other 65% goes back to the General Assembly.
It goes back where?
To the General Assembly.
Okay. I just have an issue with all of our agencies that charge fees that we don't get to see.
Well, we're running the corporations on zero taxpayer dollars.
But you are. Okay. Senator Burns.
Thank you, Mr. Chairman. Thank you, Mr. Secretary. It's good to see you today. Thanks for joining us. As we look at your request for $1.8 million for the text-based ballot scanning technology, can you share with me that whether that software will be used for tabulation or verification?
That's actually used for verification. That's what we piloted back in the 2024 election.
That's correct.
Reading the human readable text, and this reflects the governor's budget of the $1.8 million and the $5 million that he put in there.
Correct, and I supported that and championed that. My point is, notice here this is for tabulation. Is that incorrect?
It confirms the tabulation.
Text-based ballot scanning technology for vote tabulation. Is it EAC certified for tabulation?
On an election day, the poll workers will, obviously the voters, run their paper ballots, through the scanners, and the scanners record that with a QR code. Then post-election, we take those scanned images and we run that through and verify what those numbers are, the vote totals, race by race, and the totals, to verify the accuracy of the machine, the accuracy of the vote. So it's really as a check,
It is
to
a
the system.
verification, is that correct?
It's a verification process.
All right, and you use the word QR code. I believe Senate Bill 189 does not allow for the use of the QR code after July 1st, 2026. Is that true?
The system that we're using currently is available to be used until June 30th, 2026.
Correct. Thank you. The last question in this line, what was the cost, the actual cost of providing that verification text-based scan in 2024?
I will get the number for you, but it was in excess of the $1.8 million because there were setup costs.
I believe the legislature at that time appropriated $5 million. Is that correct?
Right, and it came in under that.
And it came in under that substantially, I believe.
Yes.
So if you would, please, I'd like to know what the actual cost was to utilize that technology in 2024.
We'll send that to the chair.
And we'll verify that it's a verification, not a tabulation. Is that correct?
We'll send this information to the chairman and the members.
Thank you, Mr. Secretary. I appreciate your service.
Chairman Yurda.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being with us. We made significant changes to how professional licensing boards operate, and particularly moving some of the authority to you guys inside. And do you anticipate you have the resources needed to smoothly make this transition? And I know you've made some improvements already, it sounds like, but to further, make those improvements and make it a smooth transition for our constituents, do you anticipate that's going to be workable?
Well, restating that, you mentioned that how you've moved something to the professional licensing.
Yeah.
It's really the same as it's always been.
Aren't some of those decisions made internally now by the authority itself?
Oh, I see what you're talking about.
Yeah.
Right. That helps expedite the approval of a license if you met all the qualifications, and that speeds things up. But the most important thing is really the technology upgrade. We've taken software. The old software was clunky, 2002 software. That's been replaced, fully implemented. And now you're seeing, like, for example, nurses, our largest group of licensed professionals, went from 48 days down to 18 days. And I'm happy to report our employees are dedicated, and now they're trying to reduce it even further. And I'm not going to stop them, because they're on a mission just to be more efficient and really serve, your constituents, our constituents across the state of Georgia. Thank you.
Chairman Dolezal.
Thank you, Mr. Chairman. Thank you, Mr. Secretary. I was just looking back through Senate Bill 189 to make sure my recollection was correct. So, and I want to just try to get down to a clear answer to the question that Chairman Burns was asking. In November of this year, when our voters cast votes, what are we certifying? Are we certifying a ballot that is being tabulated with the QR code or not?
Well, the challenge that you have is the Senate, the General Assembly, has not funded a single dollar to upgrade the system. So if you do fund, that system, then we could talk about alternatives. But it's not been funded, and it's not reflected in the governor's budget. And so we're here reflecting what the governor has, put in here, and pending, some funding from the General Assembly, we'll be, having to make this choice come November.
Follow up, Mr. Chairman. In addition to that, can you, when we vote in November and in May, what version of the Dominion software will our machines be running?
5.5? Yeah. For up to June 30th, it would be 5.5.
What about after June 30th?
With lack of funding, you'll be faced a choice that we probably would have to use 5.5 or some other alternative. There's no funding been put forward by the General Assembly.
And just to clarify, 5.5A is the version of the software which CISA and the Department of Homeland Security have identified have the 9 known vulnerabilities that they identified back in 2022. Is that correct?
And since that time, now we do the human readable text verification. And when we did the verification of that, we found that there was basically 0 errors with the human readable text, and I believe it was 84 errors with the hand mark.
I was just asking to clarify. That's the same version of the software.
I was just clarifying also.
Was that a yes, that it is the same software version that the Department of Homeland Security identified had those 9 vulnerabilities? That's 5.5A. I just want to make sure my numbers are correct.
We're using the same software because no additional funding has been provided.
Thank you, Mr. Secretary. Mr. Chairman.
I just have a question on that. Mr. Secretary, the $5 million in the governor's budget, does that go for the hand recount then?
That goes for the hand recount of 2 statewide races.
So it doesn't, I was under the impression the $5 million was going to be, we would be able to count all of them.
No. No, that's, no, this is just for 2 statewide races.
If we were able to count all of them, would you not just be able to certify the hand count there, and that suffice to meet the Senate bill's request of not counting the QR code?
No.
Okay.
Because you have about 16 to maybe 20 races on each ballot. Now you're just looking at 2 races that are on that ballot.
Right.
And so really it's the economy of what it is. It's not like France or Germany or any of these other democracies which just have one race. We actually have, say, 15 different races on a ballot.
What would be the incremental cost increase then to count all 16 over 2? Obviously, it's not going to be 8 times that amount. Could your office work on that number for us?
We could take a look at it.
Okay, thank you.
Representative Donahue, did you have a question? You're like, okay. Chairman Watson.
Thank you, Mr. Chairman. Mr. Secretary, we continue to receive complaints on the licensing side. That's one of the biggest constituent issues that I have in my district, and I know many others have had over the years. Could you just kind of update us on some of the things there? Do y'all track how many people apply on the professional side and just licenses in general? How many are applying on a daily basis, and how long it's taken to fill those licenses, and kind of a progress report on how all that goes? Because it just seems to continue to be an issue that we have, and also have an ethics meeting tomorrow at 4 o'clock. I'd love to see you there as well, so I appreciate your response.
I guess from a standpoint of productivity, we've gone from 900 applications per employee to 1,250, which is a 28% increase in efficiency. We also are up 67% more applications since 2018 with no increase in manpower. With the new software, we've taken, as I've just used the nursing example, but I could pull up some other boards and send those over to you. But nursing gone from 48 days down to 18 days. But we now have a new online portal that went into place as an additional, further enhancement. We'll continue looking at how to enhance this to improve customer service. But people have now 24/7 availability of looking exactly where they are through that process. Instead of having to call a number, email, they can just go online and see where they are in that process. And that has just reduced the number of calls we had, and we've had thousands of people avail themselves of that service. So we'll continue to look at how to improve that. We have a strong team, and they're dedicated to making further improvements in the process. But we're really impressed that we've increased our efficiency 28%. And we've also have 60% more applications, which shows that Georgia's growing, it's open for business, and we want to make sure it continues to be a great place to start your business, raise your family. Thank you.
Chairman Carpenter.
Thank you. Is Liz here today? No? Hey! I'm just making sure. First of all, I want to thank you for all you do. I know I'm a pain in your side sometimes, so I appreciate your help. 2 things. First thing, do you guys have any kind of legislative suggestions on how to streamline the licensing process? Are there certain boards that need some attention to make sure that we're continuing to get these things churned out so Georgians can get to work, especially folks that move into our state that are qualified? And the second question is, could you guys put out some figures on how many volunteers and the cost to Georgia taxpayers if we went to paper ballots hand counted? Because I think there's, I understand that the people's desires, but I think they need to understand the magnitude of the dollar and the magnitude of volunteers it would be required to do such. So,
well, as it relates to hand counting, we could just really extrapolate where this is done in certain counties, like in Arizona they did this, in other places, and give you an idea of what it would look like with 4 million people voting during a gubernatorial year, 5 million people voting during a presidential year. So we can get that to you. Then your first question.
Licensing, what boards what do we need to do to certain boards that you see are lagging on, whether it's they've got a 500-person quota for meetings for that month, or whatnot? What can we do as a legislature to hold them to the fire so we can get people to work quickly as possible? Because as somebody, and the reason being is, as somebody on a border in a border community, people that have communities that surround other states, we get a lot of people that move into our community to work and then they get held up. So that's the reason.
Well, Chairman, it's a great question. This office, just our office, licensed over 240 different licenses and over 40 different boards. I think structural engineers should be licensed. I am one. That's public safety. I think nurses should be licensed. That's public health. We get it. But sometimes you question some of this stuff. In fact, when we were in the General Assembly, there was one for lactation consultants. I voted against that bill. Then I become Secretary of State. And as Secretary of State, I have to defend that bill. And notably, they never asked me for a deposition. And finally, as it wound its way through the court, it was struck down. And so we really need to be mindful of what really needs to be licensed and what doesn't need to be licensed. So we could ask about other professions. Does it need to be licensed to be a barber? And if it does it need to be relicensed, and that fee cost every year or every 2 years, or can we look at extending it out? What has really changed in that industry? Obviously, electricians and plumbers, technology changes, but do we have to relicense that every 2 years? What could we do to stretch that out to make it more, in line with any technology changes that you could have? Yep. But we probably need to do a deep dive in that. I do think we license too much. And whenever I have an opportunity to license things I don't think need to be licensed, or people have been doing it since the beginning of time, it doesn't need to be licensed. And so I support, I think what your leaning is towards, that we want to make sure it's a friendly place to build a business and not over-regulate people. We need to cut red tape wherever we can, because government doesn't create jobs. If anything they can do is get in the way of creating a good paying job with entrepreneurs such as yourself. Thank you.
Senator James.
Thank you, Mr. Chairman. Hello, Mr. Secretary of State. Two of my questions have already been answered while I was waiting to be called on, but it's one that you might think is petty, but I want to know, why is it that if we want to give Outstanding Georgia Citizen Awards to people in our district, we have to go to 10 or 15 for the whole year? And also with the, honorary Georgia citizens for diplomats who might come here. So why is it that, we need to pay something? Because clearly the paper couldn't cost that much. I just need to know that question, but you answered the one about the elections and how many licenses do you give from the Secretary of State? You've just answered that.
Thank you.
Mm-hmm.
That goes back to longstanding policy, and I don't know when that began. It may go back to Ben Fortson days, but when we had the office, but there was a limitation. It's really based also on our office. We only have so many folks, and if you look at, there's over 220 members, and so it's just really something to be manageable for the amount of staff that we have. But obviously, if you have additional folks, we'll take a look at it, but we just wanted to make sure that, we had some reasonable boundaries on it. But obviously, we want to be respectful of our senators and representatives, and if we need to expand that further, we'll gladly take a look at that for you.
I hope you will look at it, because if someone dies in my community and I've already used 15, what am I going to tell them? Oh, wait till next year, and no, that won't work. So I don't understand why that many people don't use those, but I live in the metropolitan area, and for some reason, people think that that's the greatest honor that a Georgian can get, even posthumously, if they're dead.
Well, thank you, and we'll look at it.
I appreciate it.
And I'll get back to you.
Thank you.
Representative Lim.
Thank you, Mr. Chairman. New topic, securities. So I'm a securities attorney myself, and I know that states can play a really robust role in preventing fraud, particularly for seniors. I know that's been a cause for you. I also commend you for your AJC op-ed after First Liberty, promising to essentially put more towards securities investigations, the securities division. I'm not seeing that in this budget, and so I wanted an explanation for that, if possible.
Primarily, we had a bill called Senate Bill 284 that did not pass on the 40th day last year, and we'd highly encourage to pass that one forward. And then additional, strengthening of the law. That came out before the whole First Liberty situation developed, but it gives protections to investors. Our recommendations that we are presenting are really the governor's recommendations. We were aligned on that. We always could use additional resources, but for the resources we have a robust team, and our securities team is recognized as one of the tops in the entire country. And so we work very diligently. Our people are diligent. They want to make sure they stamp out frauds, Ponzi schemes, and other illegal securities violations. And we'll continue to do that with the team we have. But it does take resources. It would take the will of the General Assembly to add additional funding, to add additional investigators.
Chairman Anderson.
Thank you, Mr. Chairman. Secretary, thank you for being here today. Quick question, just to kind of follow up on some of my Senate colleagues' questions earlier regarding the funding request for elections. The amended request asked for $1.8 million for the OCR count, and then the $5 million for the full hand count for the two top-tier elections. Is that for primary, or is that for the general next year?
That's for the general.
For the general. Okay. All right. Thank you.
Representative Glaze, is that you? I can't tell. That you? Okay.
Thank you, Chairman. Secretary, I wanted to ask a question around security as far as home ownership. For foreign investors into the state of Georgia who buy homes, is there a possibility where they could be treated like a business, where they have to come and file an annual report, just so that we know who owns what when they're outside of the country and where they own property? I know they're not supposed to buy within certain areas of more secure areas, such as base, our Army or military bases, but what about in communities so that we can see at a municipal level who owns what? And sometimes we're just, we've got bad actors and we don't know who owns, and we can't really get them to comply with local ordinances. Is there a possibility, or does that make sense?
I know that there's a concern, which I share, about foreign ownership of our farmland, but you're also raising another issue, and I'll have to review that, and I'll get back to the committee and the members. Thank you. Thank you for your question.
Thank you, Mr. Secretary. I think you can see there were a lot of questions. You've answered all of them, and I hope that you will continue the interest in directed toward the licensing division, because we did have a lot of focus on them over last 2 summers ago, and things have improved, but as you can see, they're not perfect, they're not there, and I hope you will continue to focus some attention in that area.
Yes, sir.
Thank
But
you.
also, when we do get complaints, we do respond to them. In fact, we had a person, they were inspected, it was a barber, and so we now are providing the member, the photos of our inspection, so you can look at why that person did not meet the acceptable level of standards that are required per state law. But we will continue to provide great public service and to make sure that our members and the chairman are kept in the loop on these things.
I may have some legislation headed your way for more pictures. Thank you. Thank you.
Thank you.
Next up is Commissioner John King with the Office of Insurance and Fire Safety. All right, Commissioner. Go. Gotcha. You're back.
Can you hear me? Okay. Thank you, Mr. Chairman. Good afternoon, Chairman Hatchett and Chairman Tillery. Thank you, and members of the committee. Thank you so much for allowing us to come and do our budget presentation. But I want to start off with, this is my only opportunity to really come and brag a little bit about our agency in front of the legislature. And so I want to highlight some of the achievements that you all have had a hand in helping us achieve, and so I'm very grateful for that. First of all, this is a tough week for our agency. We lost Steve Manders, our Deputy Commissioner of Insurance, almost a 40-year veteran of this agency serving the state of Georgia. So, you know, it's been a tough week for the team, but it's an incredible individual that was passionate about serving Georgia, and we hope to continue his legacy in providing absolutely a top-notch service to the state of Georgia.
Commissioner, thank you for bringing that up. If you don't mind, we're going to ask the committee to hold a moment of silence in his remembrance as well, and the service to his state. Thank you, Commissioner.
Thank you so much. I would like to thank you all for this opportunity and to highlight what our agency has done to serve the people of Georgia every day. The support of this body has been essential in the tremendous growth of this agency in recent years. Today, we are more effective, more responsive, and more transparent than ever before. And we could not have done that without the trust and confidence that you all have placed on us. I want to begin by showcasing some of the success of our agency that you all have entrusted us. My agency is the second largest generator of wealth for the state behind the Department of Revenue. Our premium tax division is tasked with collecting taxes on insurance products and purchases in Georgia. In fiscal year 2025, we collected $1.71 billion in premium tax revenue. $973 million of that was distributed to every city and county across Georgia, with $737 million collected and going to the state coffers. Next. Our Criminal Investigations Division is responsible for investigating insurance fraud and related crimes. Behind tax evasion, insurance fraud is the second most costly white-collar crime in America. The cost of insurance fraud have passed directly to the consumer, and they're costing the average Georgia family between $400 and $700 in increased annual premiums, according to the FBI. But the stark reality is Georgia is still ranked too high. We're ranked number 3 in the nation for insurance fraud per capita. We have heavily invested in our division with your support. We originally started with 9 investigators in our office, and now, when I took office in 2019. Now we have more than 30 investigators, examiners, administrative staff with enhanced capabilities that supports every community, and we support all other state investigative agencies. While we have grown in our capacity to identify and arrest those committing insurance fraud, the conviction rate for these type of crimes continues to dwindle. In order to decrease the amount of fraud happening in our state, we need prosecutors who are able and willing to go after criminals, to show them that there's real punishment behind this crime. And it's not just about getting these cases into court. We also have to give offenders, measurable, penalties for committing this fraud. And so to that end, my agency is implementing a system to partner with local district attorneys' offices to help investigate and prosecute and provide prosecution support to the district attorney's offices across our state to be able to prosecute these complex criminal activities. A lot of DAs do not have the capacity to be able to present complex insurance fraud schemes, and we want to be able to provide that support to the local DA so we can put a dent in this crime. Next. Our Safety Fire Division is responsible for adopting the rules, regulations, and standards to protect Georgians and their properties from fire and create safe buildings and educate the public about fire safety. With the General Assembly's support, we have been able to expand our capabilities a great deal. Today, our arson investigators can be in the scene of a suspicious fire anywhere in Georgia within 90 minutes. We've also increased the number of fire safety educators we employ. These educators travel across the state, providing critical education resources to firefighters, schools, homeowners, and caregivers. While Georgia being the #1 state to do business, our state has been flooded with new construction. And anytime there's a new construction, like a new wing of a hospital, additional renovations to a church, or new stadium or public facility, our team is there to ensure that the safety of its occupants. With the reopening of the Rivian plant, for example, our office is taking steps to have personnel there at all times to ensure the production can ramp up to full speed as soon as possible, and ensure the continued investment in our great state. We're continuing to actively recruit, train, and retain boiler, elevator, amusement, and manufactured housing inspectors, who are a critical part of the safety and occupation of our state. When I first took office, we only had 40% of the elevator inspections were completed across the state. This year, we are projected to reach higher than 90% completion rate. And the only reason I don't have 100% is because we're putting elevators almost every day. It is just an ongoing battle. But thanks to you all support, we've been able to put a serious dent in this challenge. Last year, this body provided us with the funding for 45 additional positions in the Safety Fire Division, which was critical to this achievement, paving the way for a stronger and safer Georgia. Next slide. I don't know if you all know, but there's going to be an event later on this year called the World Cup. Well, apparently, our agency is very involved in the safety and inspections of all the facilities and the places where a lot of our international guests will be coming. And so there will be 8 matches in our great state during June and July. We're working closely with FIFA, with the World Congress Center, the City of Atlanta, and preparing well in advance for this truly massive event. We'll be hosting just like we hosted the Olympics in 1996, nearly 2 million spectators participated and traveled to Atlanta and to our state. Recently, FIFA has sent millions of visitors from across the globe to travel to these matches. Currently, projections estimate that between 5 and 6 million people will be traveled to the United States to watch these matches and participate in fan events. As a result, our team has been all hands on deck, and we'll make sure that we are prepared to host these visitors in a safe environment. In support of this responsibility, the office will enforce all applicable state of Georgia life safety codes, along with other relevant state-approved fire, building, and safety codes and standards. This includes comprehensive plan reviews, permitting, and on-site inspection of activities to verify compliance with the requirements over occupant, safety, fire protection systems, means of safe egress, and crowd management. Emergency preparedness and active crowd and facility monitoring during these events. Our law enforcement officers in the office will provide support to the inspection operations and regular enforcement and active crowd monitoring through these events. Their presence will enhance situational awareness, support compliance efforts, and contribute in maintaining a safe environment for all participants. Additionally, the office will conduct inspections and regulatory oversight of all escalators, elevators, and any conveyance system within stadiums, fan zones, and support facilities. This includes ensuring that these systems are properly certified, maintained, and operated in accordance with Georgia law and applicable safety standards. Next slide, please. Georgia Reinsurance Program provides the financial support for the health of insurers, helping them cover the cost of enrollees with high medical expenses without passing the burden on to consumers in the form of higher premiums. The goal of reinsurance is to reduce consumer premiums, increase the affordability of health care, and make Georgia an attractive market for health carriers. Since, as you can see in this display, since 2018, the number of health insurance carriers in Georgia has more than doubled. We now have 10 health insurance companies competing across our state, giving Georgians more control over the health care than ever before and allowing the free market principles to drive the cost for the average Georgian. The average premiums decreased by 12.4%, and in some of our rural areas, we've seen drops up to 30% decrease in premium savings. Next, to Georgia Access. Last year, Georgia Access launched a state official health insurance marketplace. And I'm glad to report that our platform has outperformed nearly every other exchange across the nation, and including the federal government. The first of its kind, Georgia Access partners directly with enhanced direct enrollment entities to sign up consumers for health coverage. The EDEs are web brokers that offer enrollment in all available plans across insurance companies, an insurance company that offers enrollment in their own plans. This year, over 1.3 million Georgians signed up for health insurance coverage. Over 191,000 of these consumers did not previously have health insurance coverage in the exchange. And during open enrollment, our call center answered over 433,000 calls for assistance. We average over 5,000 calls every day, helping people get coverage. 70% of those consumers utilize enhanced direct enrollment. And and this is something that I really want to brag on our agents selling health insurance coverage. 80% of those who received assistance were assisted by a Georgia licensed insurance agent across the state of Georgia. And so that's really the key. We let agents do what they do best, sell insurance, instead of the government trying to do it for them. So in a year where consumers saw a lot of change in healthcare landscape, I'm proud that our team and our state is helping consumers each step of the way and enroll for coverage. As you can imagine, this is a very complex year. We're still reeling from some of the failures in Washington, D.C. And unfortunately, as state leaders, we end up having to pick up and clean up the mess, as usual. Now the easy part, Chairman. Now that I'd like to discuss our agency's budget request before opening up to any questions you all may have. First, I am not requesting any additional changes to the amended fiscal year 2026. I know every constitutional officer comes here and asks you for more money. I'm not asking for more money. It's just continue giving me the flexibility to use the budget that you've given me and be able to provide those priorities. For amended fiscal year 2026, we only have two major items to report. First, we're giving back the state funds in two programs, nearly $2.6 million for administration and $582,000 for enforcement, for a total return of over $3 million. This return of state funds is a result of our increased other funds that you will see in insurance regulation program. We also ask that you continue to support our reinsurance program, because that's the key to keeping these insurance rates flat or decreased across the state of Georgia. We're asking for a continued support of the reinsurance program in the amount of $120 million. User fees continue to support the reinsurance, with $82 million going to this program. And the claims have increased from prior years by about 43% of medical expenses have increased. For fiscal year 2027 budget request, we are asking for the same items: the removal of the $3 million in state funds for administration and enforcement for an increase in appointment fees, and also the continued support of the reinsurance program in the amount of $146 million. You will notice a $25 million difference between these 2 years. That's because 2026 claim year experience was slightly lower than expected. So we were able to return that money back to the general fund. And so with that, I would like to open to any questions that you all may have on this or any other topic. Thank you so much for the opportunity to provide this information to you all.
Thank you, Commissioner King. First question is Senator Kirkpatrick.
Thank you, Commissioner. Great to see you. You know, we pass laws over here and then we hand them over to you, those of us who do insurance work, for enforcement. And so I just want to tell you how much we appreciate the recent action that you took on the parity issue that we've worked on for several years, where there are people who are not following the laws that we pass. So appreciate that. Have you got everything you need staff-wise to continue that work?
Yes, ma'am. Yes, Madam Chairwoman. It is the challenge that we have is that a lot of people don't understand the process, and it's a very methodical and careful process. Because if we take a misstep, I'll end up in Fulton County Court on appeals that will take even longer to get. You know, I see my role as the old Atlanta police officer that I was when I first started in law enforcement. I direct traffic, I direct commerce. You all give me the tools. When a company breaks the rules, we pull them over, we issue them a citation, we give them a corrective action, and we get them back on the road. Now, if they don't pay attention to that, the pain will increase. And I appreciate the support that you all have given me the tools. But these investigations take a minimum of 12 months because we go through every line of insurance, we go through all their emails, we have actuarial, and, folks go through every one of these. And it's not as quick as I would like it. And my team will tell you I'm one of the most impatient persons that they have to work with because I want results. I want to be able to show the people of the state of Georgia that the insurance commissioner's office has got their eye on the ball. And so I appreciate the opportunity, and we will continue watching this carefully. You all spoke very loudly. You passed this bill unanimously. And there's not very many bills get passed unanimously in this state. But you all gave me a charge, and it's very clear. Insurance companies got to follow the law, or else we're gonna increase the pain. Thank you.
Representative Yurda.
Thank you, Mr. Chairman. Thank you, Mr. Commissioner, for being here with us today. I appreciate the job you do. With recent funds being approved for plan reviewers and other positions dealing with construction-related inspections, has the agency seen any notable improvement in inspection backlogs?
Absolutely. It's significantly. When I first took over, we were 6 to 7 months behind. And in this day, and when time and materials can crush any construction project going on, we've now sped up. We're now in a matter of a week or two, and we also offer the opportunity for major projects that want to accelerate, that they can pay an expediting fee, and we'll ship that work to a contract. And you all made the suggestion that I look at contracting solution instead of increasing the amount of staff. So we look at contracting solutions to be able to speed up so we're in great shape. Now we have to, when a project like Rivian or something else comes up, obviously we have to surge. But both chairmen of this committee are they're not going to allow me to have, increase the staff to be able to deal with those contingencies. I have to be respectful of the taxpayers' money, that we can surge operations, and then we look at the data and where we need to grow. We have our inspectors now based across Georgia, so they're not commuting from Atlanta. And so we're closer, and we're using our computer solutions to be able to manage. For example, if you have an inspector down in Milledgeville, he will look at what other inspections are in that general area and can hit them, and using mapping and heat maps to be able to speed the amount of inspections. And so I'm very proud of the team, but we haven't grown. You all gave me 45 additional positions last year. Before I come to you all and ask you for more, I want to make sure that we don't want to get too big and then start wasting. I'd rather keep a very close eye on how the throughput is. But we're holding our own. So. Thank you.
Representative Lim.
I just had good to see you, Commissioner.
There you go. Sorry, I didn't see you back there.
I had a factual question. The 14,000 insurance fraud complaints that you mentioned earlier is quite staggering. And I'd asked the Secretary of State earlier about a fraud question, so I'm obviously interested in this.
Representative Lim,
yes,
can you speak up just a little?
Yes.
I know you're soft-spoken, but thank you.
Yes, thank you, Chairman. So the 14,000 figure regarding insurance fraud, one, is that across all types of insurance?
All lines of insurance, yes, sir.
Okay, second is, who are these actors? Do you have any idea who they are?
You name it. It runs a gamut. It's not just, sometimes it's consumers, it's sometimes organized criminal groups that stage, for example, accidents. And it's people who are participating in this kind of fraud don't just do insurance fraud. They do workers' comp fraud, they do insurance fraud, they do banking fraud, romance scams. I will assure you, GBI and your law enforcement agencies have arrested all the dumb criminals. We're now dealing with PhD level quality. These are very complex, tough cases. And as you can imagine, a district attorney, we're presenting quality cases. But the district attorney's offices are overwhelmed, so they're having to choose, do I prosecute a violent crime, or do we prosecute an insurance fraud scheme that is very complicated, is tough to explain to a jury? That's what instead of just whining about a problem, I want to be able to go and help those district attorney's office with additional resources with some of our attorneys to help them prosecute so we can make a dent on it. We're number 3 in the nation, and I'm not satisfied with it. Neither should you.
And thank you. That's why I'm asking these questions. We just want to know more, obviously. And so to that point, the third and last part of the question is, of those 14,000, how many have been successfully prosecuted, landing in some sort of conviction for the fraudulent actions?
It's quite disappointing, sir. We're presenting cases across the state of Georgia, and many of them, the district attorney's office, please do not take my comments as just bashing the district attorney's office. I used to be a chief of police. I know that they don't have any good, easy solutions. And it'd be easy for me to hear just come and whine that the district attorney of this county is not prosecuting. That would not be a fair criticism. My job is, if I'm going to present a problem, I need to offer viable solutions. And I have a great relationship with district attorneys across the state. I mean, I've been in law enforcement 31 years. And so our rates is pretty low. I mean, we presenting cases, then they get non-prosecuted, or when they get prosecuted, a lot of times, they give minimum sentences. If we're going to truly create a deterrent, we got to make this type of criminal activity really sting. And the victims of these crimes are usually our seniors. Every time we have a major storm, every storm that we've had, our agents deploy. We work closely with the sheriffs, police chiefs, and district attorneys, because the fraudsters follow these storms. Every tornado, every wind storm we have, the fraud follows. And so we're deploying now. We're not waiting for the fraud to come to us. We're going out there to try to stop it before it occurs. And so we're number 3, sir, and I'm not going to make any excuses. We got to do better in this. And my log jam is getting prosecutions in the district attorney's office.
Representative Campbell.
Thank you, Chairman. Thank you, Commissioner King. I have 2 questions. One, when you talked about, well, first let me back up and say thank you. Your office has been very reactive quickly in terms of getting information. But I have a factual question about the slide for the reinsurance and the point about the reduction in premiums.
Yes.
I have so many constituents who are reaching out to me to say the exact opposite, that they are seeing skyrocketing premiums. And it was my understanding that specifically for the ACA premium increases, the average increase was well into the double digits, not a decrease. So can you clarify this point? And
Yes, ma'am. We're talking 2 different things. The reinsurance pool covers, if you look at the slide with 2008.
Just reinsurance.
It covers only reinsurance.
Thank you.
And if you look at the slide, 2018, the majority of counties only had 1 insurance carrier participating in the market, which means that obviously the state benefit plan is the carrier. So part of the strings in that contract negotiation is you had to be in every county. When we started implementing reinsurance, look at 2022 and now look at 2026. Now we have the high risk, where companies now want to go into these counties and compete. And so, yeah, the subsidies is a whole different topic that I would ask you to maybe have a conversation with your congressional delegation about.
Thank you for clarifying. And I just want to clarify, this stat is not health insurance premiums decreasing. This is specific to reinsurance. And then the related question is on the next page, where you talk about the dramatic increase in coverage on access, which was very positive. But can you clarify the percentage of those that probably were impacted by the ACA tax credits, and what you might be doing to serve our constituents as we're getting these 20, 30, 40% rate increases year after year?
Great question. I hope I answered your question based on reinsurance. The reinsurance is the ability of companies to go and compete across the state of Georgia. When we only have 1 carrier competing in parts of Georgia, them and the hospital system set the rate. And y'all giving me a lot of authority, but you haven't given me the authority to set what rates are applied or not. I don't have that authority. I can accept them, I can slow them down, but ultimately, if the market is competitive, a lot of people think I'm the czar of insurance rates. And I guess my job is to be the blame catcher for insurance rates. I get it. That's why I'm a constitutional officer. But I can't go to an insurance company that says, I don't like your rate. I'm not approving it.
What are the roadblocks that are in place?
You?
The roadblocks for the insurance companies?
The legislature. They've never given the authority to the insurance commissioner to, and don't get me wrong, I think it's dangerous for one individual to have complete control over rates. We can only go back to the history of the insurance commissioners in Georgia and how many of them have gone to prison, that I would temper that. But don't get me wrong, I have a lot of tools to be able to deal with that and have an influence. But please don't think that I'm the czar of insurance rates, because you've never given me that authority. No insurance commissioner has had that authority. Just want to make sure. Can we go back to the other slide on
I think that is a good place to end. Commissioner, you have answered all the questions.
We can sit down and talk.
You have
later.
answered all the questions. Thank you,
The
Commissioner
chairman's
King.
just happy that I'm not asking for more money. Thank you very much, Chairman and members of this committee. I appreciate the opportunity to present to y'all today.
Thank you. Thank you, Commissioner King. Next up is Commissioner Holmes with Department of Labor. All right, y'all, let's turn the roar down. Commissioner Holmes, thank you for being here, and turn it over to you.
Well, thank you so much. Good afternoon. Good afternoon to our honorable members of the Georgia General Assembly. I'm Labor Commissioner Barbara Rivera Holmes, and I'm joined today by my Chief of Staff, Jansen Head, my Chief Financial Officer, Kate Furman, and we truly are honored to be here and grateful for the opportunity you've provided us to discuss funding for the recommended in the governor's budget for the Georgia Department of Labor. On behalf of our entire team, I do thank you for your partnership and for the state funding that you have entrusted to our agency, because your support allows us to deliver mission-critical services to the Georgians who need them most. That investment is powering the largest unemployment insurance modernization in state history. Government should meet the urgency of the people it serves, and as a part of this agency-wide transformation, we're replacing a system from the 1980s with technology that will help Georgians faster, safeguard taxpayer dollars from fraud, and eliminate the technical bottlenecks that have long impacted workers and employers alike. Migration to this new system will begin toward the end of 2026, and to say that we're excited about this would be a significant understatement. This afternoon, I will walk you through our new strategic plan, the governor's budget recommendations for amended fiscal year 2026 and fiscal year 2027, and provide you an update on the agency transformation and the Unemployment Insurance Trust Fund. Let's start with the foundation of our work, our strategic plan. Since taking office, I have met with workers, employers, and community leaders across your districts, and their message is clear. A strong Georgia depends on a labor department that moves at the speed of business and delivers measurable results. The Georgia Department of Labor is rising to meet that challenge by evolving into an organization that is forward-thinking, future-focused, and resilient. And that is why we recently launched our comprehensive strategic plan, The Future of GDOL, a bold transformation. This plan is built on 4 pillars: customer-centric transformation, empowering talent and leadership, modernization and operational excellence, and strategic influence and partnerships. Together, these pillars align directly with labor's budget priorities and reinforce legislative initiatives that expand opportunity, strengthen our workforce, and fuel Georgia's continued economic growth. To achieve the goals outlined in our strategic plan, the governor's budget provides targeted funding to support our employees and key initiatives, totaling $3.26 million for amended fiscal year 2026. Starting on page 250 of the governor's budget report, there's a total increase of $1,563,078 to provide a one-time salary supplement of $2,000 for our full-time regular employees throughout the agency. The next item, which is line 2 under departmental administration, is an increase of $611,661 to cover rent for the Athens and Thomasville Career Centers while we work with the State Properties Commission to fill recently vacated space. The Athens and Thomasville Career Centers operate under bonded leases, requiring that GDOL remain until the bond obligations are fully satisfied. These centers co-host location partners, so we split and share operating costs among the partners. But when a partner departs, GDOL's share of costs increases until the vacated space is reoccupied. That recommended funds will enable GDOL to manage these additional expenses while working with the State Properties Commission to secure new partners to assume this space. Line 3 under departmental administration recommends an increase of $1,090,000 to replace aging laptops across the agency through the Georgia Technology Authority's end-user computer services. The agency's outdated inventory of laptops and hardware is impeding our daily operations. Most of labor's laptops were purchased at the onset of the pandemic and have now surpassed the recommended 3 to 5 year life cycle, resulting in rising hardware failures and increased downtime. This funding will allow GTA to replace and maintain laptops, ensuring they remain modern, reliable, and effective in the years to come. Looking ahead, fiscal year 2027 recommendations build on these recent investments and position the agency for stronger performance and accountability with $3.4 million in funding. The budget, however, first addresses statewide adjustments. Starting with fiscal year 2027 on page 250 of the governor's budget report, there's a total reduction of $315,813 for statewide adjustments in fiscal year 2027. These adjustments account for statewide changes in telecommunications and infrastructure billings with the Georgia Technology Authority, Georgia at Work billings, and a lower employer contribution rate for the state health benefit plan within our administration and unemployment insurance programs. Additionally, line 4 under departmental administration reflects a reduction of $62,700 to remove one-time funds previously allocated in the FY 2026 budget for staff training, which was successfully implemented this fall. Starting on page 251 of the governor's budget report, the next recommendations provide funding for critical positions needed to support unemployment insurance program activities. Line 2 recommends an increase of $1,642,557 to fund 20 additional positions dedicated to the collection of unemployment insurance contributions. We know that understaffing costs Georgia millions. With only 36 collection agents, GDOL recovered just 11% of $288 million in delinquent employer payments, leaving major regions such as Metro Atlanta underserved. And so a strategic investment pays off. Adding 20 collection agents at a cost of $1.6 million is projected to generate $11.3 million in recovered payments, penalties, and interest, and this would then be a direct infusion into the state treasury. So the math is clear. Funding additional collection agents delivers a strong return on investment, it strengthens Georgia's fiscal health, and it ensures that employers meet their obligations. In alignment with the agency's strategic plan, line 3 recommends funding of $1,059,178 to support 15 additional customer service representatives who will assist Georgians with inquiries related to UI claims, appeals, employer UI contributions, and other critical services. Let me give you a little data. Our average call time is approximately 5 minutes and 28 seconds. Our call abandonment rate is more than 30%. And our current staffing is 27 employees, of which 13 are time limited. And they are handling upwards of 14,000 incoming calls every week. The governor's recommended funding will enable GDOL to expand its permanent workforce, strengthening overall call center management and ensuring greater stability and responsiveness. And in particular, the additional staff will provide critical support ahead of the UI Inspire system launch, which is expected to temporarily increase call volumes as customers adapt to the new platform. User training is incorporated into the implementation timeline. It's something that's so important for success, but a short-term surge in calls is anticipated during this transition. And these permanent positions will help manage that initial influx and enhance the long-term call center operations, reduce abandonment rates, improve service delivery, and ensure Georgians receive reliable support well into the future. The need is urgent, the impact is statewide, and the solution in this case is staffing. Lastly, Line 4 recommends an increase of $1,100,583 to fund 12 additional financial auditors dedicated to conducting detailed audits of employer UI contribution records. Our auditors drive measurable impact through 4 key metrics. It's the percentage of contributory employers audited, the percentage of total wages adjusted, the percentage of overall wages audited, and the average worker misclassifications identified per audit. And we know that when audit shortfalls weakens our enforcement. GDOL is below the federal 1% audit threshold, limiting our ability to detect fraud, identify misclassifications, and recover funds. These additional positions will allow us to meet the federal standard and strengthen oversight. Investing in auditors thus enhances compliance, it increases collections, and it safeguards the integrity of Georgia's unemployment insurance system. This funding represents a commitment to meeting federal requirements and a strategic investment in protecting state resources. Now, I'll turn to our capital items included in the FY 2027 governor's budget. On page 390, under Responsible and Efficient Government, line 1 includes $6.7 million in capital funding to address the agency's most pressing facilities need: the demolition, design, and construction of the downtown Atlanta Central Complex parking lot and warehouse building. This building is serving severe structural issues due to long-term water damage. Despite waterproofing efforts in 2010, 2023, and 2024, damage persists due to the building's complex design. Concrete corrosion has compromised the parking deck that is used by Career Center customers and the underlying warehouse structures. Water intrusion is now affecting the hallway between the warehouse and GDOL's data center, raising urgent concerns. Without intervention, continued water intrusion will further compromise the integrity of the warehouse and data center spaces, as well as the parking deck that's connected to the Atlanta Career Center. Once underway, the work will take an estimated 18 months to complete, and our facilities team has developed a plan to mitigate disruption to the Atlanta Career Center operations during construction. While these capital improvements are essential to preserving our physical infrastructure, it is equally critical to ensure the financial foundation of Georgia's unemployment insurance system remains strong. Georgia's Unemployment Insurance Trust Fund was depleted during the pandemic in September 2020. As of December 2025, Georgia's Unemployment Insurance Trust Fund balance starts at $1.98 billion. Which is still $1.5 billion below the U.S. Department of Labor's calculated solvency threshold of $3.48 billion. Multiple factors continue to impact solvency, and GDOL remains committed to working closely with the Governor's Office and the Georgia General Assembly to develop responsive long-term solutions. These efforts will focus on strengthening the trust fund's stability, ensuring its capacity to support Georgia's workforce, and promoting a healthier unemployment insurance system for the future. In addition to safeguarding the trust fund's long-term solvency, GDOL continues to strengthen its fiscal stewardship through consistent revenue collections deposited with the state treasury. For fiscal year 2026, GDOL remitted $17,354,194 to the state treasury, which includes funds for administrative assessments, penalties, and interest. This amount represents an increase of $678,481, or 4%, compared to the same fiscal year 2025. The governor's recommended increase in audit and collection staffing will further boost this return by driving higher revenue to the state treasury. I thank you for your time and for the opportunity to be here with you today. Your partnership and your leadership are essential to keeping Georgia the #1 state for business and the best place to work and live. And I will tell you, laboring is a team sport, and we're in it with you, and we're proud to be there. I look forward to continuing to work with you throughout this legislative session to deliver real results for the people of Georgia. It is a new era for the Georgia Department of Labor, and we're proud to move forward with you. So I'm happy to take any questions.
Thank you, Commissioner. Chairman Werkheiser.
Thank you. Thank you, Chairman. Commissioner, thank you so much for what you've done. When you came in very quickly, you didn't just come in and keep the agency rolling. You came in with a very aggressive vision that you're already implementing. Two things. The experience on the Inspire system. Talk just real shortly about the experience for the employer and the employee with the new system.
Absolutely. So it's, can I get a water, please? Thank you. So the UI system, really for us and for Georgians, represents a once-in-a-generation overhaul. It's a platform built in the 1980s. It was never designed for today's volume, for its complexity, or the cybersecurity needs that we have. So when we launch UI Inspire at the end of the year, our Georgians will experience faster, more intuitive service. The claims will be more efficient, reducing the delays that have historically frustrated workers and our employers. So for employers, excuse me, the system streamlines reporting, it reduces technical bottlenecks, and improves accuracy and wage and contribution data. And those are really big pieces. When I'm speaking to employers, we're talking workforce, we're also talking the complexity and inefficiency of our system now. So both our Georgia workers and our employers will see immediate benefits when this UI Inspire goes live in 2026.
Okay, thank you very much. One other issue that gets brought up every single year in our committee is misclassification. Employers misusing employees as 1099s versus when they should be W-2s for obvious reasons. The enforcement part, I think you mentioned that in your comma, real quick. I think that would backfill almost every agency's shortfall if we could tackle that problem. So I look forward to working on that issue with you.
Thank you, sir.
Chairman Lynn Smith.
Thank you. I'm right down your line. Thank you for a wonderful presentation. I see you've got an active staff.
We have a fantastic team, and if they're standing, but if you'll just wave anyway. Fantastic. And then, of course, my CFO and my chief of staff are up here with me.
Thank you. Thank you for your presentation. I'm still hearing from my constituents who were victimized during the pandemic when all the names were captured, and they're still getting dunning letters, threatening letters, and such as that. So is there a number that you could give, not publicly, but give to your legislators? I'm going to try and reconnect some now that it appears y'all are trying to get on top of these situations.
Absolutely. We'll be happy to send out a communication to all members of the legislature with the appropriate numbers that you can pass on to your constituents so that they can receive the assistance that they need.
Thank you.
Thank you.
Representative Vance Smith. Yerda, sorry. Yerda.
Thank you, Mr. Chairman. Thank you for being here, and we appreciate your presentation. You did a great job. You know, you touched on the Unemployment Insurance Trust Fund and the problems with that, and I know in the governor's recommendation to have additional financial auditors, what are some other potential means to shore up that fund?
Yeah, absolutely. Thank you for that question. It is something that we should be asking ourselves. Certainly, we're asking that question as a Labor Department, and you're asking as members of the General Assembly. And there are several strategies that could help with Georgia's UI Trust Fund, and we're, again, engaging in conversations with members of the Assembly as well as the Governor's Office. So I'll go through a few a few considerations, and then we'll continue to work with you. So one is to redirect the administrative assessment. So that, allowing the statutory authority to collect the administrative assessment from employers to lapse, that would redirect about $20 million annually from the straight treasury directly to the UI trust fund. So that's one option. You could also establish a waiting week period. And so 42 states right now require a 1-week waiting period before claimants can receive benefits. Georgia, however, issues 2 weeks of benefits in the first payment. And so if you institute that waiting week, it reduces the initial payment to 1 week. It does create a cost saving equal to 1 week of benefits. And what we know from our data is that the average claimant relies on UI benefits for 8 weeks. They can receive up to 14 weeks, but they're waiting, they typically use 8 weeks. And so many will secure employment before that 21-day processing period. So when you have the waiting week, you do create a savings. You could appropriate state funds into the UI trust fund. Some states, such as Texas, have directed state funds into their UI trust fund to accelerate solvency. And you could adjust the taxable wage base. This is not what we're recommending, but it is one of the methods that you could consider. So again, increasing the taxable wage base is used by other states. It is not our recommendation. However, just so that you do know, Georgia's current taxable wage base is $9,500 per employee. And it's the lowest among the 8 southeastern states. The lowest is Florida. The highest is North Carolina at $32,600. So it's something to be considered. I'll also just note that maintaining one of the nation's lowest taxable wage bases supports Georgia's standing as the #1 state for business and for talent and helps keep us competitive. So those are some options that could be explored. Certainly we are open to exploring other avenues as well, but I appreciate the question. It is a pressing matter for our agency, and certainly I know that it is for the legislature as well. Yes, sir.
Thank you, Commissioner Holmes. Colleagues, I first met her over the summer, and I must tell you, it's just a breath of fresh air when you have a new person come in, they put their arms around it, they see what they need, and they actually have a plan of what to do. So thank you, Commissioner.
It's my pleasure. Those who know me know that I like a plan. I like to work the plan, and I will deliver on the plan, so I appreciate that.
Thank you. That's it.
Okay, well, thank you so much for the opportunity, and again, it's a team sport, and we're delighted to be working with you.
Next up is Commissioner Frank O'Connell, Department of Revenue. All right. About got the room transferred over here for the most important man that we're involved with, and that's the man that collects all the money. It's time for us. This is his last time presenting to us. I should know how many years you've been here, Commissioner O'Connell, but I don't. But he likes to have a meeting in his office, so I guess this is the last time that we're going to get to be frank with Frank.
Yes, sir, but I'll try to be frank today as well.
You're always frank. Thank you, Commissioner. Floor is yours.
Thank you, Mr. Chairman, and good afternoon, Chairman Hatchett, Chairman Tillery, and members of the Appropriations Committee. Thank you for the opportunity to speak with you today on the governor's recommended amended fiscal year 2026 and fiscal year 2027 budgets for the Department of Revenue. My name is Frank O'Connell, and I've had the privilege of serving as your State Revenue Commissioner since early 2023, and have a wonderful staff, and would just like to introduce some of them. I'm joined today by Keisha Beavers, our Chief Financial Officer, Austin Gibbons, Chief of Staff, Ananias Williams, Chief Information Officer, and I'll add one of the 3 finalists for Georgia CIO of the Year, Joe Snowden, Director of Government Affairs and Communications. Now, I'm also joined by another special guest, Mr. David Burge. Governor Kemp announced Mr. Burge to be his next State Revenue Commissioner following my confirmation for the Georgia Tax Court. And coincidentally, David and I worked together right out of law school at a law firm called Hansel and Post. For both of our sakes, I won't disclose how many years ago that was. But suffice it to say that we have the same hair color today, and we have the same hair color that time in the book that they used to produce every year of the Young Associates.
I was going to say that your hair coloring is, y'all use the same dye. So.
Now, back then, David worked in a different section than I did, but I found him to be very smart and likable, very intelligent, and I'm confident that all of you will enjoy working with David in his new role as State Revenue Commissioner. Now, before we go into the department's budget requests, I'd like to provide you with some general information and updates about the department. First is our unclaimed property and process improvement project. Unclaimed property, I have to admit, before 30 years ago, I'd never heard of it, didn't know what it was. Now I think a lot of people know what it is, particularly since a law was passed a couple of years ago and we have CDRs, claimants designated representatives. And that was an effort by you all, the legislature, to help unite people with their unclaimed funds. It's been very successful, and I could tell you that in fiscal 24, we reunited Georgia citizens with $54 million out of the fund. Fiscal 25, that jumped to $115 million, so more than doubled. And this year it's trending at over $200 million. That's a lot of extra claims. Fiscal 25, we had over 79,000 claims processed and paid out. We've had a lot of pressure on the team this year, and I've probably had more inquiries about unclaimed property. And in an attempt to deal with that increased volume, number one, we're getting a new system, and we're scoring an RFP that just went out earlier this fiscal year. And so within the next time that the Revenue Commissioner appears in front of you, we'll have a new system for unclaimed property. But I decided not to wait until then, because you can always make process improvements. And so we have a 2-person team of special projects, and they've been examining what our folks do every day, and they have found some ways that we can improve. Did the team want to invite those folks in? No, you never want to have somebody come in into your sandbox, but I told them they were privileged because it was going to make their jobs easier, provide better customer service, and they would be the first, because every division is going to get the opportunity to have a PIP. Now, we're also going to bring forward agency legislation this year to help improve our uniting folks with their property. The principal thing in that bill is called an exact match program. You know, we've got a lot of information about taxpayers, where they live, Social Security numbers, et cetera. We get information when holders submit funds to us that they can't unite with their former customers. And so we're going to ask for authority to match our income tax records up with our unclaimed property records. And then folks, without even making a claim, can be reunited with their property. So we ask your favorable consideration of that. I'd like to move on to motor vehicle. We've made some meaningful improvements. We've got a system called MyMVD, and you can sign up for an account. And in that account, you can do your renewal decals, several other things. One thing that resonated with local folks who are agents and staff all the county offices was an ability to get a replacement title. Folks used to have to come down to the county offices and present some documents and get their replacement title. But if you live at the same place, same owner, a lot of the information is the same, we can do it online and get you your replacement title within a few days, and you don't have to go anywhere. And I know that because I've used it myself for a title I couldn't quite locate, but I had a new one within about 3 or 4 days. So we're proud of that. Moving into alcohol and tobacco regulation. A few years ago, we updated the alcohol regulations from A to Z. We're going to update all the tobacco regulations, and we're going to modernize the way that we distribute tax stamps. And that's how tobacco dealers pay their fees, is through the tobacco stamps. Up to now, we've had to have an inventory, manage that inventory, send out tobacco stamps, and now we've issued an RFP. We've chosen a supplier, and the supplier is going to take care of the inventory and send out the stamps. Now, the net for us, for the state, will generally be the same, except it will free up 1 to 2 folks whose sole purpose was to manage that program. So we'll be able to redeploy those folks to better uses. In tax operations, we've got our website, the Georgia Tax Center, and one of my things to do has been to make that even more useful. You can look at certain things in your account, you can make payments, but I know from being on our side, there's a lot more information that we can look at than taxpayers could see. So over the last 3 years, I've pushed to have some of the more useful information pushed to that portal. And now we have a lot of tax credits. Now taxpayers can go online and see the tax credits they have, what they've used, what they've got left. And importantly, they can see what they've transferred, because a number of our tax credits are transferable, and they can see where they've pushed those tax credits and what the status of those is. Also with net operating losses. And we're going to continue to make that more useful and increase self-service options for Georgia taxpayers. We're modernizing the voluntary disclosure agreement process. If you've not been filing with us and you think you should have been, you can approach us anonymously, and if the information we get from you pans out, we can limit the look-back period to 3 years and waive penalties. When I started at the department 22.5 years ago, I think we had about 25 VDA requests a year. It's been a very manual, paper-intensive process, but right now we're in a process to make it electronic, no paper, because we've gone to having perhaps a couple hundred VDA requests a year, and that will serve taxpayers better. Just yesterday, I know I didn't know what AI was 3 years ago. We can't get away from it, so we have launched an AI-enabled tool into production. It's called Amazon Q for Connect, and it's going to provide real-time assistance for our compliance division folks. It's going to be able to pull from our FAQs, our regulations, our standard operating procedures. It's been particularly, or can be particularly helpful to our newer agents because, believe it or not, as somebody is on the phone asking a question, the system can listen to that question and already know what materials to pull up for the agent and make it possible for them to answer the question more quickly and accurately. And of course, we have safeguards in place. We let people know ahead of time that we're using AI in rendering this assistance. One thing I'd like to note, we have publications in the state tax world, and they monitor the 50 states. And I've been a little bit disappointed over the last couple of years, but I found out 2 weeks ago that they have put Georgia in the top 10 for tax administration. So I just want to announce that as part of our idea of making things easier and giving taxpayers what they want. It's been recognized by the national state tax press. I'd like to mention a couple of DOR-wide projects. We moved and completed our move in February to 2595 Century Parkway. This consolidated us into a 5-story building with a lower base from an 18-story building. Just in fiscal 25, we realized budget savings of $1.6 million. So something that we're doing to be responsible with our budget. I can no longer sit in my office and see Stone Mountain. I see trees, but taxpayers shouldn't have to pay for my view, and I love trees. So it's been a great move. It's also given us a lot of good meeting space we didn't have before. And so when we had big meetings of groups with maybe 80 or 100 folks, they had to be off-site. Now we can do that internally. And we have 2 large meeting rooms on the first floor. Our next big project that I'll talk about will transition us into talking about the budget. And that project is the 4th round of surplus tax refunds proposed by the governor. This $1.1 billion refund is included in our FY26 budget and will be supported by the legislature's passage of House Bill 1000. Now this is an all-hands-on-deck effort for us at DOR because we want it to be successful as it has been the last several times, and make sure that our customers have a way to self-serve, and also that we're prepared to receive all the calls that we will get. Now I want to move directly into our budget and look at revenues AF26, AFY26, and FY27 budget items. These are located in section 42 of the budget tracking sheets. And I'll reference the fiscal year and specific line numbers as I walk through this recommendation. Now, beginning with amended fiscal year 26, I'll start with our core tax and motor vehicle systems. In section 42, line 42.6.2, the governor's tracking sheet includes $6.5 million for the driver record and integrated vehicle enterprise system, also known as DRIVES. And that's our motor vehicle tag and title system. Now in section 42, line 48 or 42.8.2, the recommendation includes $12.5 million for our integrated tax system, or ITS. These funds are to support a Core 26 upgrade for both systems, ensuring that they remain secure and reliable and compatible with modern technology. Typically, I think vendors have a 3-year cycle. The last version we put into effect was called version 12, and that was in 2022. And it's time to upgrade to the newest version from our vendor. It's going to modernize the underlying system architecture and programming language. We're going to go from something called VB.NET to C#. It's going to strengthen our cybersecurity protections for sensitive taxpayer and driver data. It's been described to me, we have, of course, a lot of sensitive taxpayer data. It'll be in the vault. There'll be an encryption level at which our systems operate on the data. If somebody breaches us and gets data, they're going to get the encrypted data, which will be of no use to them. So a very significant cybersecurity upgrade. It'll also expand some of our online self-service tools, and improve our reporting and analytics capabilities, also allowing taxpayers to complete more transactions online. One last mention about Core 26, it'll improve our cloud infrastructure. We were the first agency to the cloud, and I think the first DOR to the cloud in the United States. It gives you a lot of advantages, but having this upgrade will enable us to take advantage of those ways to increase efficiency of server usage and storage. Now, replacing either one of those two systems I mentioned, because you want to look at alternatives, that would be estimated to cost between $100 million and $300 million. Obviously, this is the most cost-effective way to continue to manage our systems. I asked my chief information officer, because you always want to have something to compare, and of the 50 states, probably about 40, 42 have a system comparable to ours. 34 of them use the same vendor. We do. Would I like to see some more diversity? Yes, but it says that this is a product that works, and that's been our experience. As far as whether we should go to Core 26, I asked them about that. Half a dozen states, even though this is a fairly new upgrade, half a dozen states have already started, including one that's larger than us, Pennsylvania, a neighbor, Alabama. So other states are recognizing this is a great thing to do to continue being able to serve your customers and keep your data secure. Now I'd like to turn to fiscal 27. The governor's recommendation tracking sheets includes funding to address also ongoing support and maintenance costs for these same systems. In section 42, line 42.6.5, that recommendation includes $213,815 for drives, and in section 42, line 42.8.5, $225,128 for ITS. And these funds are to support the annual 3.5% support and maintenance increase under our vendor contract and ensure continued system stability and security. Still within fiscal 27, section 42, line 3400, the recommendation includes $102,546 to address increased postage costs associated with the production and mailing of motor vehicle tags, decals, registration cards, and temporary operating permits. GCI, Georgia Correctional Industries, has served as our primary supplier of these materials since 2015. Each year they submit documentation requesting adjustments relating to postage and the producer price index. For fiscal year 27, funding reflected in this item addresses postage costs only. If funding for a PPI adjustment is not provided, the department would need to address that issue separately through discussions with GCI. Throughout our budget, you'll also see other adjustments that are reflected in the budgets of other state agencies, such as adjustments to billing for Georgia at Work. I would really like to highlight and offer my full support for the $2,000 supplement for state employees and the enhanced retirement benefit for post-certified law enforcement. These raises provided by the governor and the General Assembly over the last several years have been well received by our employees and have been extremely beneficial for retention of our workforce. Likewise, the enhanced retirement benefits for our DOR law enforcement will be another tool in our toolbox as we recruit law enforcement to work in our law enforcement division. That concludes my overview of the governor's recommendations for the Department of Revenue and my final presentation as your State Revenue Commissioner. It's been an honor and a privilege to serve in that capacity. And I want to say that I appreciate the governor's, the committee's time and consideration on these requests, support the governor's recommendation, and we stand ready to answer any questions.
Thank you, Commissioner. We appreciate your expertise, your hard work, and the years you put in, and the time that I've worked with you. You've been nothing but, I'm not going to use the pun, but honest and frank with me. So thank you.
Thank you, sir.
No joking. Chairman Burns.
Thank you, Mr. Chairman. Mr. Commissioner, I just want to add my thanks. I appreciate you, your service. I appreciate your staff. I appreciate the opportunity to work with them on the Georgia 250 tag. I appreciate Alex and Joe with their support there. So looking forward to the next chapter of your career, but I certainly appreciate what you did for the Department of Revenue. Thank you.
Thank you, sir.
Representative Stinson, is that you?
Thank you, Mr. Chairman. And thank you, Mr. O'Connell and your team. They do a really great job, especially Austin. I can call him anytime, so I thank you. But I have helped a few constituents with the unclaimed properties.
Yes.
Most of them that have had loved ones to pass away, and they have to get death certificates and all of those items are sent over. Oftentimes they come back to me because apparently there must be more documentation is required other than a death certificate when they are applying for benefits on behalf of a family member that's passed away. Is there anything that you can tell me that I need to make sure constituents are aware of, so as they are working toward this endeavor, they will be better prepared?
Of course, it's more difficult if it's somebody else's property that you're trying to claim. Some of the cases that have come up to me have been a similar situation, and the death certificate would be one of the documents. I'm not sure what other documents we're requiring. I know there was a document when I looked into some things, and I'll just tell you what it was. It was a funeral bill that we wanted, and we told our folks, that's not something that we need to have to identify the person who should get these benefits or this property. So yeah, I'd be happy to work with you and let everybody know exactly what type of documentation we require in that instance, because it shouldn't be a mystery, and I'm sorry that your constituents have had difficulty with that.
Thank you.
Yes,
Chairman Chokus.
Thank you, Mr. Chairman. Commissioner, I'm Mike Chokus from Americus, Georgia, and I just want to give a great shout out to one of your staff members, Jason Larkins. I've called him at all hours of the day, and his responses have been immediate and very, very satisfactory, so I just wanted to give him a shout out. Thank you.
Thank you, sir. Jason Larkins is, in fact, the most popular person at the department.
He listens and he gets things done. We
Yes,
appreciate it. Representative Washburn.
Thank you, Mr. Chairman. Commissioner, I want to join the chorus of shout-outs to your employees. I believe you have Robert Worrell, is it? And he helped us a great deal. One of my constituents had a very difficult problem with a truck type. It was very complex, and I was sent to him, and he just responded beautifully, and I got a wonderful text from my constituent praising him for what he did. So just wanted to comment on that, and also to thank you. You've always been kind and helped me anytime I've ever asked you, and you've served so well, and I wish you the best in the future. Thank you, Commissioner.
Thank you, sir.
Well, Commissioner, thank you. You've been a statesman. You have been truly just a steady hand, and your advice was something we knew we could trust at all times. I've enjoyed parsing out withholdings versus any other type of legal matter with you, and look forward to reading your decisions in the coming years. Thank you for what you've done for our state. Thank you for the steady hand that you've been. And David, no big shoes here, buddy. I mean, you just heard every single legislator praise him. So, I mean, we look forward to seeing you at the subcommittee hearings in a couple of days. But welcome as well, and we know you'll do a great job.
Thank you, Mr. Chairman. And let me just say, 14 years ago, somebody at DOR asked me if I ever wanted to be commissioner. Of course, I said no. That job was too big for me. But these have been the 3 most rewarding years of my career. So thank you very much. Appreciate it. Thank you. Thank you. Oh.
He's been extremely competent.
Next up is Jim Potvin, our retirement man.
He's competent too. Thank you. Jim, thank you for being here. Sure. Looks like it's cleared out really well. If you'll go ahead and get started, we'll stay on time. Thanks for being here this afternoon.
Thank you, Mr. Chairman, members of the committee. I'm Jim Potvin. I'm the Executive Director of the Employees Retirement System of Georgia. Just to kind of remind everybody of who we are, we're responsible for the administration of state retirement plans for state employees, the largest being, of course, the Employees Retirement System itself, a number of other defined benefit plans as well. In total, those defined benefit plans have approximately 120,000 active members, 79,000 retirees, and we're approaching $25 billion in total assets. And a statistic that I like to share frequently is the economic impact for the state of Georgia, which various studies that I've seen have estimated a multiplier of about 2 to 3 times the amount that we pay out in benefits, which would put the Georgia economic impact in the neighborhood of $3 to $4 billion per year. So we're very proud of that. Over 90% of our retirees still live in the state of Georgia. As I said, the ERS plan itself makes up the majority of that, 58,000 active members, which is notable because it's up significantly from our low of just over 52,000 just a few years ago. The recruiting retention initiatives that the state has undertaken in the intervening years, I believe, are really bearing some fruit there. About $20 billion in total assets and a funded ratio of just under 76%. And I'll have a lot more to say about that figure in a few minutes. We also have other responsibilities besides the defined benefit pension plans, including the Peach State Reserve's 401k and 457 plans, 97,000 total accounts. About 44,000 members are GSEPS members. That's the current tier of the ERS plan. So about 3/4 of our active population are members of GSEPS, and they make up a very large and growing proportion of the 401k plan at this point. The Georgia Defined Contribution Plan is a savings plan for part-time and seasonal members. Group term life insurance is actually 2 plans that were closed in 2009 but still have a substantial number of members for whom we administer benefits. We also serve as the state's Social Security administrator. Coordinator might be a better word. As far as the governor's budget recommendations for amended 26, that begins on page 192 of the governor's budget report. No change to our deferred compensation program. That is largely, almost entirely paid for by plan fees and forfeited employer contributions. The Georgia Military Pension Fund and Public School Employees Retirement System both are seeing decreases in their funding requirements from the previous year to the current year in accordance with the plan valuations. So we're bringing that money back to the state. And the fourth one is not a change. System administration itself, we're not asking for any change, but I did want to highlight that in FY26, $36.75 million was appropriated on an extraordinary basis outside of our actual actuarial contribution requirements to be paid to our eligible retirees in the form of one-time payments, and those payments were made this past December. Maximum payment was approximately $830. For fiscal year 27, again, in the deferred compensation program, there's no change to the budget request. The Georgia Military Fund, again, sees a decrease in its actuarial valuation, actuarial contribution requirements, about $76,000. Public school system sees a decrease of about $5.4 million. Part of that is due to the fact that previous year's plan changes, for which we had to do temporary increases in the contribution requirements, have now been rolled into the overall valuation, and so we don't need those extra contributions added anymore. And again, in the system administration area, $26.75 million to be paid, to be appropriated, to be paid in one-time payments to ERS retirees in FY27. This represents a $10 million decrease. So we're going back to the base level of $26.75 million, which we've had for several years now in the budget. And I also want to highlight the governor's recommendation under the GSEPS tier in the 401k plan for state law enforcement officers, a budget item of about $5.2 million, which will support an enhanced 401k match. You may recall a few years ago, we created an enhanced match for all state employees, including law enforcement officers, which resulted in the possibility of an employer match of up to 9% of pay. This newly enhanced match for state law enforcement officers alone will improve that enhancement up to 15% of pay. So the remaining population will stay at the level that we established a few years ago. So I thought I would take a moment to kind of look back over the past several years, kind of give you a little bit of the history of the progress that we've made and some of the steps that we've taken to get to the point where we are at today. This is a simple graph of our funded ratio over the course of the last 7 actuarial valuations. Honestly, it doesn't look particularly impressive. We've been pretty stable over that 7-year period. Funded ratio, which is the ratio of actuarial assets to actuarial liabilities, is the most common kind of simple metric that we use to look at the relative funded status of the system. But what I'm here to tell you is that just the funded ratio by itself does not tell you the full story, and I'm going to describe to you what is going on kind of underneath the hood, so to speak, to get us to where we're at today. So over the course of the last 7 years or so, we made a number of changes to the actuarial profile of the system, and these are all very significant changes. Our assumed rate of return, that's the assumption of what we're going to receive in investment return for every year into the future, was reduced from 7.3% to 7.0%. Along with the idea that we're trying to become a little bit less dependent on outsized investment returns going forward. That also serves to reduce our discount rate, which means the present value of benefits is a little bit higher today than it would have been using a higher discount rate. These have the effect of increasing the liabilities of the system. Our amortization period for any unfunded liabilities has been reduced from 25 years down to 20 years, being a little bit more aggressive about paying back any unfunded liabilities, doing it in a shorter period of time. The state has made the commitment to increase the required annual contribution in order to support that. Mortality improvements. So every 5 years we do an experience study where we look at the assumptions we make in the actuarial process, and we evaluate them against what has actually happened over the prior 5 years. And if we seem to be off track in any of those assumptions, we make adjustments for the following 5 years. Previous two experience studies that I've conducted, both included significant changes to our mortality tables. People were living longer, we weren't recognizing that as quickly as we needed to be, so we had to improve, basically extend the lifespan assumptions in the actuarial evaluations. Again, we're adding expense to the system. I'm pleased to report that the 2025 one, which we just completed, has virtually no change in the liability overall. So we are doing a much better job of anticipating what those liabilities are going to be going forward. And finally, and perhaps most significantly, we began pre-funding a COLA for the first time in our history back in 2022. So far, we're able to support an average COLA of 1.05% going forward. That's the amount of funding that we are receiving. That's a number that we do expect to change over time, and I'll talk about COLAs a little bit in a second. So that's on the actuarial side. Added a bunch of expense. State of Georgia then went ahead and continued its record of meeting its funding obligations when expenses arise. So what did we do? Well, perhaps it goes without saying, but I never take it for granted. We receive 100% of our actuarial contribution requirements every single year. A lot of states can't say that. So thank you for that and for your commitment to meeting the obligation to our pensioners and retirees. In addition, the pre-funding of a COLA required a substantial increase in the funding requirements. It was almost 5% of pay, about $150 million per year indefinitely into the future. That was met. We received, and once again, thank you for this, two $500 million cash infusions in the last 2 years. That $1 billion was put into the system in order to improve the funded ratio of the system and get us on a path to back to that 100% funded ratio that we've been looking forward to. And finally, as I've mentioned, we've received now 4, if I can count FY27, we've received 4 separate appropriations annually for contributions totaling $117 million to be passed through to our retirees in the form of one-time checks. So this will be the 4th year in a row that we are able to provide those. And we've also had, so to speak, the wind at our backs a little bit. The investment environment over the course of the 7-year period has generally been quite good. The numbers here mask some volatility. Obviously, there's the one outlier, FY22. But other than that, even within the years, there's some volatility there that doesn't really show up in these numbers. But what we're booking in terms of final results for each year has been very strong, particularly in 4 out of the last 5 years. A 7-year average of 9.6% suggests that our assumption of 7.0% is well within reason. This is where I make my obligatory caution statement, where I say, look, it's great that we have these. I'd much rather book them and be prepared for possible regression or downturn than the other way around, where we've already had the downturn and we're kind of hoping for a turnaround. So I'm happy with where we are. I don't assume that we're going to continue to get 9.6% per year going forward, but it is something that does help us when we are trying to make decisions and meet our obligations. So far in FY26, when I created this slide a couple days ago, 10% was the number. Today it's 8.5, so a little bit of that volatility that I was talking about, but still a strong start to fiscal year 26. Okay, so back to the last 7 years, which I already showed you. This is what the next 5 years looks like projected when I add it to those last 7 years. The circled spot is where we are today. I guess I should caution you, this is not a prediction of what's going to happen. It is a projection based on our current set of actuarial assumptions and assuming that we hit them right on every year. Those projections will change each year, but I will say this is the strongest set of projections that I've ever seen in my time here. So all of the stuff that we have done up to this point, all those changes to the actuarial assumptions, to the funding and all of that, has put us on what I would suggest to you is a very, very positive trajectory, which could have us meeting our 100% ultimate funding goal much earlier than I thought even 4 or 5 years ago.
Director Potvin, at what point during the year do you compare that ratio? What day do you use?
These are the June 30, these are the actuarial valuation numbers.
So do you have the number for June 30th of '25?
I do not. That will be our next valuation, which will be in
How long does that
April.
take?
To get it, it will be in April. However,
You've shared a number with us. Are you going to share us that number with the rest of the committee?
I am going to share that number.
Thank you.
I do have some projections from the actuaries on this, and that number is actually hidden in this chart here. We're going to continue to see. So we saw between FY23 and 24 an increase of about 3.9%. That by itself was the single largest increase that we had seen in at least 25 years. Next year, we are projecting that we're going to go from 76% to approximately 82 to 83%. This is a significant milestone because a few years ago, Chairman will recall that I had a conversation with him where we wondered how long it would take us to get to 80% as sort of an intermediate goal. And I, at that time, told him it would take approximately 3 years. And that was with the two $500 million infusions. As it turns out, taking advantage of the positive investment environment and the money that we have received from you, and we're going to get there a year earlier than I thought. So this is good news just from this general standpoint of being in a better funded position, but it also helps us with the COLA formula. The COLA formula depends in part on where we are from a funding perspective. We look at recent investment results, we look at the funded status of the system. As it crosses 70%, 80%, 90%, the COLA formula gets more generous. And so hitting 80% this year will help us provide a little bit more substantial COLA this coming year. I don't have a final number on that, but we're looking at something, if it stays just between us, something close to 2%. Which is much more substantial than we've done up to this point. And just on the outlier years here, we're looking at 100%, potentially as early as 2030, if all goes according to the projections. So back to COLAs just for a second. I've mentioned it several times already. I just wanted to kind of consolidate everything that we have done into a single slide, just to give you an idea of the focus that's been put onto this very, very important issues for our retirees. First of all, the formula that we use today was established in 2022 in conjunction with the $150 million per year commitment from the state. Basically, they said, we have $150 million available. What can you do with it? We created the variable funding policy, the variable funding formula. I think it's important that we keep it as a variable formula. I think it's important that the system be able to react to events. If funding goes up, it should be more generous. If funding goes down, we should have a way to kind of tap the brakes and kind of help the system recover. If investments are good in recent years, we have the ability to do better. If investments are poor, we want to, again, tap the brakes. So those kinds of things are important. That's why it's a variable formula rather than a flat one. $150 million funded an average 1.05% COLA for indefinitely. I will say that experience study that we just completed, because our funded position today is better than it was in 2022, the same formula actually can now be expected to produce a 1.15% annual COLA. Incremental step, without a doubt. But at least it's a step in the right direction, and it positions us to take further steps, hopefully sooner rather than later. Again, the 4 annual contributions to fund one-time payments to COLA-eligible retirees. That's sort of the second leg of this process. And then the third leg, again, is the 2 $500 million contributions to increase the funded ratio, which hopefully will lead to a sustained level of higher COLA payments. Now, it's all on the defined benefit side. As I said, ERS currently is in Tier 3 of its existence, what we call the GSEPS tier. It was established in 1/1/2009 as a so-called hybrid plan. It's really just 2 plans, a pension, smaller pension benefit than it used to be, and this 401k with a match. The match, when implemented, provided a maximum match of 3% of pay. We increased the default employee contribution rate, which was 1% at inception. In 2014, we made it 5%, which led to significant improvement in savings rates. Folks tend to stay where the defaults are, so we wanted to put them in a position where, at least to start with, they were going to be able to receive the maximum match available to them under the plan. What they do from there was up to them. Fortunately, many of them decided to stay at the level that we defaulted them in. And then, as I said before, effective in July of 2022, the 401k match was significantly enhanced to be dependent not just on the amount of savings that the person has, whether they save 1%, 5%, 10% of pay, but also their service. So anybody who has more than 5 years of service can be eligible for an enhancement to their 401k match as long as they continue to save the 5%, and that enhanced match could be up to 9% of pay. And again, this structure is the model for the law enforcement 401k improvements in the governor's budget recommendation, but in that case, it's a maximum match of 15%. Just a few charts to sort of close this out and give you an idea of how we've been doing, what our experience has been. Participation is just how many people are saving more than 0%, right? So in 2018, we were at about 88.5%. Today, and for the last really 4 years or so, we've been hovering right around 95%. Very proud of that number. That's considered, in the industry, a good number. I do not take for granted the fact that that means that 5% of our population is not saving. And so we're not getting the benefit of this match on any level, never mind the enhancement. So we do reach out to them. We do have annual kind of campaigns to try to get some of them to save, but there will always be a certain number of them that just, for whatever reason, don't feel the need to do it. Average contribution rate. Again, this started climbing in 2014 when we changed the default rate. By 2018, we were around 4.4% average member contribution rate. Today, it's more like 5.8%. And it's still ticking upward. We've sort of hit a plateau, but it is still ticking upward every year due to our education initiatives. And then here's what happens when we enhanced the match in 2022. When the maximum match was 3%, the average could not be more than 3%. So you can see we were in the low to mid twos in the years leading up to 2022. Once we added it, the enhancement, it became a dollar for dollar up to 5%, and then the enhancement above that. So our average employer contribution to the 401k plan went from 2.3% to about 5.1%. The average account balance, I don't have that table here, but the average account balance increased from $8,500 to $30,300 just in that 7-year period. So we're getting roughly 20% per year increases on average in our account balances. So the total that is going into the accounts every year, whether it be employee contributions or employer contributions, has increased from 6.7% to 10.9% during this period. So 4% more per year with compounding, that's going to make a real difference in the outcomes for many, many of our retirees. So we're very proud of this. Incidentally, I did pull some numbers at the last minute on the folks who are eligible for the enhancement above 5%. So it turns out that 37% of our GSEPS population is eligible for something higher than a 5% match, somewhere between 6 and 9%. Their average employee contribution is 6.5%, so it's higher than the 5.8% in the population as a whole. Their average employer contribution is just about 6% exactly, so their total going into the plan is actually 12.5%. So in the early years, it's already evident that that enhancement is beginning to work as if we designed it, and we should have longer-term positive outcomes for that population. And by the way, their average account balance is almost $60,000. Part of that's due to the fact they've got longer service, but part of it is also due to the early stages of the enhancement. So I will stop there, and I'll be happy to take any questions.
Oh, you have one. Go ahead, Chairman.
Director Jim, great to have you here, and enjoyed working with you over the years. I particularly enjoyed working with you on that 9% that we did a few years back, and glad to see that it's actually working. I hate that the governor is going to one-up my bill by going to a higher percent, but at least he said he's using the same structure.
We're blazing the trail.
This is, I guess this question back on the previous plan. I didn't see any chart, and this is a little bit morbid, but eventually that plan is going to go to zero.
The new plan?
The old plan.
Yes, that's correct.
So it's going to trail off because the new employees are on the plan and other people is there any, you have any kind of a chart that would show how that fund, I mean, eventually should keep dropping, I guess is what I'm saying. You don't have any data on that, do you?
I don't have a lot on that specifically, and the reason is that's a long ways away, to be perfectly honest. The number of retirees that are coming out of the new and old plan out of the total population is still like 98, 99%. So we have very few GSEPS retirees yet. And so the tail on this, well, let me put it to you this way. Remember the first tier, the old plan, right? We closed that tier in 1982. There are still 7 state employees who are old plan members.
Okay.
It's going to be a while before we lose all of our new plan folks as well.
All right. Well, again, thanks for your work, and as we said before, if everyone will do the 9% match, they'll retire as millionaires, and I hope they do that.
That's right.
Chairman Carpenter.
Just had a thought the other day when we were listening to GDOT talk about the private-public partnerships on Peach Pass lanes. Has there ever been any thought about doing some of that type of stuff with the state so we would actually be paying the return to ourselves, if that makes sense?
I do understand. Honestly, our asset allocation for our systems is very, I don't want to call it vanilla, but it's very, very simple compared to a lot of other states. We're pretty much a stocks and bonds shop. About 60%, 65% in stocks, depending on, in public equities, I should say. Maybe 30%, maybe a little bit less in bonds. We do have a small allocation to what we call alternative investments, but that's pretty limited in scope. We do private equity and not much else. So whether there's been any serious thought, I can't say, but I don't think that there are any plans in the current year to do anything quite like that.
Director Poppin, that's all the questions. Thank you, sir.
Thank you, Mr. Chairman. Thank you, members.
Next up is Director Branch with the Teachers Retirement System.
We'll have to check this guy's ID up.
Welcome. Thank you for being here today, and the floor is yours.
Thank you very much. Good afternoon, Chairman Hatchett, Chairman Tillery, members of the House and Senate Appropriations. It's my pleasure to be with you this afternoon and take the opportunity to talk a little bit about TRS as well as share our budget requests. To give a little background on TRS and Teacher Retirement System, we are governed by a 10-member board of trustees. Currently, we have 9 trustees. Mr. Tom Norwood stepped away in December after 18 years of service, and we want to thank Mr. Norwood for his outstanding service to the state of Georgia and Teacher Retirement System. There is a process currently underway by our Board of Trustees to fill that vacancy, and we feel like that's going well at this time. Currently, we do have 6 educators on our Board of Trustees, 2 active superintendents, 2 active teachers, a retired teacher, and a retired principal, along with, of course, several other outstanding leaders. I am coming on new as the executive director after serving on the board for approximately 8 years, filling the big shoes of Dr. Buster Evans, who served the Teacher Retirement System for nearly a decade and served on the board as well. And so while I may be new in the leadership position, our team that you see here has over 100 years of experience with Teachers Retirement System of Georgia, so we're in very good hands. A little overview of our system: founded in 1943, operational since 1945, paying out our first payment in March 7th, 1945, of $41.69. So benefits have come a long way over the years, celebrating 80 years of service to over 500,000 members. Currently, we have about 155,000 retirees and over 242,000 active members. Our plan design currently calls for years of credible service multiplied by 2% for each year, and then looks at the high average 2 years for the maximum benefit. It takes 10 years to vest in our system, and retirement eligibility happens after 30 years of service at any age, and 10 years of service at the age of 60. You can retire with 25 years of service with a penalty. We do pre-fund a COLA through employee contributions that's paid out at 1.5% each year in January and July. And as we are an IRS 401A administered plan, we do follow IRS guidelines as well as state law that currently has an anti-spiking provision when it relates to salaries. Currently, we are the 18th largest pension system in the nation. Assets of the fiscal year, $116.8 billion, $6.5 billion paid out in payroll around our state and country, and then an economic impact in our state of $9.3 billion. We did send an email to all of our House and Senate members, as well as give a hard copy of our economic impact. Hopefully you've received that. If not, it should be coming to you soon. That reflects not only the state economic impact, but the economic impact in your particular area as well. You see here some payroll information. We do offer 6 various retirement options to our members. The Max plan continues to be the most popular option, with about 60% of our individuals choosing that, but we do have several options, and those are chosen at the individual level. Payroll stats as of July 2025, roughly 140,000 service members, or service retirees rather, receiving around $3,700 per month, an average year of 25.5 years of service at retirement, an average age of 60 at retirement, and our retirees average around 72 years old that are currently receiving benefits. Both of those numbers are up slightly. About 2 years ago, it was at 59 for retirement, and as you can see, we were 71 last year in the fiscal year for our average payment. We are pleased to see that over 99% of our retirees are receiving electronic payment, which we believe aids in helping us not have as much fraud and keep their money safe. We want to get that to 100%, and we are continuing to work in that direction. You see here now retirement trends over the last 20 years or so. We average around 6,000 retirees per year. That's roughly 3% of our active members. And you can see that as of the close of 2025 calendar year, we had about 2,200 retirees this year so far. That is on pace for us to continue to have around 6,000 retirees. Of course, several of our retirees are interested after a while returning to work, and so we have some return to work stats here for you. Last year we saw over 15,000 return to work in a part-time capacity primarily. Thus far this year we've seen around 13,000. We're pleased that we work with our employers and we can auto-approve those at a rate of over 80% in under about 10 minutes, making that good for our retirees returning to work and also our employers that they're assisting. Of course, since July 1st, 2022, House Bill 385 has allowed some of our retirees to return to work full-time in high-needs areas to assist in our educational settings. And you can see here that we've had roughly around 1,750 or 60 so do that since July 1st, 2022. This year, we've had around 430. Interestingly, House Bill 385 was recently audited, and the numbers came back that our retirees that are returning work on average have been retired 4.5 years when they do choose to return back to work. See here our current contribution rates. Employee is at 6%, employers at 21.9%. Of course, those funds then go into our investment pool, which helps pay for this lifelong benefit. You see the asset allocations for our current investments, equities at 74%, fixed at 25%, and alternatives at 1%. You see the return on investment out to the side, positive equity market of 14.4% that really helped us with the 12.2% return that you see there. Historically, over the last 50 years, we've had an annualized return on our investment of over 9%, and 14 out of the last 15 years positive investment returns. Recent market trends over the last 3 years, we've had a combined 38.6 return on our investment. You see here that in FY 2024, 14.5%, that led the nation. And once again at 12.2%, while we don't have the particular stats in front of us at this time, we are seeing that those are also going to be in the tops in the nation as well. 80% of our assets are managed in-house at one of the lowest cost comparable to plans nationally. You see next our funding ratio and employer contributions. Our employer rate has remained stable over the last several years, and we predict it to decline over the next 5, as well as our funding ratio to increase over the next 5 years. You see we're currently at 77.9%, headed to 79.7%. And then, as you can tell, we're headed to close to 90% as we reach 2030. A few sustainability changes that our board has taken over the last decade here, designed to conservatively manage our fund. Adopted a 30-year amortization schedule in 2014, looked at that again at 23 years in 2022. As been discussed earlier by our counterparts in ERS, we have also reduced the assumed rate of return from 7.5% to 7.25% in 2019, and then again to 6.9% in 2022. Recently conducted an experience study to look at our retirees, the trends, the salaries, to make sure that we are making the proper assumptions, and have had good feedback on that as well. To get to the meat of why we're here today, our budget requests are currently for $26,000. This is a $36,000 reduction from our recent request. That is due to a decline in the numbers of teachers who qualify for this particular benefit that's funded. This benefit is designed to provide retirees from local retirement systems a minimum allowance upon retirement. We currently have 2 individuals who remain under this plan. Both of those individuals are over the age of 90, and so we do respectfully request $26,000 in both the amended and the FY26. Finally, giving you a lot of stats as it relates to TRS. Thought I'd give you a fun and encouraging one. Over 11,000 of our retirees are over the age of 85. That's roughly 7% of our retired members. Take it one step further. In fact, we have 89 of our beneficiaries that are over the age of 100. So I like to say that retired educators are not only the happiest people I know, but perhaps the healthiest as well. So with that, I'd be happy to answer any questions that individuals may have.
Thank you, Commissioner. Representative Franklin.
How you doing, sir? I want to welcome you to your new position. I know we will do a great job, and I look forward to working with you.
Thank you.
In the future. The question I got, did you say there was 1% invested in alternative investments? Is that correct?
Yes, sir.
Do you see any appetite to increase that at all, or do you predict that's going to stay at that level?
We have taken some measured steps into that since we've been allocated an opportunity to do so. I think we're capped at 5%, so we're taking marginal steps within that, but it has grown every year with the opportunity.
Okay, I think we increased it a little bit more than that, but I was just curious to see if y'all were going to
Yes,
do it.
sir.
Thank you, sir.
Chairman Hubstetler.
Yeah, I think it's 10% on the ERS and 5% still on the teachers is what
Yes,
it
sir.
is. So the assets grew from 106 to 116 billion. And I noticed you had Buster sitting back here. You got a phone a friend
There you go.
available just in case. And you had, I think it said 77.9% funded. I know in the book, I thought I saw 85%. So was the difference in that the 5 years, I guess you call it smoothing or wherever you don't show it all, you kind of spread it out over 5 years?
We do smooth out our returns over a 5-year period to keep the volatility down. Yes, sir.
So does the book have the non-smoothing and this is the smoothing number, or?
Let me check on that for you and get back to you on that. I don't have the book in front of me at this time, so
Okay.
I apologize.
Thanks.
Commissioner, that's it. All the questions. Thank you.
Thank you.
I got to come up with something.
Next up is, I can't read it, Director Ollie, no. Commissioner Angelique McClendon, Director of Driver Services. How are you today?
I am wonderful.
Good.
Thank you.
Welcome.
Yeah, and I have Bob Griffin is here. He's our deputy commissioner, and he's a former CFO.
All right, floor is yours.
All righty, so we'll get started. But first, good afternoon. I know we're late in the day, but I do want to thank you for your previous considerations over the past years. But what we've done so far, we've improved retention. You'll see that. We've been able to serve customers at the same level, I would argue better, over the past year at least. We've expanded services without expanding staff by doing things like adding a self-serve kiosk, things like that. But overall volumes higher, but wait times are shorter. Processes are more efficient. Technology is better, and we're heading into our second decade as DDS. So I don't know how many of you might remember, but House Bill 501 was passed in 2005, and so it makes 20 years as the Department of Driver Services. So at that point, DMVS was broken up to create Department of Driver Services, and as you know, as you've heard today, motor vehicles is with revenue. And so we have a new commissioner, but the same mission, same core values. Short update on what we're doing. Again, it's 20th year, so the 20th year is supposed to be your platinum year. If you are married, that is your platinum year. Just don't forget that. And some of you might have passed that platinum year. So you're supposed to give platinum on that on the 20th year. So this year is our platinum service year. So we believe we have delivered that platinum service, and we will continue to deliver that service. But in 2025, our average wait time was 6 minutes and 10 seconds. And that was 1 minute and 16 seconds shorter than the previous year. And the average longest wait time was 15 minutes and 35 seconds, and that was 3 minutes shorter than the previous year. Now, the previous Commissioner Spencer Moore was awesome, but these numbers are better, I would argue. And but we keep our focus on wait times, but we will also want to focus on the quality of the service as well. And just at a glance, there are 9.1 million valid drivers in the state of Georgia. Over 400,000 of those drivers are commercial drivers. And at the end of 2025, there were almost 600,000 digital license users. And how many of you have your digital license on your phone? I see a smile.
I got a picture of it.
That's not it. That won't work. we'll get you squared away after this. We'll get you squared away. But we have surpassed, but now, that was at the end of 2025, but we have since surpassed 600,000 digital licensed users. So if you are a person who uses your phone to pay for things, that's how you add that credential to your wallet, in the same way you go to your wallet on your Samsung or your Google or your Apple, whatever your platform is, and you find a state, because we were one of the first, but we're one of many now. You find your state, which is Georgia, and you add that, and it will walk you through those steps. And so we've made a lot of strides in that area as well. And of course, we have 68 locations. We have a new one that since we last were here, we have Hazelhurst in South Georgia. So we cut the ribbon in Hazelhurst not too long ago. But that site, we've conducted many CDL tests, commercial testing. We've served about 2,300, a little over 2,300 customers since the end of September. That's when we opened. And our average wait time was in line with our standard wait time. It was less than 30 minutes. It was around 6 minutes. And the site employs 8 people down there in Hazelhurst, Georgia. So that was a great addition. And again, last year we had 11 commercial testing sites. This year we have 12. And so last year we served over 4 million customers, 4.1 total customers served. And so that's great. That is a huge increase. That's a 6% increase from the previous year. But that more customers means more calls, more mail, more transactions, more face-to-face interaction, more remote transactions, more need for cybersecurity. So the increased volume matters a whole lot when it comes to our business. And then 158,000 of those customers that were totally served were served on kiosks, the self-serve kiosks. You have many of those throughout the state. In grocery stores, those yellow machines, we have our services in those machines. And then we have self-serve kiosks in the locations when you come in, where you can, many people like it because you can take your own picture and you can do retakes if you like, if you don't like those pictures. So I've seen a lot of people who actually have the patience to do it. I mean, you think some people come in and they might want to see a person, right? But a lot of them love going to the kiosk. 158,000 of them have done that, so that's great. So as I travel around the state and go to each locations, I'm getting around to it. I mean, 68, so I haven't made all 68 quite yet. I think I counted 28 so far since May, since I've become commissioner. So I've been counting since I've become commissioner. I've been at DDS 10 years as general counsel, so I'm not counting that time, but since I've been commissioner, traveled a lot throughout the state. We have, again, 81 kiosks. Our services are in 81 ITI, those yellow kiosks in the grocery stores. We have a total of 23 at locations. And so we're in the process of adding some more self-serve kiosks inside our locations. And speaking of those types of services, remote services, non-people-facing services, we serve 1.1 million customers that were served online and through the app as well. But again, that leaves 2.9 million that were served face-to-face. And on peak days, which are Thursdays and Tuesdays, we can see upwards of 16,000 or more customers. So again, about 30% of our customers are served remotely, and 70% are still served face-to-face. So,
Commissioner, do you have any idea the number of first-time license?
You know, I don't know the number of first-time licensees.
Yeah, I mean,
that's an interesting number. Yeah, that would be good. And those are actually, you know, what we'll talk about throughout this presentation are the predictables, right? So we know who needs to renew. You can kind of predict replacements maybe based on previous years, but we have been thinking about other ways we can try to estimate things like how many people would be new drivers, and we would have to work with population statistics to figure that out, but I do think that's a great question. Our budget is in 3 categories: administration, license issuance, and regulatory compliance. So we'll start with the administration program. We're very appreciative of Governor Kemp's salary supplement additions. This will prove very, very helpful for retention and morale, but we're requesting $114,109 to accommodate the one-time salary supplements for employees in this administration program. And you see on the slide CDL federal mandate notifications. From time to time, we have federal mandates that come to our state that are related to commercial drivers. And so to implement those, we have to have system changes. We have to notify these drivers of those changes. And we have listed on the slide 3 that we had to implement within the past year, and those involve multiple notices to drivers of the coming changes, sometimes, unfortunately, of revocations. So that's unfortunate, but we do have to notify the drivers. So we're requesting $150,000 to accommodate those implementations. And to continue with the license issuance program, we're requesting $1.7 million, over $1.7 million, to accommodate the one-time salary supplements for the license issuance program. This is our largest group, so this is over 800 employees. We're requesting this amount, the $1.3 million, for increased card production. That's that increased volume that we talked about. As I mentioned earlier, it leads to more transactions and more work overall. You have more cards, more mail, more calls, more interaction, more system changes, and things like that that are needed when you have that extra volume. And so we had to issue about 250,000 extra cards. If you do the math from year to year, our increase from the previous year, that's around 250,000 as well. And this is the prediction that's based on expiration dates and actual cards that were issued. And again, these are the predictables, but as we just talked about, there are some other variables that are unpredictable. We talked about new drivers. There's also new to Georgia. That's hard to predict, and we've seen that increase. There's also mail costs that we don't control necessarily that are part of the variables that impact our car production costs. And the third bullet you see there is for armed guard services. So our locations, again, we mentioned 68 different locations that we have throughout the state. They do not all have security or armed security. We would love it if they did, but they don't. We have 12 post-certified law enforcement on staff. Of course, 12 is not enough to cover 68 locations, but 8 of them are assigned to locations. They are primarily fraud investigations, but they are post-certified and state-certified law enforcement. But we do have armed guard services at 5 locations currently. So we're requesting $150,000 to cover the cost for the armed guard services. And just to mention, when we just talked about physical security with armed guard services, another thing we're doing that has not required additional resources is that we're using one of those post-certified law enforcement officers on staff who has 3 decades of law enforcement experience to do security assessments. So he's traveling to each location. He's making security assessments and creating reports so we can figure out what we can do to ensure the safety of our customers and our team members without coming back here necessarily for certain requests. But some requests we do make are based on the research that we've done from those security assessments, and we'll see that a little bit later in the presentation. So continuing with the license issuance program, leases have increased. So several locations, 9 to be exact, the lease amount has increased. So we're requesting $139,000 to accommodate for those increases for the leasing of those facilities throughout the state. And they're in different parts of the state. We are requesting $185,000 to continue compliance with GTA security and infrastructure, and that's just penetration testing and compliance testing for our back-end system. So we want to concentrate on cybersecurity as well as physical security. And then there's drives, cloud migration support, $428,000 we are requesting for that. And that is to support the drive system, which we have a joint project with, of course, as you can recall, with Department of Revenue. But this is for DDS system maintenance and mandatory upgrades that might come out of legislative changes. Continuing with the license issuance program, we are requesting $2.4 million to support personal services for decreased turnover. So our turnover has greatly increased, and that's great. We need retention. We need to retain team members for their knowledge, their service, and that's really how we can keep that good customer service, by people who are knowledgeable and are at that top level. But to retain them costs. They receive promotions, they receive standard increases because they have been there for a certain time, and so we're asking for $2.4 million to cover the costs of decreased turnover. And our smallest program is regulatory compliance, and we are asking for $27,000 to accommodate the one-time $2,000 salary supplement for the employees and the team members in our regulatory compliance program. So we'll move on to our bond request. Our bond request consists of funds for support of facilities and upgrades for the facilities, the security, safety, and the NextGen project. So we need to replace time clocks and ticketing equipment. That's $1 million that we are requesting for that equipment. We are also requesting $1 million for facility safening and hardening initiatives. So that's a part of those security assessments that we've been doing, where we found that certain materials are resistant to weapons, and that they are helpful to secure the counters and the other building material where our team members are during work hours. And then the CSE counter replacements, we're requesting $430,000 to replace older, worn counter materials. And some of these counters are over 20 years old. And for our FY27, a lot of these are the state required requests. But then you also see in these requests, you'll see the CDL federal mandate notifications. Of course, this is year after year that we have the commercial driver federal mandates that we have to comply with. And again, part of that compliance is to make system changes and notify those customers of those changes. The license issuance program for FY27, we have the same statewide requirements, the same state requirements that are in this request, but then we also have some requested services and for armed guard services, lease increases as well, and then the GTA security services and infrastructure are in this budget request as well. And also for the license issuance program, the personal services we just discussed, due to decreased turnover, obviously, we are requesting $2.3 million for personal services due to decreased turnover, and also we have received funds for SAVE, that is the non-citizen verification system that we've been using and utilizing since around 2010. So there are funds that are typically associated with SAVE, and so from time to time there might be some, I guess, federal waivers of those fees, but then also at any point in time those costs can be put back onto the agency, and they also can increase as well. So we are requesting the funds to make sure that we can maintain our personal services and be able to utilize SAVE if we have to pay again for using SAVE. The amended FY26 regulatory compliance program, the statewide required additions, which these are the Rec Comp program, requests are adjusted to reflect the benefit rates. So these are benefit rates that we, this slide reflects that. Do you have any questions other than the wonderful ones you've already asked?
Commissioner McClendon, when did you become commissioner?
May 1st. Well, yeah, I think it was May 1st last year.
Well, I was wondering when you were starting out how everything had improved, and I was like, boy, Commissioner Spencer Moore is not going to be happy.
Oh, yes.
But I thought he did a pretty good job, but you took it even better.
He did an awesome job, and I calculated May is about 70% of last year. So I'll take credit for 70% of all of that.
You know, he was from my hometown, so
yeah,
we had a connection. But welcome, you did great. Things are going, look like the progress is continuing. What is your turnover rate now? Do you know?
The turnover rate, I would be 38%, 34.
I thought it was 34.
We'll go with 34%.
I hope it gets better and continues to get better, because that means it must have been a lot worse.
People are happy. So one of the reasons I try to visit so many locations is to see how people are doing and to see what their needs are as they are facing the public every day. So we can think we know what those are, but it's good to hear it from them themselves and actually observe what's going on, right? So I can observe that maybe this location needs another kiosk, instead of waiting on the team to have the nerve to say that, right? Because they have to get it all the way up to headquarters here in Conyers. So I'd rather go to them and see how things are going. And I feel like people in general are happy with what they do, and they take pride in what they do. I can tell that really from how they interact with the general public, that they really take pride in what they do.
Good, because I don't know many businesses that could run with a 34% turnover rate. So I hope it continues to improve.
Right.
Chairman Carpenter.
I couldn't let this go away unless Miss Leslie stands up, because she puts up with me all the time. I bother that poor lady. I must be the only person in the world that has license issues. Thank you so much for all your help. And if you haven't used a kiosk, I swear you're in and out in like 30 seconds. So it's a great addition. Appreciate you.
Right. And our team members, and I will say that is a testament to the frontline team members, because they really had to buy into it and to be able to send the customers to the kiosk. And so it works just like self-checkout. So if you have something simple, go to the kiosk. If you want to take 5 pictures of yourself, go to the kiosk, because we're not going to take 5 pictures of you at the counter.
And it took 6 for me.
Casey probably broke the machine. Senator Sims.
Thank you, Mr. Chairman. I just want to compliment the driver services in Americus, Georgia. I don't live there, but I didn't have my license. I didn't have my tag on my car. I was really going to jail, okay?
No.
But they didn't. When I went in, I said nothing about being a legislator, and they were awesome.
I love it.
And I told them afterwards that I appreciated the help that they provided me and how the customer service was just great.
That's great.
And I just want to give a shout out to those young folks that were working well in Americus, Georgia. And that's part of my district.
No, thank you. I love that. And I would encourage you, if you are visiting, now if it's an emergency, Miss Leslie's wonderful, right? But I would encourage you to do just that, to go in. Don't identify yourself as someone important, because they should be treating everyone with the same level of customer service. And that's really how we find out how the customer service is, if you're not famous to them. And so I would encourage people to do that, again, unless it's an emergency. Right.
Are you sure, Commissioner, you don't have pictures of these troubled lawmakers on the walls up there and say, if they come in, we're going to check
Well, I wrote Americus down, so I might be taking a trip to Americus. We'll see. I'll report back.
So, Commissioner, I have the same thing. We had as you know, we have foster children, and one turned 16, he got his driver's license. And that lady yelled at me to get off my cell phone just like I was any regular old person in that building.
What's her name? We need to give her a raise.
$2,500 for her.
She made sure that I knew that if I wanted to use the cell phone, I needed to leave. But I
Right.
say that to also say they were incredibly competent, fair. They treated everyone
Wonderful.
really the same. And
That's great. Great to
But
hear.
yes, ma'am, I know not to use my cell phone in your buildings anymore.
Now, where was that? Was that
It was
Reedsville?
seriously, she did the right thing. She did the absolute right thing. So, but it was great.
Well, thank you.
It was not in Vidalia. We don't have a
They
facility
do not
in
have.
Vidalia. We do
Since
not.
you said Vidalia.
It's
There
probably
is
Dublin.
not a
Probably
location. It's
Dublin.
currently not a location in Vidalia. There always could be, but there is currently not one.
You have to
There
go
is one
30
in
miles
Reedsville.
to get to one.
There
Yeah.
is one in Reedsville. And how far do you have to go, Senator?
About 30 miles.
30
But
miles.
you rural legislators understand that. I mean, it's
30 miles
but
to Reedsville.
they were incredibly competent, and they made that little 16-year-old guy feel extremely awesome. He did a good job.
Thank you for that. Thank you. Vidalia.
Thank you, Commissioner.
Thank you.
Nothing wrong with having a little laugh. Next up is Director Ali with the Georgia Public Defenders Council. All right. Welcome, Director Ali. Thank you, and the floor is yours.
That is a tough act to follow. I came in and I heard everyone laughing. I hope you're going to be laughing about the public defenders too. Good afternoon or good evening. My name is Omatayo Ali, Public Defenders for the state of Georgia. And I'm joined, and the reason why I say I hope you're going to be laughing about the public defenders is because when we tell you what we're doing about transformation to put our clients back in the communities because they're doing better, that's what I hope you're going to be happy about, not because they're going through the public defense system. So let me correct myself on that. I'm joined by DeAndre Berry, who is our Deputy Director, and Terry Rayford, who's the CFO, and Kenya, who's hiding right there, who's the manager for our social services, who's the one in charge of making sure that we have services that's putting our clients back in our communities and transformed. Just a little bit about myself. I have been a public defender for more than 35 years, a long time. And in those 35 years, we have struggled. What are we going to do to make a difference? Because wherever we are, we live in those communities as well. And our job is more than just representing people. And over the years, I think we got it. Today, as public defenders, we represent, we rehabilitate, and we restore. But it's been kind of difficult to get those things done because we didn't have what it took. But over the last few years, I just want to say thank you to the representatives who have worked very hard to make sure that we have what we need. Especially over the last summer, I don't see Chairman Gillette here, but I'm still going to do a shout out to him and all the members of the appropriation team on both sides who worked on the common pay plan for both the prosecutors and the public defenders. That was a game changer. And I would be remiss if I did not say thank you. In all my years as a public defender, I never thought I would see a day when we will have public defenders being considered so that we can actually deliver the job that the taxpayers have asked us to do. And our job is more than just being in the courtroom. When we leave the courtroom, we should always say to ourselves, then what? The what is making sure that we close the revolving door. And that's what you all did for us over the summer. And Chairman Hatchett, Senator Tillery, and all the other members who are not here, thank you for spending that time during the summer. Ms. Bogus, Ms. Smith, I see you all here. We spent a lot of time during the summer when the session was not even on to put a common pay plan together. And somebody is probably saying, what does that mean? It means that we have a defined budget. It means that finally we can retain our employees. Finally, we can provide better services to our clients. And finally, we can, it helps us to recruit in even difficult to staff places that we called, oh, Chairman Gillette is here. I just mentioned your name right before you came in. I was just talking about all your efforts during the summer, and I just said thank you. And I said the common pay plan that you worked on, I'm still saying thank you. I said thank you in July. I'm still saying thank you in January. Thank you so much for all your efforts. I'm grateful. And because of all your efforts and the efforts of your colleagues, we are able to recruit even in difficult to staff places that we call the legal deserts. We can stabilize our employee turnover. In the state, statutory attorneys right now, we only have 6%. It's never done before, and I credit that to your efforts. We can ensure that people who want to be public servants can actually do it. I remember when I first started as a public defender, I did have family support, but if I didn't know that I can shop in the Winn-Dixies and Piggly Wigglies of my neighborhood. I didn't know that I even made enough money to do that at that time. And the most important thing we can do now, we can raise the bar for effective, high-quality representation. We thank you. And the parity that you have enabled us to get, and I don't know if Representative Judge Gunter, I think I see you. Thank you so much. HB 1391, I will forever be grateful for that. It's unprecedented. It's never happened everywhere. It's happened in Georgia, and it's enabled us to recruit and retain. In the public defender's world, I never thought we would have that. Normally, I come here and I want to tell you all we have achieved over the last year. But today, I would be remiss if I did not just stop and just say thank you. I am full because even from last year, I'm still thinking as to how much we have been able to get. And so I just want to say thank you to all of you because today we can do that job that we have been called to do, to represent the least of these, but not just represent them in the courtroom, to step outside the courtroom so that Kenya can find them services in the community. And at any point in time when you see that we need services in your constituencies, give us a call. We will be there with services because that's what we're supposed to do. The return on your investment is going to be measurable because what we're going to do is that we will foster positive transformation for all our clients because our goal is to break the cycle of recidivism and return them as healthy and productive members of their communities. We will improve continuity of representation for clients, and there will be a system that better reflects the values of fairness, efficacy, and accountability. I just want to say thank you before I pass it on to Terry, our CFO, to do the needful by asking for what we need for next year. I am grateful. Thank you so much.
Thank you, Director Lee. Thank you, Chairman Tillery, Chairman Hatchett, and members of the General Assembly for the opportunity to present the Governor's recommended budget for Georgia Public Defenders. And we only have 2 programs, and the first one is Public Defender Council. It was added one-time salary supplement of $2,000. That comes at $135,000. For our second program, Public Defenders, of course, is the one-time salary supplement of $1.5 million. And also what was added was to offset the loss of ARPA funding for conflict cases for $5.5 million. We do have one additional ask, and that is for parity for the pay scale to start retroactively to January 1st, 2026 for parity with district attorneys. That's at a tune of $4.1 million. For FY27, for our first program, these are all statewide changes and adjustments. And for our second program, 1 through 4 is also statewide adjustments. And we do have, for number 5, an offset for the loss of ARPA funds at $6.2 million, and also to align our public defender salaries along with the district attorney salaries at $7.8 million. Any questions?
You got a couple of questions. I think they're going to come from Chairman Gullett. Gullett, I don't know if me and you will ask the same things. You want to go first?
You got it.
All right. Then. Thank you for your presentation. I got a couple of things. First of all, we've been very committed to keeping parity among the district attorney's offices and the public defender's offices. But one of the things I'm starting to fall back on and wonder now is, well, is parity the right thing? So the reason I bring that up is I know that every single case that's brought by the state is going to have to get defended by or prosecuted by the district attorney's office and the assistant district attorney. Clearly, you'll have private attorneys that enter into the public defender space. So I need to understand your case count. Does everything go into JCATs? Every case count you have? All case counts? And I'm sorry. Thanks for coming up and just stating your name so the rest of the folks know you and hear you.
Good afternoon. I am DeAndre Berry.
And you keep up with the data for, among other things, right?
Yes, sir.
So we're also making the juvenile courts, to an extent, move into JCAT so we can have a little bit more transparency there too. So this isn't us picking on you. We just need to understand the data of where things break down. I got this caseload summary. I know you've had some issues where you've hired conflict people, et cetera. How do I know, if I'm comparing apples to apples, how many cases each public defender has? Is there a way you can tell me that, or do you have that info with you?
I can pull that data and provide it to you, sir.
Okay.
But yes, sir, we have the ability to give you that data.
JCATS will help.
Yes, sir.
And I say that so that other people understand why we're asking people to put things either in JCATS or some other formula. It's not trying to micromanage you. We just need to be able to see the data later on. So juvenile court judges listening, hopefully they understand that too. Another thing that we do is we award judgeships based on case counts, and you know that. The way that we've moved with your conflict system kind of makes my circuit breakdown of public defender offices, I don't want to say skewed, but maybe that's the best word to use. You've got conflict and you've got obviously your circuit public defenders and then the assistants that come underneath it. Can we get a breakdown of what each circuit looks like? If there's employees per circuit and then of course if we've got cases per that, we can do the case counts accordingly. Would that be something that JCATS would show us as well, or something you can get for us?
We have the ability to break down the staff, not from JCATS, but from the state system.
From a statutory budget, we can pull the data together.
Do you mind? I can hear you, but I know that the folks listening or watching or hearing out there maybe can't.
So for statutory positions, say Alapaha has, 3 attorneys. You would like to see, from just a statutory standpoint, how many cases they have and how much each attorney has?
Well, the statutory matters to me, but also if you've done some other hiring with other funds, whether it be county funds, et cetera, it just helps us understand why we may have bottlenecks in certain areas as to others.
We could do that.
We're wanting to get a better grasp of that.
Yeah, we could do that. We could have state, county contract employees, this, conflict contractors. We could
Right.
do that for each circuit, what we have, and how many cases are assigned to that judicial circuit.
One other thing I'm going to wonder in that data is how many cases each conflict attorney has, because one thing we've heard from judges is I have multi-defendants in a case. I can't set a scheduling hearing because that attorney has 30 clients and they're in courtroom B and I need them in C. So again, we're trying to understand all of this. As you know, we worked through this entire summer. Chairman Gullett has really spent his entire summer. I appreciate his leadership on the, I won't call it a study committee. Is that my mic or, sorry, anyway, the working group and what's going on. But those are things I'd like to see too, and as we follow up on the work that we've already been working on through all of the summer. Chairman Gullett.
Yeah, thank you, Chairman, for your help this summer too. You came and spent as much time as I did on those. Director Ali, thank you. I do have a question just related to ARPA funds. How long have ARPA funds been used for conflict cases? Has it been really? How long have we been using ARPA funds on conflict cases?
It's been since 2022.
Okay, so 4 years.
Yes.
4 calendar years, I guess.
Yes.
Do you have any idea of how much total ARPA money that was on conflict cases?
Not right this minute, but we've allocated as much as we got to the conflict cases.
Okay.
I don't want to give you a ballpark figure that's not correct,
Okay.
but I can get it for you.
Yeah, that'd be great. Just because I'm trying to see if we have 4 years of ARPA funds, you're asking for $5 million now, or a little bit more than $5 million now for this to continue. And so I'm trying to see what the future holds for conflict cases from a money. If we're using ARPA funds, that was really to kind of get us out of COVID, but now it's costing the state now $5 million to kind of keep up with what was really a one-time funding mechanism for conflict cases. Related to the salary study, are there any the changes have kind of implemented? We're going to figure out how to get this thing funded from the parity with the DAs and the funding mechanism for salaries. But are there any APDs that make more than CPDs today, or make more than their CPD?
I don't believe so.
Okay.
I don't believe so.
Okay.
And the ones who are making out of the salary studies that we did during the summer,
right.
If it's beyond that range, what we're going to do is grandfather them. We don't anticipate cutting anyone's salary, but we are not going to increase. So what we'll do is redline, so that those salaries are not increasing until they attain a higher rate, a higher status rather.
Just over the next couple of days, if you can look and see if there's any APDs making more than CPDs.
We don't believe so, but if I go
Just
back and I
verify it,
see that, I'll let you know.
Okay, thank you.
And to say something about the conflict cases, the reason why we have the conflict cases is not attributed to us is because of the indictment. The cases that get indictment, if we get a 160 one single case indictment, we have to find 159 attorneys for those. But one thing we're doing, because of the concurrence that just came from the Supreme Court, we're working on a different kind of model that we think is going to make a difference in how we assign conflict cases. We are working with our CPDs, and I think we can come up with a different formula by the end of March. I have reached out to your, I will reach out to your office to discuss that as well.
Yeah, great.
So,
I appreciate that. And I think the Supreme Court is probably going to write rules and regs or regulations around that.
Yeah.
So thank you. I think that's going to be important, and I think it's ultimately going to hopefully drive down some costs associated to conflict cases, whatever those rules are.
We believe so. And we're working on that in a way that's going to actually make it better for us to represent our clients better, and at the same time reduce the cost to the taxpayers. So we're working on that with all the parties involved, and we will be in touch so that we can keep you informed as to how we're doing that.
Great. Thank you so much. Thanks for being here.
Yeah.
Chairman Gunner.
Thank you, Chairman. Okay, on your 7.8 million to align assistant public defender salaries to the assistant district attorney salaries.
Yes.
About a year ago, I guess, I was thinking that y'all were at 71,000 with your assistant public defenders, and the DAs were at around
58,
61 or 2,000. So this number doesn't make sense to me that you're asking for more money to align, because they weren't making as much as your folks. So that's what I'm asking. How did we get here?
So what we did at that point, Judge, is we looked at both the supplement and what the state was offering. So we went to the state allocation as well as the supplement, if there was one, from the county.
For the assistant
public defenders.
Okay.
So now we're doing what the prosecutors are doing, straight state salary.
All right, so that still doesn't make sense.
Yes.
Were you using the ARPA funds to pay the $71,000 payments?
No, sir.
Then I'm confused too. So,
No, sir.
can you walk us back through that one more time?
No, sir.
Well, our understanding last year was you were paying the public defender, I guess average, or maybe his actually set rate was starting rate was 71,000, which sent the prosecuting attorneys into a little bit of a nosedive, because they were like, hey, where's parity? So they brought us a proposal now to meet you, but the number on here is showing that you need more money to be at parity with them, that we thought we were moving them to parity with you at. So that's accurate, right?
Yeah, exactly.
Okay.
Yes.
So it was in 2023? 2023, we received 2 appropriations. And when we applied all of that, our first line, APD 1, went to 72. Not APD 2, not APD 3, not APD 4. It was nothing that we did. It was because we received 2 separate appropriations to increase retention and to increase retention and to improve hiring. Was that? Yeah. Those were the 2. And so when we applied those 2 appropriations that we got, the salaries of APD ones went to 72,000, with the exception of 3 or 4 employees. We didn't do anything to cost that. We did not start the salaries. It was just what happened when we got those 2 appropriations. What were the numbers, Terry? It was, do you remember?
Not offhand.
Okay.
It came to about $1 million, but we did use county funds and state funds to make sure that the employees were at 72.
So there were only 4 employees who did not make it up to that 72 when we applied those 2 appropriations. But it was only APD 1. And now we're doing it for APD 1, 2, 3, 4. And we're happy to be joining the prosecutors in the pay plan with steps. So when you heard that we were paying more, we truly were not. It was just appropriations that brought this APD 1 up to 72, not the 2nd, 3rd, and 4th levels. And that was caused by those 2 appropriations that we got that particular year. But now we have the same common pay plan. We're going from APD 1, APD 2, APD 3, realizing that our APD 2 that was not affected by that increase, now everybody is going up. I hope I can explain it.
Yeah, when you start, are you an APD 1 or an APD 4?
We just did APD 1 at that time.
No, if I was hired today, would I be an APD 1 or an APD 4? I'd be an APD 1, right?
APD 1.
So if they were at 71, you're saying your 2, 3s, and 4s were less?
They were, well, some of them had gone up to that. They were not affected. So we had sought money to get everybody up, but we did not receive the money at that time.
And so we'll go into it in subcommittee, I guess, to kind of get some more clarity. But Senator Representative Chokas, did you have a question?
Yes, thank you, Mr. Chairman.
Can
in the
I'm sorry.
Yes, ma'am. In the caseload, do you break down the caseload between first offenders and second and third offenders? Is there any way you could get us that information?
Say that again, sir.
Is there any way we could get the information on the offenders that you represent, if they're first-time offenders or they're multiple offenders? Is there any information on that?
Yes, sir. Our case management system can partially get that information. For the most part, it can't, but I can definitely provide you with what we can, what the system is able to do.
Thank you.
Yes, sir.
I think that would be very. I think that would be very interesting. Just know how many times you're seeing repeat people. I think that's what Representative Chokas is asking.
Okay, sir.
And how often. Any other questions? Thanks. We look forward to following up with subcommittee to maybe understand better. Thank you for being here today.
Yes, sir. And what I might be able to do is just send you some paperwork.
Okay.
Thank you, sir.
You want to go ahead, Mr. Hatchett? Our next presenters will be the Prosecuting Attorney's Council.
Director Scandalakis, we meet again. You're the last one today.
I ran into Chairman Powell outside a little bit earlier, and he said, keep it short.
Don't be careful repeating what he said. Go ahead.
Well, it's a pleasure to be here, Chairman Hatchett. I appreciate it. Thank you, Chairman Hatchett, Chairman Tillery, Chairman Gullett, my good Greek colleague over there, Representative Chokas, Chairman Chokas. Always a pleasure to be here. With me is District Attorney Herb Cranford. Herb is the budget chair for the DA's Association. He's also a council member. He will be presenting the budget for us today, and I'll be available to answer questions. Also with us is Chris Jones, our Chief Financial Officer, and Catherine Kemp, who's also in our financial department. We're all here to answer your questions. But I will turn it over to Herb, and I promise you we will be short.
Thank you, Pete. Thank you all for having us. This whole presentation is 14 slides, and I aim to move very quickly, okay? So this is the big budget ask. The number one priority for DAs this year is increasing elected DA pay. There are 51 DAs. Our request would put us at 88% of federal district judge pay as compared to Superior Court judges. Last year, y'all moved to 90% of federal district court judge pay. If we got funded fully at 88%, the salary would be that 196 number. Our reasons for that are twofold primarily. One, all the states that touch Georgia paid elected DAs more than the state of Georgia. So currently elected DAs state pay is at a little over $132,000. The next closest is North Carolina at $167,000, and it goes up all the way to Florida to over $218,000. Second, y'all really helped us out last year by increasing state ADA pay. We moved the floor for a new ADA from like $64,000 to $72,000. We moved the ceiling for a state paid ADA from like $125,000 to $134,000. The result was there are now 83 state paid assistant DAs in the state of Georgia who are making more than their elected DA. So out of 400 something state paid ADAs in the state of Georgia, 83 are at the top of the pay scale making more than their elected DA. For assistant DAs, we are asking at very least for a step increase, just so they, the people that stick with us, the people that try the most serious cases in our offices, that they're still getting a merit increase every year. Those are the people that have committed their career to prosecution, and we want to reward them for that, obviously. Year 2 of the competitive plan, to skip forward to show you that, in fiscal year 2025, starting ADA pay was at 60. The top of the scale was at 125. What y'all did last year is that FY26 year 1 of this 3-year plan. We now start state-funded ADAs at 72,000, and they max out at 134. Year 2 of this plan, if you chose to do that this year, would be starting salaries at 78,000, and it would max out at 157 at the top of the scale. So again, we're asking for 2 things for ADAs. There are 437 state-paid ADAs in the state of Georgia, a step increase, and if you're willing to also give us year 2 of that 3-year plan. Keep in mind, helping out state-funded ADAs disproportionately helps the smaller offices. There are some DAs in the state of Georgia that get no county funding. They get no county-paid assistant DAs. Their office is entirely dependent on what the state of Georgia will do for their offices. My office, I'm in Coweta County, LaGrange, Meriwether. I'm kind of in the middle. About half of my state-funded ADAs are funded by my counties. The other half are funded by the state of Georgia. But I think it's worth noting there are multiple offices that are very dependent on what the state of Georgia does. Vacancy trends, going back to July 2022, out of those 437 state-paid ADAs, we've been over 30 vacancies statewide going back to early 2023, and we remain over 30. Roughly, 9 to 10% roughly of our state ADAs have been vacant for the last few years. ADA turnover, you can see 2017, 18, 19, and 20, it was in the teens as a percentage. Since 2020, it's remained over 20% as a percentage, and unfortunately, since 23 has ticked up the last 3 years. So we've still got a turnover issue. Just to give you an example, I've got 6 assistant DA positions in Troup County. Since 2023, I've lost 9 assistant DAs in that one county. And I presented that to my commission and city council recently. So a lot of offices are experiencing that kind of turnover. And every new person you got to train and get them up to speed before you can give them a case that anybody in the community's going to care about, right? So it's a real problem, this kind of turnover. This is where we're at. Out of the 437 assistant DAs, only 25, when we pulled these numbers recently, were brand new out of law school. 245 out of 437 are in our class 4. That's the top class. So we're struggling to get new people in and keep them. And thankfully, we've got a lot of career prosecutors, but we're hollowing out in that middle zone. And that's what our 3-year plan is really meant to address. We can tell somebody, if you start with me out of law school, in 10 years, you'll be making, over $100,000, for example, right? The career prosecutors handle murders, sex crimes, crimes against children. Those are really the most important prosecutors in our offices. Next, we're kind of moving into the PAC program budget. We split the Coweta circuit a couple years ago. The new circuit is Carroll and Heard County, the West Georgia circuit. PAC has been using funding to cover the investigator, victim advocate, and legal assistant positions, and we're just looking for full funding for those administrative, non-lawyer positions. The total budget need for those 4 positions is right under $500,000. The conflict case program was started a few years ago. I think after 2020, there was a lot of turnover among DAs as a result of elections. When a private lawyer becomes DA, they're conflicted from prosecuting a lot of cases in their circuit. We started the conflict program as a separate program with the idea that it would go away. Once we handled all those conflicts, then we wouldn't need those conflict prosecutors at PAC. Keep in mind, the Attorney General's office used to handle conflicts in the state of Georgia. For reasons that I couldn't tell you the answer, conflicts have stayed high. We continue to receive a lot of conflicts. PAC does. One thing to keep in mind, PAC can't scrutinize an elected DA who says, I have a conflict. The law doesn't allow PAC to say, no, you don't. So they have to accept all these conflicts. PAC is handling over 50% of the cases conflicted by elected DAs. The other 46% or so are handled by other DA's offices. And you know, if I pick up a conflict, I've got to send an ADA to another county. That means they can't handle cases in our county. So I really appreciate the fact that PAC is now able to handle in-house conflicts. So part of our ask is to move what was a separate program into the PAC program. And we're asking for a step for those conflict prosecutors. And if ADAs get year 2 of the 3-year plan, we'd like that to apply to the prosecutors at PAC as well. And this is what I was talking about, moving the program over to the PAC program. There would be a little bit of savings here. And Chris is at the $200,000 that we would reduce our current budget allocation by. This is what I was talking about. There were 512 conflicts referred in 2025 compared to 215 in 2024. PAC handles a majority of those. And that was my best effort to move through that quickly. We're all happy to take any questions if y'all have any. I know we're last, but.
Thank you. Chairman Gullett.
Thank you. I have a couple of questions. One on the 3-year retention. So the ask is for elected DAs for pay increase 88%. And I want to get there. But when I see the numbers continue to trickle up on 25%, I guess, you know, 24, year 2024, 2025, and your 3-year plan, retention plan is going to get hit. I think that was, I mean, I know we've had conversations, hey, it's, both can't happen, right? It makes me struggle to say, you know, you're saying retention is a problem, and it's clearly a problem. But I don't know how fixing the elected DA pay is going to help with retention. I know we got to balance, we got to walk and chew gum at the same time. But 25% is really, it's not sustainable, I don't think, to the DA programs. And so, what would you say to that, I guess, as far as, you know, electeds, as an elected, we know what we're getting into. And I said this for the judges too. We know what our pay was. And yes, you know, judges got their pay raise. We do need to figure this out, but it's a difficult ask at the moment to me to say electeds need it, but we have a 25% retention rate, and this is a problem too. So do you have a, it's a hard question, but any quick response on it?
I mean, my take on that is, I think it is two problems. Both need to be solved in my view. That's why when we had those discussions with you and other appropriators, I guess, more than a year ago, we said, look, we're not trying to keep up with the judges, this year. Our priority is our assistant DAs getting this first year implemented. That took effect in January of 25. So I at least can speak for of 26. I mean, so it just took effect in 26. So at least speaking for the conversations I've had with the ADAs in my office, that just hit their pocketbooks. They're very thankful. I'm transparent with them about the fact that I and DAs are prioritizing elected DA pay over year 2 of the year 3 plan this fiscal year, and they understand that. And at least in my office, they're supportive of that, in part because they know we're committed to years 2 and 3 in the plan. And I would like to think that year 2 of the plan would totally fix the turnover problem. I don't know that it will. I think it really is that 3-year plan, and I would love for that to take place in 3 years in a row. I understand that may not. If we can get there in 5 years, that's better than not getting there at all. And so it's not a fun choice to make, but last year we prioritized the ADAs, and just candidly this year we're prioritizing elected DA pay. If we got year 2 for ADAs, I think top of the scale they'd be at 150, if I recall correctly, from the slide, and so elected DAs would be that much more underwater, from their assistance.
Locality pay or locality cap with the idea. Tell me a little bit.
Sure. Yeah. So our thinking on proposing a DA pay bill was to essentially follow the framework that the judges used. They got 90% of federal district court judge pay, that paid from 2022. So we're asking to get no more than 88%. Understanding we may not get that fully funded, right? We are proposing we increase the retirement age. I think, everybody would love to keep it at 60 or 62. I understand that it's likely to be moved to 65 where the judges are, just to be candid. We've also proposed the same cap on county supplement pay, what's called locality pay. I believe the judges were capped at 10%, and if the funding we got was substantially lower than 88%, that could create a problem. But if we're relatively close to where the judges end up, we're proposing a 10% cap just like the judges got.
Sure. Are there currently any ADAs making more than a DA?
Assistant DA is making more than the elected DA? Yeah. Yes. That.
In the same circuit?
Yes.
Okay.
Yeah. There are some circuits that get no county funding that have, an ADA or 2 at least that are at the top of that scale, making more than the elected DA.
Chairman Gullett, we got other questions.
Oh, hurry up. One more question. This is per diem pay. So with DAs who have, I guess, presumably more than one county in their circuit, do they get per diem pay, or do they get mileage going between, and do the ADAs get that as well?
ADAs, as I understand it, you have a home office, and if you travel from your home to a different office and that commute is longer than it is to your home office, you would get mileage for the excess. Your other question was about do DAs get? Yeah. Speaking for myself, if I go to any of my 3 counties, or before the split, if I was going to any of my 5 counties, I'm lucky enough to have a state vehicle, so I wasn't asking for mileage. There may be DAs that don't have a state vehicle that seek reimbursements. I would imagine the same rule applies to them. They've got a primary office for which they would not get mileage, but if they travel further than their primary office, as I understand the law, they could get mileage for that.
Chairman Chokus.
The question I have is the same one I asked for the public defenders. Do you have any numbers on your recidivism, on the number of prosecutions y'all have that are repeat offenders?
I don't know, a lot of prosecutors in Georgia use a case management system called Tracker that was made for prosecutors. The Prosecuting Attorneys Council helped develop that software. We can run a lot of reports that give us good data on different things. I don't know that we currently have that software where it can run a report on recidivism, but as I heard you ask that question, I wondered, is that something we could develop? The names are the same, right? So it seems like that's something we could do. I'm not a tech guru like Chairman Gullett here, but I think that's something we could look into and try to do.
Chairman Gunner.
Thank you, Mr. Chairman. Okay, so I feel like I've been asleep for a year.
Sorry about that.
Can you catch me up on the changes in the step system? Because apparently y'all gone from a 4 or 5 step system to a 3-step. Is that right? Or how does that work?
Yeah, Chris would be the best to talk to that, but my quick understanding is there are 4 classes. Once somebody gets through steps 1, 2, 3, and 4 for each class, they graduate to the next class. Except class 4 has multiple steps that once you're into class 4 and you stay a prosecutor, you just keep going up. So when we increased state pay, the top of the scale from 125 to 134, at 125, the most you could get was class 4, step 8. At 134, if I'm looking at this graph right, it increased a step or 2. 1 step, I guess, yeah. So now you can get step 9.
This is the same scale that y'all had
for a long time.
For a long time, okay. Okay, just curious.
Yep.
Representative Holcomb.
Thank you, Mr. Chairman. I don't understand the conflicts problem that you're raising. Is it an actual conflicts problem, or are people just declining working on cases? Like, what's going on here? This doesn't make a lot of sense to me.
Yeah, for whatever reason, the last few years, there have been more cases conflicted than our understanding of how many cases were conflicted historically. One thing to keep in mind is these conflicts also include conflicts from solicitor generals and part-time solicitors. So a lot of counties have a part-time solicitor that also has a local law practice, and again, they could feel like they have a conflict for a lot of different reasons, and PAC legally can't question that. Typically, conflicts would jump after election years because there's new elected prosecutors, solicitors, or DAs. They had a private practice. They obviously can't prosecute somebody they represented. So historically, they were used to the bumps in the years after elections. For whatever reason, that increase the last few years has stayed up there.
Well, it depends on what you represent the person for. So that you can potentially be adverse to a prior client if it's a different action. If it's something where you learned information that's related to that subsequent issue, then you clearly would be conflicted. But there are situations where it's a totally different subject matter, totally different, it's not automatic or as simple as you represented somebody, so you're automatically out.
I agree, and if the implicit suggestion is that it might be helpful to have rules about what is a conflict and what isn't, I would agree with that. But right now, as the elected DA, I could call Pete tomorrow and say, I have a conflict on these 200 cases, and he'd have to say, okay, I'll figure out somebody to handle them. And I wouldn't even have to say why I think I had a conflict. And typically, I don't think people do. They just say I have a conflict. But I agree with the point you're making. like ethically, yeah.
I have a conflict for the rest of this session. Thank you.
Representative Evans.
Thank you, Mr. Chairman. One quick prefatory question. We're in year 1 of a 3-year pay step up for the ADAs, is that right? We've
Yes,
only done
ma'am.
1 year of 3, okay. And then one other prefatory question. Y'all's budget that you're presenting here today, this is your presentation. The governor doesn't weigh in on your budget because of the separation of powers, true?
That's correct.
Okay. I heard a couple of things I heard. I'm going to repeat. And you can tell me if I heard them right or wrong, and I just want you to comment on them.
Sure.
We have every elected DA position is filled. True.
Every elected, yes.
Every
Yeah.
elected. But we have a problem retaining assistant DAs, right?
Correct.
At crucial levels in some areas, right?
Yeah, I would say particularly rural areas, yeah.
I assume we have shared with the ADAs the presentation of the step up over 3 years, and while they know it's at the discretion of the legislature, they would assume, I think, that their elected DAs and that PAC is going to advocate for the rest of those steps. I think that would be a fair assumption, don't you?
Yes, like steps 2 and 3.
Correct. But you're down here asking us to jump off the 1, 2, 3 in favor of a pay raise to elected DAs where we don't have vacancies, but we do have vacancies of ADAs. I'm trying to understand how that's responsible for leaders of offices that are responsible for making sure that bad guys aren't on the street, and how it's responsible to ask us to prioritize that when we know we've got these vacancies.
Yeah, well, to be clear, we're asking for both. Chairman Gullett asked me, you know.
But if you had to
pick one or the
prioritize,
other.
which one are you picking?
Yeah, if the DAs, on behalf of the DAs that voted, and I personally agree with this, like I said, I've spoken to my office about it, and they support it. This year, if we're asked to prioritize one over the other, it would be elected DA pay. And we continue to want ADA pay, whether that be one step or a step and year 2 of the 3-year plan.
And
Yeah.
are the ADAs in other offices aware that their PAC council and their bosses are down here advocating for us to choose them over the ADAs if a choice is required? I understand you want both, but when
Yeah.
we ask you, if push comes to shove, if we can only give you one, which one do you want? That's the message.
I don't know what other DAs have said or not said to their offices. I know what I've communicated to my office. And I would say, like I said earlier, I guess this month, at the end of the month, all those ADAs are going to get the substantial increase that this legislature gave last year, right? So I think they're very appreciative of what y'all did for them, and I think they understand the leaders of their offices. You know, they all want a good boss too, right? And I think they understand, at least the ones I talk to, I imagine a lot of ADAs understand, having the position of your boss being the lowest paid elected DA in the Southeast just isn't a good thing. And so I do think, yeah, they would definitely like step 2. They would definitely like more money, don't get me wrong. That would help the turnover problem. But elected DA pay is a problem as well. And it's not just, yeah, it's in my personal financial interest, don't get me wrong, but as a policy matter, I think this is a legitimate issue, being this much lower paid than other states.
Perhaps when we have our subcommittee hearings, we could have some ADAs come in. I would be very interested to know if surveys have been taken across other offices and how those ADAs feel, and even more so, perhaps other members of the criminal justice system, about how the system doesn't work when we don't have ADAs, and that I want somebody to tell me why not filling those positions is not the priority over raising DA pay. That would be good for subcommittee. One other question, if I might, Mr. Chairman, on a different subject. ARPA money is running out. How are y'all filling in those gaps?
Yes, I'm glad you asked that, this occurred to me during the prior presentation as well. I noticed they were asking for ARPA funds. As I understand it, the Public Defender Standards Council was given ARPA money directly. DAs, to the extent we got ARPA money, it went through AOC and was subject to the decisions of our chief judge. So early on in the ARPA process, before our circuit split, my office got no ARPA money for those first 2 or 3 years. Now we've got a circuit split, and I've got a different chief judge. The last year and this year, I have gotten ARPA money to fund one ADA. I can tell you, we've had no discussions, maybe we're dumb or something, but we've had no discussions about coming to the legislature to ask for y'all to cover our ARPA allocations. My understanding is I've got to go to my county to do that, and I intend to do that, just so you know. But I haven't had a single discussion with a single DA that we expect the legislature to pick up ARPA dollars. Thank you.
Looks like that's all the prosecuting you get today.
All right. Thank you all.
Thank you all very much. Y'all, we are finished. We start back up at 8 in the morning. Just in case some of you haven't seen the speaker, and I don't know if the Senate is addressed or not, but Monday we will not have to be here, but the speaker is going to gavel in, so it counts as a day, but we will not be expected to be here Monday. But be here tomorrow. Thank you.